Di nagtatapos sa 4 na sulok ng kwartong ito ang kwentong tapos ng pag-aaral, magsasaya, at higit sa lahat, mag-atop sa board exam. Dahil sa top rank, pamilya kami.
So always remember, ang dami yung opportunities. Okay? What we offer in Asian is, you tell us what to do, and we will make it happen for you.
Don't ever let somebody tell you that you can't do something. Not even me. You gotta dream. You gotta protect it. You want something, go get it. Here.
Be confident. You have that knowledge. Later on, ang tanging hihilingin mo na lang ay enlightenment.
Okay, right. So, hindi ba siya naka-record? Thank you, Ma'am Bell. Okay. So, ayan. As what I said kanina, huwag kayong ma-confused. Okay? Tanda mo palagi, basta board exam, book-based ka lang. Okay? Kasi I know, some of you, mga babae, siguro may mga kaibigan kayo or mga nanay or mga kapatid. For some doctors kasi, they encourage the woman to do the fetal movement count before sleeping or at bedtime. Bakit po pagkahiga ng mother, before matulog, magbilang ng fetal movement count for 1 hour? That is okay for the convenience of the woman. But again, ideally, it must be done early morning when the mother is rested. Okay, so I would like to make myself clear on that one. Okay, early morning, book-based Sandowski method. Okay, next question, guys. Fetal movement count. When is the best time to perform fetal movement count? Before meals or after meals? Again, before meals or after meals? What will be the answer of our registered nurses? Before or after meals? Okay, what some of you said after. After, most of you now are telling me after, some are saying before. Okay, some are saying before, some are answering me after. Guys, the correct answer, please take note, that should always be after meals. Again, there will be after meals. Sir, bakit po after meals ang best time to do the fetal movement count? Dahil mataas ang glucose ni mother, therefore mataas din yung glucose ni baby, merong energy yung bata upang gumalaw-galaw. Yes or no? Yes po. Siyempre, pag walang glucose, baka nanghihina si baby, hindi talaga yan gagalaw. Yes or no? Yes po yan, guys. Kailangan din ba ni baby ng oxygen para gumalaw-galaw siya? Siyempre. And Ginner says, bingo, how are we now going to ensure that the baby is receiving adequate oxygen coming from the placenta by preventing compression of the left or inferior vena cava? Okay, very good everyone. Again, ang mahiwaga, ang mapaghimalang, ang namamayagpag, left side lying position. Yes or no? Yes po. Bakit po left side lying? Again, to prevent compression of the vena cava, ensuring adequate blood passing to the placenta, ensuring adequate oxygen to the baby. Maliwanag po tayo. Okay? It must be done same time each day, maximum of 2 attempts. Like for example, pag kulang for example yung nabilang mo in an hour, you could repeat the procedure for another hour. Pag kulang pa rin, that is when we're going to report it to the physician or perform other possible diagnostic test. Maximum of 2 attempts. Sir, ano po bang normal fetal movement count namin? Bingo! That is 10 movements per hour. Actually, 10 to 12 movements per hour. Yes or no? Yes po. Again, 10 to 12 movements per hour. 10 to 12 movements per hour po. But this is for Sandowski method. Yes or no? Again, not sure, sorry. Sandowski method, 10 to 12 movements per hour. Kaya ang problema ngayon, guys, for example, yung babae ngayon, nagtatrabaho, madaming ginagawa, busy sa buhay, yes or no? Yes po. At hindi naman siya merong time palagi ng 1 oras upang humiga ng left side upang magbilang ng galaw ng kanyang anak. Another alternate method will be your Cardiff method, guys. Ano ngayon yung Cardiff method, Sir Ken? Ito ngayon sa mga working professionals. This is now the normal fetal movement daw po, according to Cardiff method, that is now 10 movements in 12 hours. Another term for Cardiff method, guys, is count 10 to 12. Again, count 10 in the normal Cardiff method, the normal fetal movement count is you call this one as your count to 10. Count to 10 method. Okay? And the normal for this one, guys, that will be 10 movements in 12 hours. Again, 10 movements in 12 hours. Okay, sir, paano ngayon yung 10 movements in 12 hours? You don't need to lie down for 1 hour. Parang ganun siya. Okay, ang mangyari ngayon, guys, for example, nagising yung babae. Habang kumakain ng breakfast, ay, gumalaw yung bata. Record it as 1 fetal movement. Habang, for example, ngayon, papunta ng trabaho, sumakay, for example, ng MRT. Yung nasa MRT ngayon, nakaupo siya, biglang gumalaw yung bata, ay, second movement for the 12 hours. Okay. Dumating, for example, sa office, habang siya nagtatrabaho, biglang gumalaw. O, nagtatlong movement na. Tapos nag-lunch, for example, habang kumakain ng lunch, gumalaw yung bata, naka-4 na movement na. Dapat magkaroon ng 10 movements in 12 hours. Yes or no? That will now be your Cardiff method. So Sandowski, 10 to 12 movements in 1 hour. Cardiff method is 10 movements in 12 hours. Maliwanag po. So don't be confused with your Sandowski and with your Cardiff method. Alright? Sige po, guys. Copyhin mo, screenshot mo, ililipat ko in 5, 4, 3, 2, and 1. Again ha? Sandowski, 10 to 12 movements in 1 hour. Cardiff method, 10 movements in 12 hours. Don't be confused, okay? Very good. Moving forward, let's have the next topic. May pasok daw pala si Sir Narciso kahapon. Ayan. Okay lang, baby. Naiintindihan ko. Ikaw naman kasi di ka nagpaalam sa akin. Magpaalam ka pag umalis ka. Okay? Yung iba na may pasok, okay lang po kayong umalis nang walang paalam. I understand. Yes or no? Yes po. But Mr. Narciso, I demand. Ikaw lang ang kailangang magpaalam sa akin. Okay? I need to know all your whereabouts. Maliwanag, Mr. Narciso. Okay? Sige. Sir, jowa ko po yan si Narciso, sabi nung isa. Sir, pwede po may screenshot yung slide po? Ayoko nga. Okay. Hindi, okay lang po, ma'am. Sige po, screenshot nyo na po. Screenshot nyo na po. Ililipat ko na po in 5, 4, 3, 2, and 1. Okay? Very good. Number 2. let's have the principles and the equipments used naman po. Okay, guys, bingo. Another big star in the board exam. Hindi po nawawala. With a big star, bingo, Doppler. When is the earliest time in pregnancy that we could use your Doppler? Please take note. That will be on the 8th month of your pregnancy. Oh, sorry, 8 weeks of your pregnancy. Wait lang, may nag-chat. Ano yung sinabi sa akin? Sir, may duty po kami mamayang 3 to 11. Baka di po matig. Okay lang po, ma'am. Walang problema. Your post test, guys, I guess, please coordinate na lang po. I don't know kung ilang oras mapupush yung post test ninyo, but you have time naman po to take the post test anytime pag meron po kayong work, okay? Ayan, yung mga yupang naka-duty pa pala. Oh, guys, ingat sa duty, ha? Okay, ngayon. Again, I would like to clarify one thing again, nurses. If you are going to check, nurses, the book of Piliteri ngayon, actually, ang ginagamit pa rin ni Piliteri, 10 weeks for Doppler. Yes or no? Yes po. But remember guys kasi, again, there is advancement in technology. Yes or no? Yes po. If you are going, for example, to do your own research, guys, and check for other references, there are already references po, and there are already brands of Dopplers that can be used as early as 8th week of your pregnancy. Bakit po? Mas high-tech na, ibig sabihin mas malakas na, mas maganda na yung quality. Yes or no? Yes po. So for this one, let me just use at 8 weeks. Pero pag walang 8th week, you can answer 10th week of your pregnancy. Maliwanag po. But again, the idea is earliest time. Yes or no? 8th week. Pero pag fetoscope, nurses, this will be your fetoscope anyway. Ayan. So guys, take a look at the screen. Ito po yung Doppler ninyo. Yung Doppler ninyo, nurses, meron po yung speaker. Okay, you are just going to apply the transducer in the abdomen of the woman and the sound will be amplified. So napapalakas po yung sound, alright? Well, this will be your fetoscope. Para siya yung stethoscope pero mas maiksi lang siya tapos gaganin mo siya. That will be your fetoscope. And when will now be, guys, the earliest time that we could use your fetoscope, that will now be naman po, nurses, only on the 12th week of your pregnancy. Again, 12th week of your pregnancy naman po. Okay? While stethoscope, that will now be on the 16th week of your pregnancy. Okay? Again, but again, I would like you to remember, bingo, sige po, lagyan mo ng konting star na maliit. When is the earliest time that we could monitor the fetal heart rate? You answer on the 8th week of your pregnancy. Yes or no? Yes po. Maliwanag ba tayo? Check. Okay? Bingo. Next po tayo. Alright. Guys, diretso po tayo. Nurses, ano ulit yung embryonic stage of development po natin? When is our embryonic stage of development? Ilang weeks po? 5 to 8 weeks of your pregnancy. Yes or no? Yes po. Okay? Very good, everyone. Sige. How are we going to promote bonding? Let the parents listen to the fetal heart rate. And what will be, sir, can the normal fetal heart rate? Bingo. Another very, very big star, guys. Gawin mong parol kasi Pasko ngayon. Very good, ma'am. That is 120 to 160 beats per minute. Again, tap na church. What is the normal fetal heart rate? That will be 120 to 160 beats per minute. Guys, tip in the board exam, tip in the board exam. Tandaan niyo po to, ha? Again, tandaan mo to. Huwag kang malito. Any situation wherein the fetal heart rate is less than 120 or more than 160. Ulitin ko po. Any situation wherein the fetal heart rate is less than 120 or more than 160. At tinanong ko ng board examiner, ano ang appropriate nursing intervention? Ang sagot lang po dito, notify the physician. No, notify the physician or the MD. Maliwanag po, huwag ka nang humanap ng ibang sagot because any condition wherein the fetal heart rate is less than 120 or more than 160, that is already indicative of your fetal distress. And if there is fetal distress, you need to immediately notify the physician because the physician will only be the one to decide on how to manage the condition. If there is already a need, for example, to immediately deliver the baby. Paliwanag po tayo dyan. Okay? Sige po, guys. Copyhin mo. Copyhin mo po. Screenshot mo. Screenshot mo. Ililipat po natin. Ililipat po natin in 5, 4, 3, 2, and 1. Okay? Sige po. Very good. Moving forward. Diretso po tayo. Warahin ka na, ha? Okay, go. Okay na? Sige, one more time. 5, 4, 3, 2, and 1. Okay na po? Okay. Sige guys. Let's have now your fetal heart tone monitoring. Now, remember guys, in fetal heart tone monitoring, we have what we call as your non-stress test. We also have what we call as your contraction stress test. Okay, if we say non-stress test, nurses, this is now checking for the fetal heart rate in response, again, checking for the fetal heart rate in response to fetal movement. Again, checking of the fetal heart rate in response to fetal movement. All right. Now, there are two possible results. Okay. Reactive or non-reactive. Question, guys. In non-stress test, what is considered a normal result? Reactive or non-reactive result? Okay. Correct answer. What is considered normal? Okay, very good, everyone. The correct answer, that will be a reactive result. And guys, again, remember, reactive result is considered as a normal result. Bakit po? The heart is responding to the fetal movement. And Sir Ken, when do we say now that the result is reactive or normal? When there is an increase in the fetal heart rate of 15 beats per minute for 15 seconds, 2 episodes in 20-minute period. Yes or no? Ibig sabihin, nung gumalaw yung bata, biglang tumaas yung kanyang heart rate ng 15 beats per minute, that is a reactive result. Bakit po? Sa normal, for example tayo guys, pag tayo naglakad, pag tayo for example tumakbo, napagod or gumalaw, tumataas yung heart rate natin. And that is a normal compensatory mechanism. Yes or no? Yes po. And that is also normal for the baby. It is normal for the baby that the fetal heart rate should respond to the fetal movement by increasing the heart rate when the fetus moves. And guys, an increase in the fetal heart rate is what we call as your fetal heart rate acceleration. Bumibilis. Yes or no? Yes po. But, for example, gumalaw yung bata, pero hindi tumaas yung kanyang heart rate. That is now your non-reactive result. Ibig sabihin, hindi nagre-react yung kanyang puso doon sa kanyang paggalaw. Ibig sabihin, the heart doesn't have the ability to compensate in case, for example, magkaroon ng problema. Yes or no? There is no fetal heart rate acceleration or it is just less than 15 beats per minute and it is considered abnormal. Maliwanag ba tayo dyan? Okay? Very good. Now, once, for example now, that the result is non-reactive, top-notchers, what will happen? The physician could order another test and that will be your contraction stress test. Sir, ano naman po ngayon yung aming contraction stress test? This is now checking nurses the fetal heart rate in response naman po, in response to your uterine contractions. Okay guys, I hope everyone has a copy of the handout po para hindi kayo mahirapang humabol sa akin. Yes or no? So that you don't need to write everything na, okay? The fetal heart rate in response to your uterine contractions. Okay. Bingo, guys. For this one naman, let's make it madali for everyone. Okay? Nurses, sige po. Ito tandaan mo ha, for your contraction stress test. Sir, what is now the normal result for a contraction stress test? Bingo, letter N. Top-notchers, tandaan nyo na po. A normal result for your contraction stress test is a negative result. Again, it says a normal result. Very good, everyone. A normal result for your contraction stress test is a negative result, meaning to say, nurses, there is no decrease in the fetal heart rate or what we call as your deceleration. Yes or no? Yes. Again, there is no decrease in the fetal heart rate or what we call as your fetal heart rate deceleration. Yes or no? Yes po. Pag acceleration, bumibilis. Pag deceleration, bumabagal. Ibig sabihin guys, ano po yung normal sa contraction stress test? Pag nag-contract ang uterus, dapat hindi magbago yung heart rate ng bata. There is no decrease in the FHR, there is no deceleration, hindi bumagsak nung nag-contract, normal negative result. Pero for example, pag nag-contract ang uterus mo, for example, at biglang bumagsak yung heart rate ng baby, that will now be a abnormal result, a positive result. Yes or no? Yes po. So again, the normal is a negative result wherein there is no decrease in the fetal heart rate in response to your uterine contractions. Maliwanag po tayo dyan. Okay? Sige po. Guys, magdagdag lang ako ha. Go. Kompletuhin natin. What if for example, nakita mo sa board exam? Ito for example yung sinabi sa board. Okay. Lang ha. Saan ba ako magsusulat? Sige, sa taas na lang. Ano ba yan? Wala na ako ng space to write. Okay. For example, nakita mo to nurses. Sabi doon, there is episodic fetal heart accelerations po. Again, nurses. For example, nakita mo doon, there is episodic fetal heart acceleration. Question guys, is this normal or abnormal po? Again, is this normal or abnormal? Ano pong sagot ng ating mga registered nurses? Episodic fetal heart rate acceleration. Normal or abnormal? Okay. All right, very good. The correct answer guys, this is now normal. Yes or no? Again guys, this is totally normal. Bakit po nagkaroon Sir Ken ng episodic fetal heart rate acceleration? Dahil yung bata bigla-biglang gumagalaw. Yes or no? Yes po, therefore. Pag bigla-bigla nurses ngayon na gumagalaw yung bata, therefore, bigla-bigla din na tumataas yung heart rate ni baby. Yes or no? Yes po. Baliwanag po tayo dyan. Okay? Sige po. Alright. Moving forward guys. Moving forward, screenshot mo po. Screenshot mo. Ililipat po natin. Ililipat po natin in 5, 4, 3, 2, and 1. Okay? Sige po. Okay. Now, tandaan mo naman guys, hindi naman po lahat ng decelerations ay abnormal. Yes or no? Yes po. There is such thing nurses ngayon na what we call as your early, late, and your variable deceleration. Yes or no? Yes po. Okay, sige po. Copyin mo. Copyin mo, screenshot mo. Ililipat po natin. Ililipat po natin in 5, 4, 3, 2, and 1. Okay? Go. Sir, normal lang po ba na tumaas yung heart rate ng baby during contraction stress test? That is okay naman po. Wala naman po problema dyan. Yung pagtaas ng heart rate that will now be brought by the fetal movement po natin. Okay? Sige po. Go. Sige. So anyway, mamaya balikan po natin lahat ha para ma-refresh, para ma-recall lahat, para hindi makalimutan. Okay. So again, hindi naman lahat ng decelerations are considered abnormal. But again, a negative result is a normal result wherein there is no decrease in the fetal heart rate. Okay. Now, we have what we call guys as your early deceleration. Sir, ano po ba yung early decelerations po namin? Early. It occurs during the onset of your contraction. Okay, nung pa-start po yung contraction ng uterus, biglang bumagsak yung heart rate ni baby. Sir, bakit po nangyayari yon? Okay. The cause, nurses, of your early decelerations, again, nurses, take note, the cause of your early deceleration is your fetal head compression. Again, early decelerations is caused by your fetal head compression. Okay. Remember guys, in your head, andyan yung mga cranial nerves mo. Yes or no? Yes po. Ano po nangyari dito, Sir Ken? Pag nag-contract, for example, ang uterus, again, pag nag-contract, for example, ang uterus, at naipit yung ulo ng bata, anong mangyari? The head compression now will cause vagal stimulation. Vagal stimulation. Sir, ano po ba yung vagal stimulation? Stimulation of the cranial nerve number 10. Yes or no? Or your vagus nerve. Pag naipit yung ulo mo, na-stimulate yung vagus nerve mo, cranial nerve number 10, anong mangyayari? Bavagal ang tibok ng puso mo. Don't forget that one ha. Cranial nerve number 10, vagus nerve, pag na-stimulate, nagkakaroon ng vagal stimulation, bumabagal ang tibok ng puso. Again, vagal stimulation, bumabagal ang tibok ng puso. Therefore, what will happen? Magdi-decrease po yung heart rate ni mother. Yes or no? Yes po, sir. Yung decelerations po na ito ay expected lang po ba during labor ng mom? Yes po. Actually, we can perform this one while the woman, for example, is labor. Or another reason, guys, is why do we perform, for example, your fetal heart rate monitoring? Like, for example, yung kanina, di ba we started with your fetal movement count? Yes or no? Yes po. Sabi natin kanina, the fetal movement count is 10 to 12 movements in 1 hour plus it is now done tawag dito, maximum of 2 attempts. Yes or no? Yes po. Like for example ngayon, for the fetal movement count, for example, for the first attempt, hindi umabot ng 10 movements in 1 hour. Then in the second movement, again, hindi siya umabot ng 10 movements in 1 hour. Okay, ang mangyayari ngayon dyan, for example, guys, that will now be referred to the physician and the physician now could perform again your fetal heart rate monitoring naman po. Pag, for example, yun nga, kulang yung movements ng bata. Okay, so para siyang tawag dito, by level, yes or no? Yes po. Okay, so not necessary naman po na it is only performed during labor. It could be also performed kahit wala pang labor just to check for the fetal well-being. Okay? Sige po. So again, physical stimulation decreases your heart rate po. Okay. Therefore, guys, anong gagawin mo? For example, sabi doon, during the fetal heart tone monitoring, for example, okay po, Ma'am Vanessa, the nurse noted a decrease in the fetal heart rate on the beginning or on the onset of your contraction. What will be the appropriate nursing action? Bingo, you answer. You simply continue monitoring. Again, that will be the answer in the board exam. You document and continue monitoring. Sir, why are we going to document and just continue monitoring? Because this is all normal because of the vagal stimulation. Yes or no? Yes po. Okay. But if, for example, top-notchers, that is now caused by your late deceleration. Sir, ano po ba yung late decelerations? If you say late deceleration naman, nurses, take note. This is now caused, guys, letter L, gawin mong letter U. It is now caused by your utero-placental insufficiency. Again, utero-placental insufficiency. Ibig sabihin po, nagdi-decrease na yung blood supply going to the placenta, therefore nagdi-decrease na po yung oxygen na nakakarating kay baby. Yes or no? Yes po. On the end of your contraction. Sir, bakit po ba kasi nangyayari to? Remember guys, pag nag-contract ang uterus mo, again ha, pag nag-contract ang uterus, anong mangyayari? Pag nag-contract ang uterus, magkakaroon ng vasoconstriction dun sa mga blood vessels sa inyong uterus. Yes or no? Yes po. At pag nagkaroon ng vasoconstriction, that will lead now to a decrease in the placental perfusion. Yes or no? Yes po. Placental perfusion po. And that will now be your utero-placental insufficiency occurring on the end of each contraction. Yes or no? Kung parelax na po yung uterus, dun bumagsak yung heart rate ni baby. And bingo, what will now be the appropriate intervention by the nurse? Bingo, top-notchers, this will be the proper sequence of your intervention. Number 1, we have to stop giving the oxytocin if the woman, for example, is receiving one. Yes or no? Yes po, sir. Why are we going to stop the oxytocin? To stop the contractions. Bakit? Remember, the contractions are causing vasoconstriction, decreasing placental perfusion. Therefore, stop the oxytocin to stop the contractions to maintain adequate placental blood supply. Okay? After that one, we are now going to reposition the woman, guys. Tanungin ko ulit kayo ngayon. How are we going to reposition the woman, nurses? Left or right side lying? Again, ang mapaghimala. Ang tawag dito, ang mapaghimalang left side lying position. Bakit po? Again, to prevent your vena cava compression, ensuring adequate blood going to the heart, ensuring adequate blood to the uterus, ensuring adequate placental perfusion. So guys, kung alam mo yung galaw ng katawan mo, madaling maintindihan to. Yes or no? Yes. And lastly, nurses, or hindi, number 3 pala, oxygenate the woman muna. Then last, nurses, is to notify the physician. Yes or no? Yes. Okay? So guys, this is the proper sequence of your management. If there is late deceleration occurring in the end of contractions, caused by your uteroplacental insufficiency. Okay, stop the oxytocin, reposition the woman, oxygenate the woman, then notify the physician. Yes or no? Yes po. Okay. Let's have your variable deceleration naman po. Variable, guys, is variable. Paiba-iba. It occurs anytime during the contractions naman po. Okay? And this is now caused, guys, letter V, variable. This is caused by your cord compression naman po. Naiipit yung umbilical cord ni baby. Kaya bigla-biglang bumabagsak yung kanyang heart rate anytime during the contractions. Okay, therefore, sir Ken, what will be our management for this one? You simply reposition the woman. Sir, how are we going to reposition the woman? For that one, that will now be dependent. Depending now, nurses, kung paano ba naiipit, for example, yung cord. But again, pag cord compression, usually, it is caused because of your, tawag dito, your cord prolapse, yes or no? Yes po. So usually the answer for that one, pag may cord compression, again, usually the answer will be your knee-chest position. Yes or no? Again, your knee-chest position. Okay. Nakapatiwari, nakatihaya, ang tawag din nakatuwad. Parang nakatuwad, ba tama ba yung term ko? Nakaganon yung mother, yes or no? Yes po. Okay, bakit po? To relieve compression of the cord, yes or no? Yes po. Pero pag wala pong knee chest, guys, another possible position is your modified Sims position. Modified Sims position. Sir, ano po ngayon yung modified Sims position? Naka-turn to the left side si mother, tapos nakaangat yung kanyang puwet. Yes or no? Yes po. Bakit mo inangat yung kanyang puwet? Again, to relieve the cord compression in case nagkaroon ng inyong prolapsed umbilical cord. Okay, but anyway, guys, don't worry. We'll discuss further your modified Sims position or your exaggerated Sims position. This afternoon, we'll discuss your prolapsed umbilical cord. But for now, tandaan mo, variable deceleration is caused by your cord compression. Okay? So guys, copyhin mo po, copyhin mo. Okay, so one last rundown. Remember, go. Early decelerations, again, they occur on the onset of your contractions caused by the head compression causing deceleration, pinapabagal ang tibok ng puso, continue monitoring, everything is normal. Late decelerations are caused by your uteroplacental insufficiency occurring on the end of contraction. Management would be to stop the oxytocin, reposition to the left, oxygenate, then notify the physician. And last is variable decelerations occurring anytime during or in between contractions caused by your cord compression, reposition the woman. Okay? Sige po. Everyone, copyhin mo na po, screenshot mo na po, ililipat na po natin. Ililipat na naman po natin in 5, 4, 3, 2, and 1. Okay na? Okay. Very good. Moving forward, diretso po tayo. Okay, sir, ilang liters po ng oxygen ang sa intervention ng late? That will be your high flow oxygen. Usually that will be 8 to 10 liters per minute. Again, your high flow oxygen, your 8 to 10 liters per minute of your oxygen. Okay, again, I repeat, 8 to 10 liters per minute. Sige. High flow oxygen. 8 to 10 liters per minute. 8 to 10 liters per minute. Okay. Sige po. Alright. Sige guys. Copyhin mo na, screenshot mo, ililipat ko po in 5, 4, 3, 2, and 1. Sir, what week po, usually pwede na mag-monitor ng fetal movement? Yun po, yung like kahapon po, yung ating quickening, usually quickening natin is, di ba sabi natin quickening will be on the 20th week for 20th week for your primigravida and 16 weeks for your multigravida. Okay, but there are references, guys. Again, ulitin ko po. Sige, good question po, Ma'am Cristel from UP. Good question po. There are some references po telling us that the peak of your fetal movement, usually that is only between the 26th to the 28th week of your pregnancy. Again, the quickening, the first movement can be felt on the 20th week or 16th week. Okay, but the peak na pinaka talagang gumagalaw ng bata, that will be between the 26th week to the 28th week of your pregnancy. That is when we could now monitor for your fetal movement count po. Okay? Alright. Sige guys, copyhin mo. Copyhin mo po, screenshot mo. Ililipat ko na po. Ililipat ko na po in 5, 4, 3, 2, and 1. Okay? Sige. Ulitin ko ha. Again, 20th week, quickening. Okay? Pero yung pinaka-peak talaga na gumagalaw na yung bata, na regular yung galaw niya is again, 26th to 28th week of your pregnancy. Okay? Sige po. Very good. 10 to 12 movements per hour, air number yung 26 by 28 week. Yes po, ma'am. Yes po. Okay? Alright, moving forward. Nurses, moving forward. Screenshot mo, ililipat na po natin in 5, 4, 3, 2, and 1. Okay? And last topic before we go to your labor. Okay? Ito ngayon, ang inyong mga, tawag dito, pregnancy and vaccination. Okay. Go, guys. Ito lang po. Tandaan nyo lang ha. Ano, sir, Ken, ngayon yung mga safe na vaccinations during your pregnancy? Okay, go. Number 1, of course, is your tetanus toxoid. Again, number 1 is your tetanus toxoid. Yes or no? Again, your tetanus toxoid. Okay, mga TT1, TT2, TT3. Yes or no? Yes po. Okay. Another one, nurses, is your Hepa B vaccine. Again, your Hepa B vaccine. Okay. Another one is your influenza vaccine. Influenza vaccine. But guys, for the influenza vaccine, we could only give your inactive form. Again, inactive form. All right. What else? Guys, I would like to focus on your R. Guys, nurses, tandaan mo to ha. Huwag kang malito. R is your rabies vaccine. Again, R is your rabies vaccine. Remember po that your rubella vaccine, again, your rubella vaccine or your MMR vaccine or your anti-measles vaccine, 1 or 2 pa yan. Bawal po yan sa pregnancy. Yes or no? Again, bawal po to sa pregnancy. Yes or no? Yes po. Again, I would like to reiterate, R is for rabies vaccine, not rubella vaccine. Maliwanag po. Rubella is contraindicated during pregnancy. And of course, D, that will now be your diphtheria. Yes or no? Ayan, your diphtheria vaccine. Dagdag mo na rin po si pertussis or yung whooping cough vaccine po natin. Yes or no? Yes po. In short, yung Tdap mo, pwede. Ano yung Tdap? Tetanus, diphtheria, pertussis. Or in other books, that's your DPT. Yes or no? That is okay. Wala pong problema tayo sa DPT. So guys, these are the safe vaccines during your pregnancy. Tetanus, Hep B, influenza inactive form, rabies, diphtheria, pertussis, tetanus vaccine are safe during pregnancy. Okay? Dagdag ko na rin po guys. Sige, dagdag natin ha. Okay, kumpletuhin natin. Safe din po guys. Safe din po si pneumococcal, and meningococcal vaccine po. Again, your pneumococcal and meningococcal vaccines are also safe during pregnancy if needed lang naman. Again, if needed lang naman po. Okay? And lastly, dagdag na rin po siya natin. Huwag lang natin kalimutan. Bingo, another big star is your COVID-19 vaccine. Again, COVID-19 vaccine. Sir, is COVID-19 vaccine safe during pregnancy? The answer, top notchers, is yes. However, it must only be given after the first trimester. Yes or not? Yes po. Sir, bakit po only given after the first trimester? Dapat masiguro muna na buo na yung bata. Yes or no? Yes po. To prevent any fetal malformation. Again, COVID-19 vaccine can only be given after the first trimester of your pregnancy. Yes or no? Yes po. Okay? Sige po. Copyhin mo na guys. Copyhin mo na. Screenshot mo. Screenshot mo. Ililipat po natin. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay, sige po. Copyhin mo. Copyhin mo. Screenshot mo po. Screenshot mo. Ililipat po natin. Ililipat po natin in 5, 4, 3, 2, and 1. Okay? Sige po. Guys, nakakatuwa yung mga pumasa ng board exam. Tuwang-tuwa sila. Ang dami kasing pumasa nurses. Aray ko. Nakakatuwa yung mga post nila. Okay. And may ideal weeks na po ba na i-administer per type of vaccine? Sige po. Ma'am Kate, wait lang ha. Sige po. Okay. Sir, ilang dose ulit for tetanus toxoid? TT1 to TT5 po. Okay, the doses po for your TT1, TT2, TT3, TT4, TT5, yung mga after 1 month, after 6 months. What else? Then after 1 year, 3, 5, yung mga ganon. That will be discussed na po on your other subjects po. Maybe discussed in your community na po. Or might be discussed by Ma'am Heidi in your intensive review na po. Yung mga TT1, TT2. Okay, so don't worry for that one. Okay? Sige po. Ayan. Sir, ako po nabigyan ng Sinovac ng first trimester po, pero okay naman po si baby na. Okay, that's good. Okay? Sige po. Sir, may ideal weeks po ba na i-administer per type of vaccine? Etong mga vaccine naman to ma'am, mostly, binibigay lang po yan, for example, as needed, for example, for the woman. For example, wala pa siyang Hep B, then you can give your Hep B. Pero pag may Hep B na siya, then don't need for Hep B. And for example, yung rabies, if hindi naman siya, for example, in contact with animals, then no need to give your rabies vaccine. So it is only given as needed po during pregnancy. Okay? Sige po. Sige, wait lang. Guys, kopihin mo, screenshot mo, lipat ko in 5, 4, 3, 2, and 1. Sige guys, let me just share to you this slide na lang. Sige, stop share ko ha, saglit lang po. Let me just open a slide. Actually, I'm discussing this one sa NCLEX na, pero sige, I'll be sharing it with you guys. Okay, so this is a part of my lecture in NCLEX, pero sige, since pinagtanong, i-share ko na din po. Malay mo naman, lumabas sa board exam. At least, di ba? Pandagdag lang. Okay, nasa na ba yon? Okay, wait lang guys ha. Hanapin ko. Okay, nasa na siya? Ayun, nawala. Bakla ka ng to. Ito. Guys, NCLEX na to. Bakla ka ng taon. Pagdagdag bayad to charot lang. Okay, hindi, sige. Para may screenshot mo lang siya, para makita mo lang siya, no? Anyway, I just simplified it, kaya mas simplified lang yung lecture ko. Pero if you want to have this, okay lang din naman sa akin. Ay, asan na yun? Nawala, bebe. Asan na ba yun? Ito. Ay, ayun. Sige. Wait lang guys, ha? Share natin para makita ng iba. Okay? Alright. Wait lang. Ganon, mali. Saan na yun? Ayaw. Okay. Ayan. Eto guys. Okay, you may take a screenshot of this one po para at least meron kang eto, nasa gilid. Kung nababasa mo. Ayan. Ayan, yung nasa gilid guys, you may take a screenshot of this one. Ayan, yung HEPA A, HEPA B, it indicated lang. Okay? Ayun. Tapos yung may influenza, measles, mumps, rubella, ayan, tetanus toxoid, sige po. You may take a screenshot po para at least meron kang copy. But again, there's no need to memorize everything. Yes or no? Yes po. Okay? Sige. Kung kaya mag-memorize, why not? Okay. Pero kung hindi kaya, at least alam mo lang yung mga safe. Again, your safe are your third. Ano po yung third? Tetanus, Hep B, Hep A, dagdag mo na rin po, influenza, rabies, and your diphtheria, pertussis, Tdap. Yes or no? Yes po. Okay. Alright. Sige po. Very good. Welcome, ma'am. Okay. Okay na? Okay. Stop share ko na. Lipat ko na po in 5, 4, 3, 2, and 1. Okay. Sige. Asan na tayo? Okay. Share ko ulit yung ating slide. Go. Yung mga TT1, TT2, that will be discussed na po by Ma'am Heidi siguro or si Sir Dakis. Okay? Ayun po. Sige. Asan na tayo? Ito. Alright, so we're done with your fetal heart tone monitoring. Okay, so again, top-notchers of Top Rank Review Academy. Everyone, open your chat box, everyone. Open your chat box, everyone. Bingo. Again, if asked in the board exam, top-notchers, considering, for example, your Sandovsky method, what is the normal fetal movement count for your Sandovsky method? Ano pong sagot ng ating mga top-notchers from Top Rank Review Academy? We shout. Okay, very good. 10 to 12 movements in an hour. Before meals or after meals po? Before meals or after meals? Ano pong sagot ng ating mga top-notchers? That will now be after meals? Yes or no? How about now, according to your Cardiff method? Cardiff method. What will be your normal fetal movement count? Cardiff method. That will be very good. 10 movements in 12 hours, or your count to 10 method. Bingo, guys. Question. What is again the normal fetal heart rate? Again, will be the normal fetal heart rate. 120 to 160 beats per minute. And guys, any condition or situation wherein the fetal heart rate, for example, is less than 120 or more than 160, what is the name of the baby? Ayun ka na naman, bakla ka ng taon, sagot ka ng sagot, ha? Okay, very good everyone. The only thing you have to do is to notify the physician. Ang bilis, mga advance mag-isip, yes or no? Yes pa. Okay, very good everyone, guys. The nurse now is performing your non-stress test. Okay, and the nurse noted an increase in the fetal heart rate of 15 beats per minute for 15 seconds for nanggigigil na ako, guys, sa saglit. Hindi pa tapos yung tanong, di ba? Okay. Sige. Okay, very good. How are you going to record that one? Reactive or non-reactive? That will now be your reactive result. Normal or abnormal? That will be abnormal. A normal result. Yes or no? Yes. But very good, top-notchers. Okay, how about this one? The nurse is performing the contraction stress test. Question, guys. What is the normal result for contraction stress test? The normal result is a negative result, guys. What is a negative result? With decelerations or no decelerations? No decelerations. Ibig sabihin, hindi bumabagsak yung heart rate ng baby. Normal, negative, no decelerations, guys. Are episodic fetal heart rate accelerations normal? Yes or no? Normal. Bakit po? What is probably causing the episodic fetal heart rate acceleration? Caused by the fetal movement. Yes or no? Yes po. Very good, everyone. Bingo. The nurse now noted a decrease in the fetal heart rate on the end of each contraction. Early, late, or variable? Very good, late. And what is now causing late deceleration? Head compression, uteroplacental insufficiency, or cord compression? Uteroplacental insufficiency. Therefore, what will be your appropriate intervention? Continue monitoring and document, or stop the oxytocin, or reposition immediately? Stop the oxytocin muna. And bingo, how about the woman noted a decrease in the fetal heart rate on the start or beginning of each contraction? Early, late, or variable deceleration? Early deceleration. Therefore, top-notchers, what is the cause? Head compression or your uteroplacental insufficiency? Head compression. Therefore, top-notchers, what will be your appropriate nursing management? You are going to document and continue monitoring. The question is, how are you going to document the fetal heart rate? Red ball pen, green ball pen, or black ball pen? O, sige nga, sumagot ka. Okay? Again, so depende yan sa shift mo. Yes or no? Kung morning shift ka, di mag-green ka. Parang ganun. Okay, charot lang. Okay, guys, moving forward. Moving forward, violet, sabi nung isa. Screenshot mo, pink, sabi nung isa. Lipat ko pa in 5, 4, 3, 2, and 1. Okay, very good, everyone. In fairness sa inyo, guys, ang bilis ng pick up ninyo, ha? Okay, nafe-feel ko. May mga top-notcher na manggagaling sa section na ito. Yes or no? Amen? Manifesting? Yes or no? Yes po. Manifesting. Claiming? Yes or no? Yes po. Okay? Ayan. Very good, everyone. Sige, diretso po tayo. Okay? In fairness, guys, sa inyo, maganda yung batch ninyo, nurses. Maganda yung section ninyo. Kasi, napansin ko lang po, mula kahapon, walang pasaway sa inyo. Okay? Ayan. So, guys, mahalin ang mga kabatch. Yes or no? This is section 1. Yes or no? Yes po. Guys, promise, napansin ko, maganda yung section ninyo. Kaya huwag kayong lumipat, yes or no? Yes po, napansin ko po, walang pasaway. Lahat sumusunod, wala pong naiiwan, yes or no? Yes po. Okay, so everyone, love your section. Unahan ko na kayo. Hindi kasi ganito kasi minsan, guys. Yung ibang section, may mga pasaway. Oo, yung alam mo yung nag-lecture kayo tapos, sir, hindi ko na screenshot Yung kanina, pakibalik naman po. Ayun, so babalik na naman. May mga ganon. Napansin ko lang sa inyo, in fairness naman, mula kahapon, wala masyadong mga delays. Yes or no? Yes po. Section 1, maintain that kind of attitude. Yes or no? Yes po. Focus palagi sa review. Yes or no? Yes po. Okay? Sige po. Very good everyone. Go. Ito, right? Nagmamahalan na sila. Sige. Section 1, magmahalan. Yes or no? Yes po. Magmahalan pero wala munang mag-Trendelenburg position. Yes or no? Mga bakla kayo ng taon. Maaga pa po dyan. Para dyan. Yes or no? Wala munang mag-Trendelenburg position. Utang na loob. Yes or no? Yes po. Tsaka na po yan. Mga intensive review. Yes or no? Yes po. Bakit po? Noong November 2022, bakla ka ng taon? Online review? Makikita mo na lang, may kasama ng iba. Galing din sa online, yes or no? Yes po. At magkatabi sa kama, tapos nag-selfie. Mga baklang to, sabi ko, ay, online yan, di ba? Bakit magkatabi sa kama, nag-selfie pa sila? Pinost pa sa Facebook, yes or no? Yes po, mga bakla ng taon. Iba yung ginawa. Okay. Ginawa yung review, online review, ginawang Grindr, ginawang, anong tawag dun sa babae at lalaki? Ginawang, anong tawag doon? Anong tawag doon, guys? Yung sa Grindr sa mga bakla. Ginawang Tinder, yung Top Rank Review Academy online group, mga bakla. Ginawang Bumble, mga bakla tong mga to. Oh, guys, behave muna. Okay, mahirap mag-review na. Meron kang nausea and vomiting. Yes or no? Okay, tsaka na po yung MS Gravidarum. Yes or no? Mahirap mag-review na may nausea and vomiting. So, utang na loob. Magpakaibait ka muna. Yes or no? Yes pa. Okay? Sige, diretso po tayo. Section 1. Go! Nasa review center ang hanap. Okay? Ayun. Pure online to, di ba? Pure online kayo, guys. Tama? Sus! Pure online. Sa review, pure online. Pagkatapos ng review, nag-face-to-face. Nag-Trendelenburg pa yung isa. Mga bakla kayo. Nanggigigil ako. Sige. Anyway, moving forward, guys. Diretso po tayo. Doon na po tayo sa labor. Okay? But anyway, nurses, before we start with your labor, let's have a 2-minute quick break. Bloody break po tayo. Then we'll start with your labor. Sige po, guys. Please have your quick break for 2 minutes before we start with your labor and delivery. Go. Sige po. Ihina po yung mga umihi, yung mga hindi pa nag-breakfast, kumuha ng something to eat. Okay. Go. Ayan. Ako din, I have to change my napkin kasi medyo puno na po. Because ako ay nasa second day of my menstrual bleeding. Wait lang. Give me 2. Okay, let's continue, nurses, with your, ano na tayo? Ayan. Preparation for childbirth, your normal labor and delivery na po tayo. Okay? So remember guys, that walking, again, ano ba yun? Ano biglang lumabas? Walking would always be top-notchers, the best source of exercise during your labor. Again, walking would always be considered as the best source of exercise po during your labor. Best source of exercise. Usually guys, 20 minutes per day na walking. Okay na po yan. Again, 20 minutes per day is already enough po na walking. Pero dapat dire-diretso, yes or no? Yes po. Squatting, that will increase blood supply to the uterus. And squatting nurses, squatting po, ayan, sige, lagyan ko na lang siya ng note ha. Squatting, letter A, this will now be the proper way to do your squatting, guys. This is your squatting, okay? While tailor sitting, letter B, this will be your tailor sitting naman po, to tighten the perineal muscles. And Kegels exercise is to strengthen the perineal muscle. And pelvic rocking, we have discussed this one yesterday na po, that will now be to prevent and to manage your backache. Yes or no? Yes. Again, your backache. Alright, sige po. Copyhin mo na guys. Copyhin mo po. Copyhin mo, screenshot mo. Screenshot mo. Ililipat po natin. Excuse me. Ililipat po natin in 5, 4, 3, 2, and 1. Okay na? Okay, sige. Don't forget your pelvic rocking. Itong pelvic rocking, guys, favorite palagi yan. Hindi po yan nawawala, ha? Okay, go. Lipat po and go. Okay. Now, let's have nurses the different premonitory or prodromal signs of labor. Now, remember, guys, if you say premonitory or prodromal signs of labor, these are not yet signs of true labor. Ibig sabihin lang, malapit ng manganak yung babae. Premonitory or prodromal signs are not yet true signs. These are only signs that the woman could undergo labor na po. Okay? In a matter of 1 to 2 weeks. Yes or no? Depending na kung primipara or multipara. Okay. We have number 1 nurses, your lightening. That is now manifested by the relief of your dyspnea. Gumana yung kanyang pakiramdam. Bakit po? Nag-engage na yung bata. Okay, there is relief of the compression of the diaphragm. For primipara nurses, lightening could occur 1 to 2 weeks before labor. While for multipara, that could occur as late as a day before labor, ang inyong lightening. Okay, another sign of your premonitory or prodromal sign is your increased Braxton Hicks contractions po, okay? Or the painless contractions relieved by walking. Therefore, what are you going to do? You simply ask the woman to walk. Mother, maglakad-lakad ka lang para mawala yung inyong mga Braxtons. Guys, Braxton Hicks, ito yung mga sinasabi, for example, ng mga buntis. Ito yung pag malapit na silang mga anak, yung biglang naninigas. Yes or no? For example, sabi nila, uy, friend, yung tiyan ko biglang naninigas. That is now your Braxton Hicks contraction. Yes or no? Yes po. Tumitigas kasi nga nagko-contract. But again, it is painless. Yes or no? Yes po. Biglang tumitigas yung tiyan ko, friend. Parang ganun siya. Okay? What else? Bloody show. This will be your pink tinged cervical spotting. Okay, guys, nurses, I would like to show you now how your bloody show looks like. That will be your bloody show, nurses. So this will be your mucus plug. And if the mucus plug, for example, now is combined, for example, with blood, that will now be, ito, parang ganito itsura niya, yes or no, your bloody show. A prodromal or a premonitory sign of your labor. Okay, your bloody show. Okay, sige po. And what else? The ripening of the cervix. The cervix will be as soft as a whipped butter. Yes or no? Yes po, guys. Another big star here, whipped butter. Ganyan po siya kalambot. Remember, softening of the cervix or your Goodell's sign is a probable sign of pregnancy. That is your Goodell's sign, softening of the cervix. Pero pag malapit ng manganak yung babae, it will now be as soft as a whipped butter. Yes or no? Yes po. Okay, parang yung butter mapalaman. Okay. Sabi nila guys, pag hindi daw buntis yung babae, yung cervix niya, sing tigas ng kanyang nose tip. Again, yung babae daw pag hindi buntis, yung cervix niya parang nose tip. Pero pag yan ay nabuntis, sing lambot na yan ng kanyang earlobe. Yes or no? Yes po, pag nabuntis na po. Okay, sir. Paano naman po kami? Wala kaming nose tip. Magpabelo ka, ha? Okay, sige. Another one, guys, will be your, excuse me po, pasintabi na lang po doon. Ay, joke lang, pasintabi po. Okay. Okay, let's have your psychosocial sign of your pregnancy. Okay, that will be increased maternal energy. Guys, ito ngayon, yung parang kahapon yung sabi natin, nesting behavior. Yes or no? Yes po. Ito ngayon, guys, napansin mo, for example, guys, napansin niya, sa mga mall, for example, pag nagpunta ka ng SM, for example, ng Robinson, ng Ayala, ng Shangri-La, ang daming buntis, ang lalaki ng tiyan, naglalakad. Yes or no? Yes po. That could now be a sign na malapit na silang manganak. Yes or no? Yes po. Bakit? Nagdinesting behavior. There is increase in maternal energy. Bakit po? Tumataas yung kanilang adrenaline. Yes or no? Yes po. Bakit po? Excited na. Bumili ng mga gamit ng bata, lakad ng lakad, bili ng bili kung anong mga gagamitin, for example, sa hospital. Yes or no? Yes. But guys, please take note, you have to instruct the woman to conserve the energy po. Again, teachers, instruct the woman to conserve the energy. Why do we have certain now to instruct the woman to conserve the energy? Because they will use this energy during the true labor process. Yes or no? Yes. So guys, these are all the premonitory or the prodromal signs of your labor: lightening, increased Braxton Hicks, bloody show, ripening of the cervix as soft as a whipped butter, and of course, increase maternal energy, nesting behavior, a psychosocial sign of your approaching labor. Yes or no? Yes po. Bakit po, sir, psychosocial? Psychosocial. Mas nagiging outgoing yung babae. Yes or no? Labas ng labas, kung ano pinagagawa. Yes or no? Yes po. Okay. Moving forward, screenshot mo po. Screenshot mo, ililipat ko na po. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay? Diretso po tayo. Ayan, bloody show. Now, let's have your true labor naman po. For your true labor nurses, okay, ayan, usually sa mga discussions ninyo, you separate your true labor and false labor. But let us just simplify, nurses. For true labor nurses, that will now be your drip. Sir, ano po yung drip namin? Decreasing intervals, regular contractions, increasing intensity. Therefore, whatever is the opposite of this one, that will be your false labor. Yes or no? Yes po. So for now, decreasing intervals, or it becomes more frequent. Yes or no? Yes po. The contractions are regular. There is increasing intensity, plus there is progressive cervical dilation. Okay. Top notchers, tanong ngayon. Sa lahat po ng ito, interval, contraction, intensity, cervical dilation, what is now considered as the most important sign of your true labor? Everyone, sa lahat po ng to, what is considered as the most important sign of your true labor? What will be the answer of our top notchers from Top Rank Review Academy? Okay, very good, everyone. This will be the most important sign. Yes or no? Yes po. Your cervical effacement and dilatation. Sir, bakit po yan? Kasi po, nurses, kahit contract ng contract ang uterus, ulitin ko, kahit po mag-contract ng mag-contract ang uterus, pag hindi nag-dilate yung cervix, hindi lalabas yung bata. Yes or no? Yes po. Therefore, kailangan mag-dilate ng cervix mo. And sir Ken, what is now the pain characteristic of true labor? For example, sabi ng buntis, nurse Ken, ang sakit ng tiyan ko. Ay mother, saan po yung masakit? Dito sa may bandang gitna, sa may taas. Ay mother, kumain ka na ba? Baka gutom ka, yes or no? Or mother, tumae ka, baka natatay ka, yes or no? Yes po. Pero pag sabi, for example, ng babae, nurse Ken, ang sakit ng likod ko, pati yung tiyan ko, parang yung katawan ko mahahati. Bingo. That could now be your true labor pain. Very good, everyone. We call that one as your girdle-like pain. Again, your girdle-like pain. Sir, ano po yung girdle-like pain? Parang girdle. Di ba ang girdle? Ito yung pinabalot mo sa abdomen mo after surgery. Yes or no? Ibig sabihin, pinapaikot mo sa abdomen mo. Girdle-like pain, that is now your pain. That is now radiating from the back to the abdomen. Again, the pain is radiating from the back to the abdomen. That will now be, nurses, your girdle like pain. The pain is radiating from the back to the abdomen. Sobrang sakit. Pumapaikot yung kirot. That will now be known as your true labor pain. Don't forget, another big star. Bingo. True labor pain is radiating from the back to the abdomen. Yes or not? Yes po guys, ganito. Normal lang po ba ang back pain during pregnancy? Yes or no? Yes or no? The answer is, of course, that is normal. Yes or no? Yes po. Okay. If it is only intermittent or episodic, like for example, hapon biglang sumakit, okay lang, yung napagod lang siguro. Or gabi or umaga biglang sumakit yung likod, okay lang, normal lang siguro, baka napagod lang, yes or no? Yes po. Pero if the pain, for example, is continuous na po, yes or no? Ibig sabihin, there is consistent or persistent low back pain. Tuloy-tuloy yung sakit ng likod. Guys, that could be a sign of your preterm labor. Yes or no? Yes. So pag tuloy-tuloy na po yung inyong backache. Okay, so again, you need to know what is normal from what is abnormal. Intermittent, manaka-naka, paminsan-minsan na sakit ng likod, okay lang. Pero pag tuloy-tuloy, for example, makirot yung likod niya, that could be a sign of impending or your preterm labor. Maliwanag pa tayo. Okay? Sige po. Copyhin mo na, screenshot mo, ililipat po natin in 5, 4, 3, 2, and 1. Okay, very good. Moving forward, diretso po tayo. Okay, now, ito yung pelvis mo, guys. So, this will be your pelvis. Your true pelvis. Sir, bakit pag nanganak, sumasakit yung likod? The answer, guys, is ito. Dahil tumatama yung ulo ng bata dito sa ating sacrum. Yes or no? Yes po. And that is now causing the pain. Yes or no? Yes po. During your delivery. Again, ito po. Pag nanganak yung mother, tumatama yung ulo ng bata dito, it is now causing the pain. Okay? Sige, dito tayo guys. Your, tawag dito, maternal pelvis. Okay. Guys, tanda mo to ha. A common to na question din na nakakahilo minsan. Okay? Tanda mo, nurses, pag ganito, ang gagawin mo, hanapin mo lang yung dalawang magkaumbok na magkaharap. Yes or no? Yes po. You call this one as your ischial spine. Ay, ano ba yan? You call this one as your ischial spine po. Ischial spine. Okay? Then above, nurses, the ischial spine, those are your negative stations. -1, -2, -3. And the baby, if the baby is in a negative station, the baby is still considered as floating. Yes or no? Yes po. But if the baby, for example, are on the positive station na po, the baby is considered crowning na. Yes or no? Yes po. Sir, ano ang pwede namin gawin para hindi na kami malito sa floating, crowning, negative or positive? Usually guys, ang nakakalito dito, yung negative at positive. Minsan kasi na-confuse ka, yes or no? Yes po. Sige. First technique, nurses, to remember, para hindi ka malito, huwag mong i-apply yung algebra. Bakit? Paano po yung algebra? Sa math kasi, pag pataas, positive. Pag pababa, negative. Yes or no? Algebra. Huwag mong i-apply yan. Okay? Baliktad po. Pag OB, yes or no? Pag negative, pataas. Pag positive, pababa. Yes or no? Another way to remember this one, guys, to prevent confusion, is floating. Pag nagpo-float, guys, for example, lumalangoy ka, nagpo-float ka, straight ka lang, yes or no? Yes po. Floating, negative. Yes or no? Yes po. Pero pag crowning, nurses, palabas na po yung ulo ng bata. Okay? Crowning. Remember, pag crown, yung crown, for example, ni Queen Elizabeth, meron niyang cross sa taas. Yes or no? Yes po. Therefore, crowning, positive, may cross sa taas. Yes or no? So don't forget, those are just your memory aid. In case, for example, medyo mahina yung memory mo, mabilis ka ma-confuse, I hope magamit mo yan. Yes or no? Floating, float, negative, crowning, positive. Palabas po yung ulo. Okay? Pero pag ang ulo, for example, ay nandun na mismo sa ischial spine, that will now be your station 0 na po. That will be your station 0. Okay? Sige po, nurses. Go, copyhin mo na. Copyhin mo na po. Copyhin mo, screenshot mo po. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay na? Okay, burahin ko and diretso po tayo. Alright. Let's have your maternal pelvis, nurses. Okay. Remember, nurses, we have what we call as your diagonal conjugate and your obstetric conjugate. Diagonal conjugate, nurses, is the only pelvic measurement obtained through vaginal or internal examination. Ito ngayon, nurses, ang inyong diagonal conjugate. Okay, pasok mo yung fingers mo. From the tip of your finger to dito sa bandang to, measure the distance until the vaginal introitus. Yes or no? That will be your diagonal conjugate. And usually, nurses, the diagonal conjugate is around 11.5 to 13 centimeter. That will be your diagonal conjugate. Okay. However, nurses, please take note, meron pa po tayong mas makipot na daan sa ating pelvis. And you call that one, nurses, as your obstetric conjugate. Ito ngayon yung diagonal conjugate mo. Ito yung mineasure mo dito. Ang problema, nakaharang si symphysis pubis. Yes or no? Yes po. And that will now be the obstetric conjugate. And guys, please take note, obstetric conjugate, that is now the narrowest diameter of the pelvis na lalabasan ng bata. Therefore, it is considered as the most important pelvic measurement. Bakit po siya, sir, most important pelvic measurement? Because it will determine if the fetus could pass through the pelvic outlet during a normal spontaneous vaginal delivery. Yes or no? Yes po. Okay. Guys, recall lang po tayo. Remember, sir, ano po ba ang normal fetal head diameter during delivery? Usually that's 9.5 centimeter. A normal baby usually 9.5 centimeter ang kanyang fetal head diameter. Okay. Ang problema ngayon, nurses, we could not directly measure the obstetric conjugate, but we could estimate this one by measuring for sure diagonal conjugate. What do you mean by that one, sir? Because your obstetric conjugate, nurses, please take note, is your diagonal conjugate minus 2. Yes or no? Yes po. Ay, station 0 po is your engagement po. Station 0, the fetus is engaged. Okay? Station 0, the fetus is engaged. Alright, go. Again, obstetric conjugate is diagonal conjugate minus 2. Therefore, guys, for example, if the diagonal conjugate, for example, is 11.5 centimeter, nurses, what will be the obstetric conjugate? That will be 9.5. 11.5 minus 2. Guys, makakadaan po ba ngayon yung 9.5 na ulo ng bata doon sa 9.5 na obstetric conjugate? Yes or no? Yes po, saktong-sakto dadaan yung bata. Yes or no? Yes po, sir, saktong-sakto. Paano lalabas? Don't worry, magkakaroon naman po ng molding. Di ba yung molding? Overlapping of the coronal and the sagittal sutures. Yes or no? Yes po, lumilit din yung ulo ng bata. Pagkadaan niya, nagmo-molding, saktong-sakto makakadaan siya sa 9.5 cm na obstetric conjugate. Again, don't forget, the most important is the obstetric conjugate. But what is the only pelvic measurement that can be obtained through internal or vaginal exam? That will now be your diagonal conjugate. Paliwanag po tayo siya. Okay? Sige po. Nurses, copyhin mo na. Copyhin mo na po. Screenshot mo na. Screenshot mo na. Ililipat na po natin. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay? Sige po. Okay? Ay, ayaw gumalaw. Okay. Question ngayon, guys, sa inyo, nurses. What is now the best position for delivery? Anyone? Ano po yung best position for delivery? Okay, guys. Huwag na po kayong sumagot ng lithotomy, utang na loob. Huwag mo nang isagot yan. Bakit po? This is the only common practice here in the Philippines. Bakit po? For the convenience of the doctor. Bakit po? Kasi pag naka-lithotomy, madaling ma-assess, yes or no? Yes po. Okay. Pero again, it is not for the convenience and the comfort of the patient. The best ideal position for delivery would always be your squatting position. Yes or no? Yes po. Pag walang squatting position, upright position. Okay? Sir, bakit po squatting or upright position? Sige po guys, copyin mo muna, screenshot mo. Screenshot mo, ililipat ko in 5, 4, 3, 2, and 1. Again, squatting position, sir. Bakit po squatting position? This is the answer, nurses. Go. Taran! That will now be an example of your squatting position, ideal position for delivery. Bakit po? Number 1, guys, is the gravity. The gravity will help in the descent of the fetal head para mas mabilis lumabas yung bata. Yes or no? Another one, it will widen the pelvic outlet para mas lumuwag kahit papano yung dadaanan ng bata. Yes or no? Yes po. So again, this will be the squatting position, ideal best position for your delivery. Okay, hindi na po yung ating lithotomy na common dito sa Philippines. Okay? Alright. Sige guys, copyhin mo na. Copyhin mo na po. Screenshot mo. Screenshot mo kung gusto mo. Ililipat po natin in 5, 4, 3, 2, and 1. Okay? Yan. Moving forward, diretso po tayo. Ayan. This could be as well a good position. Ayan. So, depende rin kung ano yung pinaka-comfortable sa nanay. Yes or no? Yes po. Okay? Sige. Ito naman guys, ayan. This could also be okay. Ayan. Depende nga kung ano yung comfortable. Ito nurses, this is position, it could relieve your back pain. Bakit po? Remember, ang back pain mo nandito kasi nga yung ulo ng bata tumatama. Okay, this position now could relieve the intense back pain during labor. Bakit po? Yung ulo ng bata bababa, it will relieve the compression of the sacrum that could relieve the pain of the mother. Yes or no? Yes po. Okay? Sige. Diretso po. Ayan. Ito naman yung water birth natin. Wala lang. Water birth. Pag-feel mo lang. Kasi daw pag may water, marerelax yung mga muscles, mas mabilis manganak. Okay? Sir, ano po usually yung temperature ng water? Pag water birth, that will be body temperature po. Around 37.5 to 38. So parang it should be the same with your body temperature. Okay? Sige. Copyhin mo. Screenshot mo. Ililipat ko na po in 5, 4, 3, 2, and 1. Okay? Ayan. Taran! Bingo, nurses. Let's now have your 6 major concepts of natural birth. So guys, these are the 6 major concepts of your natural birth according to your World Health Organization. Again, the 6 concepts of natural birth according to your World Health Organization. Number 1, it must not be artificially induced. Okay? Ibig sabihin, pag hindi naman kailangan magbigay ng oxytocin, huwag mong bigyan ng oxytocin. No to IV fluids and anal. Ma'am Cory, okay lang po kayo? Nakatulog ka, no? Pagkatulog mo, yung kamay mo napindot yung plus. Okay lang. Naganoon siya. Tapos napindot yung plus. Kaya madaming plus yung lumabas. Okay? Kayo guys, ha? Anyway, charot lang po. Thank you. Okay. So again, no to IV fluids. Nagulat pa ako. Again, no to IV fluids. Okay lang po, Ma'am Cory. And of course, no to analgesics. Yes or no? Yes po. Pag hindi naman kinakailangan magbigay ng pain reliever, then don't give your pain reliever. Yes or no? Yes po. Again ito yung ideal. Pero sir, ano po usually yung ginagamit na pain reliever during pregnancy? Your oxycodone. Yes or no? Yes po. For example, kailangan, sobrang sakit talaga, hindi na kaya. We could give your oxycodone. Yes or no? But again, ideally, do not give any pain reliever. Okay? What else? The woman can move freely. Again, the woman can move freely. Pwede siya maglakad-lakad, umikot-ikot. What else? The woman is supported. And of course, another big star, alam mo na yan, of course, upright or side-lying position. Left, of course. And immediate or unlimited breastfeeding. Okay, sige po. Nurses, copyhin mo na. Copyhin mo na po. Screenshot mo na. Screenshot mo na. Ililipat na po natin. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay na? Okay. Go. Yan hanggat maaari, this is the ideal. No IV fluids, no oxytocin, no analgesics. But if needed talaga, we could give naman. But again, this is your idea. Okay? Sige. Alright. Let's have the Leboueur method of contraception. Leboueur method of your childbirth nurses. And this was also adopted by your WHO, World Health Organization. And guys, this is your Leboueur method of childbirth nurses. This is one of the basis of your EINC, or your emergency and immediate newborn care, or your unang yakap, yes or no? This has been one of the basis of your EINC, your Leboueur method of childbirth adopted by the World Health Organization. Birth without violence. Okay, anyone nurses, according to your Leboueur method adopted by the WHO, what is the recommended birthing room temperature during delivery and birth? Okay, very good everyone. The correct answer that is 25 to 28 degrees Celsius. Yes or no? Yes po. Sir, bakit po 25 to 28 degrees Celsius? Hindi masyadong malamig. Hindi rin naman masyadong mainit. Yes or no? Yes po. Bingo, it must be warm. What else? Dim. What else? Quiet. And it should have at least soft music. Yes or no? Warm, dim, quiet, soft music, 25 to 28 degrees Celsius. Question, guys. In the delivery of the fetal head, are we allowed to pull the head of the baby? Yes or no? Very good. The rule, do not pull the head of the baby, sir. Therefore, if we are not allowed to pull the head of the baby, ano pong gagawin natin? Your modified Ritgen's maneuver. And later on, guys, this afternoon, we'll discuss your modified Ritgen's maneuver. But the ideally again, is do not pull the head of the baby. Pero guys, aminin niya, sa OR, sa delivery room, madaming OB ang hindi makapag-antay. Yes or no? Yes po. Hinihila yung ulo ng bata. Lalo na po sa public. Kasi sa public, ang daming manganganak. Yes or no? Mabilisan. Yes or no? Todo hila ng ulo ng bata. Yes or no? Yes po. But again, nurses, ideally, we do not pull the head of the baby. Hayaan mong yung bata lumabas ng kusa. Yes or no? Yes po. Huwag mong hilain, kawawa naman. Kasi nga, birth without violence. Yes or no? Yes po. Okay? Legit, sabi ng isa. And lastly, nurses, bingo, cutting of the cord. We need to delay. Yes or no? Yes po. Again, guys, when are we only going to clump or cut the cord? Possible answer? When? Very good. When the pulsations have stopped. Yes or no? When the pulsations have stopped. Or pag wala po to sa option, guys, when the pulsations have stopped, another answer is after 1 to 3 minutes. Yes or no? Again, after 1 to 3 minutes. Maliwanag po tayo dyan. Again, only cut or clump the cord when the pulsations of the cord have stopped, and after 1 to 3 minutes po tayo dito. Okay, sige po guys. Copyhin mo. Copyhin mo po. Screenshot mo. Screenshot mo na ililipat po. In 5, 4, 3, 2, and 1. So that will be your method of your childbirth. 25 to 28 degrees Celsius. Okay, now, let's go to the stages of your labor nurses. What time is it? Sige, go. Kaya ba? Guys, tandaan mo to ha. Okay. Let's focus on this one, nurses. Huwag mong kalimutan to. First stage, to make it simple, this is the stage for your cervical dilation. Yes or no? Yes po. The onset of your true contractions to your full cervical dilation. First stage of labor. Okay. For primipara, the average duration for primipara, that will be 14 hours. For multipara nurses, that will be 8 hours. Primi, 14 hours. Multipara, 8 hours. And again, please take note, nurses, that under the first stage of labor, there are 3 phases of the first stage of labor. and that will be your latent, your active, and your transition. Okay? And what is the difference now between the latent, active, and transition? Number one, guys, is the cervical dilation. For number one is the cervical dilation. For latent, that will be a 0 to 3 centimeter cervical dilation. For active, 4 to 7 centimeter cervical dilation. Transition, 8 to 10 centimeter cervical dilation. So, remember the song. Ano po yung song natin? 0 to 3, 4 to 7, 8 to 10, ARF, ARF. 0 to 3, 4 to 7, 8 to 10, ARF, ARF. That will now be your latent, active transition. For the duration, nurses, that will now be, bingo, 20, 40, 60, 20 to 40, 40 to 60, 60 to 90 second contraction. Again, this will be the duration, 20, 40, 60, 20 to 40, 40 to 60, 60 to 90. Yes or no? Yes po. For the frequency, nurses, every 10, every 5, every 3, every 10 minutes, nagkukot ang uterus, every 5-minute contraction, every 3 minutes for your transition. Yes or no? Yes po. And for the intensity, that will be your mild, moderate, and your severe. Again, mild, moderate, and your severe for the intensity. Okay? Sige po. Guys, copyhin mo. Copyhin mo. Okay, so nurses, how are we going now to recall this concept? Gawin mo to. Latent, active transition, 0 to 3, 4 to 7, 8 to 10, 20, 40, 60, 20 to 40, 40 to 60, 60 to 90, every 10, every 5, every 3, mild, moderate, severe. Okay, nurses, for example ngayon, binigyan ka ng tanong sa board exam. Ang tanong doon, sabi doon, you are now monitoring for a woman in the first stage of labor. The woman's cervical dilation is at 5 centimeters with contractions occurring every 6 minutes, lasting for an average of 55 seconds. What phase of labor is the woman experiencing? Latent, active, or transition? Very good. That will now be the active phase. So that is how you are going to apply this table. Yes or no? Yes po. Okay guys, ganito. Sabi ko sa inyo, pag alam mo yung normal, alam mo ang abnormal. Yes or no? Yes po. Okay. Guys, nurses, primipara, 14 hours. Multipara, 8 hours. Yes or no? Yes po. That is the maximum average duration of the first stage of labor. For example, nga sabi sa tanong, the woman was admitted at 8 o'clock in the morning with 2 centimeter dilation. On the next shift, the nurse now noted at around 9 a.m., let's say 9 a.m., the woman's cervical dilation is at 6 centimeters with contractions lasting every 45 seconds, or for 45 seconds every let's say 6 minutes. Okay, nurses, question. Is this still a normal first stage of labor? Yes? Or ano po? Normal pa rin ba to? Guys, hindi na. Yes or no? Yes po. Bakit hindi na po normal? Remember, for primipara, hanggang 14 hours lang dapat ang first stage. Yes or no? Yes po. But in this patient, 8 a.m. 2 centimeter na siya. Sorry guys, namali ako. Sorry po, pasensya na po. ako yung mali. Dapat 4 p.m. pala to. 4 p.m. 4 p.m. Ayan. 9 p.m. 9 p.m. na po. 9 p.m. na. More than 12 hours na siya nag-labor. Yes or no? Yes po. Pag more than 12 hours na, andun pa rin siya sa 6 centimeter. Ibig sabihin na siya, mabagal po ba yung pag-dilate ng kanyang cervix. Yes or no? Yes po. Therefore, ibig sabihin, there is no prolonged first stage of your labor. Yes or no? So guys, again, sabi ko sa inyo, pag alam mo ang normal, mabilis mong malaman kung merong abnormal. Yes or no? Yes po. So again, don't forget, pag preemie, 14 hours, pag multi, 8 hours. Maliwanag po tayo. Okay? Bingo. Let's now have the consideration, nurses. In the latent phase, the woman usually here is still excited. There will still be excitement. Siyempre, manganganak na siya. Pag active, nagkakaroon na po ng anxiety. Pag transition, nagkakaroon na po ng irritability. Yes or no? Or loss of control. Kasi nga sobrang kirot na po nung kanyang tiyan. Okay? Dagdagan po natin. In the latent phase, you have to instruct the woman to walk. Yes or no? Yes po, sir. Why do we have to instruct the woman on the latent phase of the first stage of labor to further dilate the cervix? Yes or no? Yes po. But on the active phase, nurses, bingo, don't forget this one. This is not the time that we are going to start using your partograph. Again, this is the time wherein we are going to start using now the partograph, and this is the only time that we could now request the physician to administer your epidural anesthesia. Sir, ano po ba yung epidural anesthesia? Epidural is your painless labor. Yes or no? Epidural, nurses, is it will stop the pain, but it will not stop the contraction po. Ulitin ko, again, epidural anesthesia, it will stop the pain, but it will not stop the contraction. That will be your epidural anesthesia, your painless labor. Therefore, guys, for example, sabi sa'yo doon, a woman now is requesting for epidural anesthesia. Upon assessment, the cervix is dilated at 2 centimeters. What will be the appropriate action of the nurse? A, request the physician for epidural, or B, inform the woman that epidural cannot be given at this time, can only be given on the active phase of labor. Ano pong sagot ng ating mga registered nurses? Okay, very good. Epidural, it can only be given on the active phase of labor pag more than 3 centimeter na po. Yes or no? Yes po. Maliwanag po tayo dyan. And transition, this is now when we are going to prepare for delivery. Yes or no? Yes po. Guys, nurses, if the woman, for example, is already on the transition phase, again, if the woman is already on the transition phase of labor, can we already immediately transfer the woman to the delivery room? Yes or no? For example, 8 centimeter na siya, transition. Can we immediately, agad-agad, transfer the woman to the birthing room? The answer is no. Bakit po? 8 centimeter pa yan, hindi pa yan fully dilated, baka hindi pa lumabas yung bata. Yes or no? Yes po. But nurses, take note. Pag nagkaroon na po, for example, ng Ferguson's reflex. First question, guys. Ito muna. On the first stage of labor, is the woman allowed to push? Yes or no? First stage, is the woman allowed to push? The answer is no. No to pushing. Bakit po bawal mag-push? Kasi hindi pa naman nag-dilate yung cervix, hindi pa lalabas yung bata, baka magkaroon ng cervical tear or cervical rupture. Pero for example, sabi ng babae, o mother, huwag ka munang mag-push. Sabi niya, hindi ko na mapigilan. Ayan na, hindi ko na mapigilan. Lalabas na. Bakla ka ng taon. That will now be your Ferguson's reflex. Yes or no? Yes po, sir. Ano po ang Ferguson's reflex? The uncontrollable urge to push. That is now a sign na palabas na po talaga yung bata. Yes or no? Usually, this is when we are now going to transfer the woman to the delivery table. Pag meron ng uncontrollable urge to push. Diyan po natin i-transfer yung woman to the delivery table. Yes or no? Yes po. If there is uncontrollable urge to push or your Ferguson's reflex, guys, huwag ka basta-basta mag-transfer sa delivery room na wala pang Ferguson's reflex. Bakit? Mumurahin ka ng OB. Yes or no? Yes. O sasabihin niya sa'yo, bakit nandito na to? Hindi pa lalabas yung bata. Sabi niya, yes or no? Yes po. So again, you have to wait for the uncontrollable urge to push. But in the board exam, guys, baka hindi mo makita yung word na Ferguson's reflex. Ano po ang pwede mo makita doon? Nurses, put another big star. There is urge to defecate. Again, feeling nung nanay, parang gusto niyang tumae. That is now your Ferguson's reflex during the transition phase. There is urge to defecate. Guys, for example ngayon, tanong sa board exam. The woman on the transition phase of labor is requesting to go to the bathroom. What will be the appropriate nursing action? A, accompany the woman to the bathroom. B, allow the woman to go to the bathroom. Or C, check the perineum. Ano pong sagot ng ating mga top-notchers? Okay, very good everyone, the correct answer. Pag may urge to defecate, sabi niya, Nurse Ken, parang gusto kong tumae. Ano ang una mong gagawin? You check for the perineum. Yan ang pinakauna mong gagawin, sir. Why do we need to have to check the perineum? For possible crowning. Yes or no? Yes, po i-check mo. Baka akala nung nanay, siya ay natatae, yun pala, palabas na po yung ulo nung bata. Yes or sir Ken? If there is urge to defecate, Sir Ken, parang gusto kong tumae. Ang una mong gawin, silipin mo. Baka dyan na pa yung ulo, check the perineum for possible crowning. Maliwanag po. Pag may crowning, immediately deliver na. Immediately transfer to the delivery table na po. Yes or no? Huwag mong hayaang pumunta ng CR. Bakit? Baka mahulog yung bata. Yes or no? Kawalan naman yung bata. Saan ka pinanganak? Sa inidoro. Yes or no? Yes. Trot lang. Okay? Sige po. Copyin mo na guys. Copyin mo na po. Screenshot mo, sir. Clarify ko lang po. Bawal po mag-push pag transition. Yes po ma'am. Hanggat wala pong hanggat hindi pa po fully nag-delete yung cervix. No to pushing po. We only push if there is already uncontrollable urge to push pag meron na po tayong crowning. Okay, to prevent your cervical lacerations or your cervical turn. Okay? Sige po. Copyhin mo, nurses, copyhin mo, screenshot mo. Okay? At pag nagkaroon na ng Ferguson's reflex, that will be a sign that you are now moving to the second stage of your labor. Okay? Sige po guys. Copyhin mo na, screenshot mo na, lipat ko na po in 5, 4, 3, 2, and 1. Okay? Go. So one more time, don't forget, 0 to 3, 4 to 7, 8 to 10, 20, 40, 60, 60 to 90, 20, 40, 60, 20 to 40, 40 to 60, 60 to 90, every 10, every 5 to 3, mild, moderate, severe. Yes or no? Yes po. Maliwanag pa tayo siya. Alright, sige guys. Again, top-notchers of Top Rank Review Academy. What is the recommended temperature of the birthing room during delivery according to your Le Boyer method? Answer, very good. It's 25 to 28 degrees Celsius. And how are you going to characterize the pain of your true labor? Ano pong sagot ng ating mga nurses? Girdle-like pain. Yes or no? Yes po, top-notchers. What is again the normal fetal movement count according to Cardiff method? 10 movements in 12 hours. How about in Sandowski? 10 to 12 movements in 1 hour. How about the normal fetal heart rate? 120 to 160. And guys, before we have our break, again, if asked in the board exam, what is the earliest time that we could monitor for the fetal heart rate? Ano pong sagot ng ating mga top-notchers? That will now be on the 8th week of your pregnancy. And what are we going to use? Doppler, fetoscope, or your stethoscope? That will now be your Doppler. Yes or no? The fetus moved and there was an increase in the fetal heart rate by 15 beats per minute. Reactive or non-reactive? That will now be your reactive result. Okay, very good everyone. Top-notchers, did you learn something po? For the second day, first 2 hours of our lecture, yes or no? I hope the answer would be yes. Okay, sige. Thank you very much everyone for attending the class today. Please have your lunch break. Enjoy your lunch with your friends, family, barkada, and jowa. I'll see you after 1 hour for the continuation of our lecture. Okay, sige po. Thank you everyone. Have your lunch break. I'll see you after 1 hour po. Okay, kumain ng mabuti. Okay? Alright, then elevate the head of bed 3 hours after meals to prevent your, ayun, cirrhosis. Yes or no? Sige po. Kain na and I'll see you afterwards. Go! All right. Okay, so good afternoon again, everyone. Let's continue with your obstetric nursing. Okay? So again, yung kanina sabi ko sa inyo kanina, at active phase of labor, sabi ko kanina, in the active phase of labor, this is when we are now going to use your partograph. Okay, sige po. Recall lang po tayo. 0 to 3, 4 to 7, 8 to 10, 20, 40, 60, 20 to 40, 40 to 60, 60 to 90, every 10, every 5, every 3, mild, moderate, severe, latent phase, advise the woman to walk. Active phase, you are going to use your partograph. Then, that is when you could administer your epidural anesthesia. Then, transition is when we are going to prepare now for your delivery. All right, bingo. Let's have your partograph, nurses. Go. In the use of partograph, nurses, you just have to remember the most important principles to be considered in the use of your WHO modified partograph. Okay, that will be the first topic for this afternoon. Okay, moving forward, guys. Moving forward, the screenshot. Ay, huwag mo na screenshot. Okay, lipat ko na po in 5, 4, 3, 2, and 1. Okay? All right. Let's discuss your partograph. Okay. So remember, guys, first principle to consider is start using your partograph during the active phase of labor. Bakit po active phase of labor, Sir Ken? You are going to only use your partograph pag umabot na po ng 4 centimeter dilation. Yung babae, can start using the partograph if the woman is already at 4 centimeter dilation. Okay. Another principle to consider, guys, is your how do you call this one? Internal monitoring po, or vaginal, or how do you call this one? IE. Your internal examination. Okay. Again, another thing to consider is your internal examination. Nurses, according to your WHO, what is the considered, or what is the recommended frequency for your vaginal internal examination, or IE, to prevent your infection? Anyone na po sagot ng ating mga registered nurses? Again, according to WHO, what is the only recommended frequency of your IE to prevent possible infection during pregnancy? Very good. Every 4 hours lang po ang recommended internal examination according to your WHO. Okay. Now, for example, guys, ngayon, yung babae ngayon, for example, ay nag-labor or nag-start ng kanyang 4 centimeter dilation at 8 o'clock in the morning, 8 a.m. So 9 a.m., 10 a.m., 11 a.m., 12 noon, of course, 1 p.m., 2 p.m., 3 p.m., 4 p.m. Okay? Now, for example, nurses now, at 8 a.m., 4 centimeter yung babae. Okay? Ngayon, at 12 noon, for example, the woman now is at 6 centimeter. Again, 12 noon, 6 centimeter. Then at 4 p.m., the woman now is at 9 centimeter. Then you are now going to do the graph. Question, guys, is this normal or abnormal labor po? Normal or abnormal labor? Ano pong sagot ng ating mga registered nurses? Pag ganyan po, yung nabuo nating graph, normal or abnormal labor? Answer? That is still normal labor. Yes or no? Yes po. Bakit po? The cervix is dilating as expected. Yes or no? Yes po. Okay, how about this one, for example? So this one, nurses ngayon, this is considered normal. You simply document, continue monitoring. Yes or no? Yes po. How about this one, for example? Nakalagay dyan ngayon, 4 a.m. 8 a.m., 4 centimeter. 12 noon, umabot na ng 5 centimeter. 4 p.m., andun na siya sa 6 centimeter. So this will be now, nurses, your graph. Now, considering the graph, nurses, normal or abnormal na po yung labor? Normal or abnormal na po yung labor? Abnormal na yung labor. Yes or no? Yes po. Here, you are now going to notify the physician. Bakit po? Ibig sabihin, matagal mag-dilate yung kanyang cervix. Yes or no? Yes po. How about for this one naman? Ganito, for example, yung naging graph mo. Anong kulay kaya? Ito na lang. 8 a.m. for example, 4 centimeter. Nung 12 noon na, andun na siya sa 9 centimeter. Guys, prepare for immediate or possible imminent delivery. Bakit? Mabilis mag-dilate yung cervix. Yes or no? Yes po guys. Sa lahat po ng graph natin dito, saan pong graph po yun ang considered normal? The brown, the red, or the green? The green. The red. Yes or no? Yes. So therefore, another principle to remember in using the partograph, the normal graph should stay on the right side of the alert line. Again, it should be on the right side of the alert line, but should not pass through the action line. I repeat, nurses, a normal graph in your partograph is that the graph must be maintained on the right side of the alert line, but should not pass through the action line. Bakit po? Once that will pass through the action line, ibig sabihin mabagal mag-dilate yung cervix, kailangan mo nang i-notify yung physician. Yes or no? Pero pag yan naman, for example, ay nandun sa alert line, ibig sabihin, or on the left side of the alert line, ibig sabihin, mabilis mag-dilate yung cervix anytime baka lumabas yung bata, you need to prepare for possible imminent delivery. Yes or no? Yes po. Very good, sir. Pag itong green, for example, ba kailangan ng isi-yes yung bata? Yes or no? Yes po. So again, guys, what are the 3 principles? Remember, in the use of your partograph, number 1, we use the partograph starting at how many centimeter? We start at 4 centimeter dilation. Yes or no? Yes po. And what is the recommended frequency of your internal examination? Every 4 hours. Yes or no? Yes po. And where should be the graph located? On the right side or the left side of the alert line? On the right side of the alert line, but should not pass through the action line. Yes or no? Yes po. Maliwanag po. That will now be your partograph. Sige guys. Example lang tayo ha. Example. Alright? Sige po. Nurses, try to graph this one. I think I have provided you an extra graph in your handouts. Sige. For example, let's say, ito yung situation for example. Nag-start siya for example ng 1 a.m. The woman now is at 4, sige, ito na lang. 1 a.m., the woman now is at 4 centimeter dilation. Then at 5 a.m., saan po makikita yung handouts po? Nasa Google Class po ninyo, ma'am. Nasa Google Class po ninyo. Okay? 5 a.m., Google Classroom po. 5 a.m., it is now, for example, let's say at 6 centimeter. Then after 9 a.m., it is now at 7 centimeter. Guys, question, continue monitoring or report to the physician? Continue monitoring or report to the physician? Ano pong sagot ng ating mga registered nurses? Okay, so 1 a.m., 2 p.m., 3 p.m., 4 p.m., 5 p.m., 6 p.m., 7 p.m., 8 a.m., 9 a.m. Ano natin? 1 a.m., nasan siya? 4 centimeter. 5 a.m., nasan siya? 6 centimeter. 9 a.m., nasan siya? 7 centimeter. Nandito, guys. Tumawid ba siya ng inyong action line? Yes or no? Yes po. Therefore, tumawid siya ng action line, report to the physician, kailangan ng action. Yes or no? Ibig sabihin, baka tumigil, mag-dilate yung cervix. So that will be your modified WHO partograph. Yes or no? Yes po. But again, guys, one more time. Remember, normally, the cervix will dilate 1 centimeter per hour. Again, guys, normally, the cervix will also dilate 1 centimeter per hour po. Again, normally, the cervix could dilate 1 centimeter per hour. Okay? Sige po guys, copyhin mo, screenshot mo, ililipat na po natin in 5, 4, 3, 2, and 1. Okay? Sir, paano pag saktong 8 centimeter dito sa, dito, ay wait lang. Padahin ko pa. Okay, pag 8 centimeter guys, okay pa po tayo dyan. Basta hindi siya lumagpas dun sa alert line. Yes or no? Yes po. Okay? 4 centimeter. Tapos napunta ng 8 centimeter. Kung titignan mo dito guys, 4 centimeter, 4 centimeter, 5 centimeter, 6 centimeter, 7 centimeter, 8 centimeter, parang sakto. Pasok tayo dun sa 1 centimeter per hour dilation. Yes or no? Yes pa. Okay? Alright. Sige. Very good. 8 a.m., 7 centimeter. 8 a.m., 7 centimeter. Remember, pag normal pregnancy po yan, ma'am, usually we do it only every 4 hours. Yes or no? Yes. But in case, for example, talagang may mga abnormalities, we may perform the cervical examination more frequent than that. Okay? But again, pag nag-pass through sa action line, basta yun na, dun po tayo mag-action. Okay? Ayan. Should not pass through the action line. Okay? Ayan. Sige. Copyhin mo na po. Copyhin mo na. Screenshot mo na. Ililipat ko na po in 5, 4, 3, 2, and 1. Okay? Alright. Sige, diretso po tayo. Alright. Now, questioner says, when is now the usual time for rupture of your membranes? Ano pong sagot ng ating mga registered nurses? Kailan po ba talaga sumasabog ang panubigan ng isang babae? Normally, usually, when is the usual time for rupture of membrane? Kailan po lang dapat talaga sumabog yung panubigan ng babae? The answer, guys, please take note. Very good, ma'am. When the cervix is fully dilated or on the early second stage of your labor. Diyan lang po dapat sumasabog ang panubigan. With the cervix fully dilated or the early second stage of labor. Sir, paano pag sumabog yung panubigan pero yung babae hindi pa nag-labor? That is now your premature rupture of your membranes. Yes or no? Yes po, maliwanag. Okay, sige po guys. Copyhin mo screenshot mo, ililipat po natin in 5, 4, 3, 2, and 1. Okay na? Okay, lipat ko na ha, and let's go. Now, the second stage of labor is now, of course, your fetal expulsion. Yes or no? Yes po. Your fetal delivery. Alright? For primipara, that will be around 1 hour. Ay, ano ba yun? Primipara, that will be around 1 hour. Ay, ba't ganun? Kulay green. 1 hour. But for multipara, that will be about 30 minutes na lang po siya. Okay? Alright. So again, kailangan mo malaman yung mga time. Again, nurses, for the first stage of labor po. First stage of labor, what is the maximum duration po? Pag primipara, first stage, average maximum duration, 14 hours. So, but pag multipara, 8 hours po. Okay, ngayon naman, pag second stage, primipara, 1 hour, multipara, 30 minutes. Again, guys, you need to know the normal duration of each phase or each stage. Bakit? Again, pag alam mo yung normal, alam mo agad kung merong abnormal. Yes or no? Yes po. Okay? So, what are now the cardinal movements of your labor? Again, alam mo na yan, your engagement, descent, flexion, internal rotation, extension, internal rotation, and expulsion. Guys, look at the image on the right side of your screen and go. Okay, so nag-engage na siya, nagdi-descent na rin po siya, at naka-flex na yung ulo ng bata. Okay, now baby, internal rotation. Internal rotation. Very good. Next, extension. Extension. Labas ang ulo. External rotation. And then expulsion. Guys, balikan natin na one more time. Tignan mo kung kailan ang delivery ng fetal head. Again, you need to know when is the delivery of the fetal head. Engagement ba, descent ba, flexion, internal rotation, extension, ER, or expulsion. Tignan mo guys ha, kailan yung delivery of fetal head? Internal rotation. Dali. Next, extension. External rotation. Guys, what cardinal movement of labor is the delivery of the fetal head? Ano pong sagot ng ating mga registered nurses? When is the fetal head being delivered? Very good. That is now your extension. Yes or no? Yes po. Delivery of the fetal head. It happens during your extension. Okay? Very good. Sige po, guys. Copyin mo. Copyin mo, copyin mo. Screenshot mo. Screenshot mo. Ililipat po natin. Ililipat po natin in 5, 4, 3, 2, and 1. Again. Therefore, pag nakita mo for example sa tanong sabi niya, during extension, what will be the appropriate action of the nurse? Ibig sabihin guys, sa tanong doon, during the delivery of the fetal head or during the extension, yes or no? Yes po guys. Again, balikan mo kanina yung ating tawag dito, Leboyer method of delivery. Are we allowed to pull the head of the baby? Yes or no? The answer is no. Yes or no? Yes po. So don't pull the head during extension. Ano ang gagawin mo guys? Ito ngayon ang sagot mo sa board exam. During the extension or during the fetal head delivery, ito po ang gagawin mo. Nurses, you are going to use one hand to pull the chin from between the maternal anus and the coccyx. Then, using the other hand on the fetal occiput to control the speed of delivery. Therefore, wag mo siyang hilain. Actually, i-control mo siya. Oops, baby, dahan-dahan lang, wag biglang lalabas, wag biglang lulusot, baka masira, baka mawakwak yung pepe ni mother. Yes or no? Yes po. And guys, top-notchers, this is now what we call as your modified Ritgens maneuver. Yes or no? Again, this is what we call as your modified Ritgens maneuver. Maliwanag po tayo dyan. This is what we call as your modified Ritgens maneuver. Okay? So again, what is modified Ritgens maneuver? Modified Ritgens maneuver is performed during the fetal head delivery. Yes or not? Yes po. By using one hand, pull the fetal chin from between the maternal anus and the coccyx and the other hand on the fetal occiput. In short, modified Ritgens maneuver is you are going to simply support or apply gentle pressure on the head of the baby upang hindi siya biglang lumusot or bumulwak para hindi masira yung pekpek ni nanay. Yes or no? Support or apply gentle pressure to the fetal head during extension. Yes or no? Yes po. Sir, bakit po? Ano yung purpose nito? To prevent your perineal laceration. Yes or no? Again, nurses, what is the purpose of your modified Ritgens maneuver? You answer, to prevent perineal lacerations po. Again, to prevent perineal lacerations. All right? Modified Ritgens maneuver to prevent your perineal lacerations. Okay, sige po nurses, copyhin mo na. Copyhin mo na, don't forget, your modified Ritgens maneuver. Lipat ko na nurses, lipat ko na. Sige po, screenshot mo. Screenshot mo. Ililipat po natin in 5, 4, 3, 2, and 1. Okay na? Okay? Sige, diretso po tayo and let's go. Okay. Third stage na ngayon tayo is delivery of the placenta naman po. Guys. So for the duration, for both preemie and multigravida, usually around 5 to 15 minutes po tayo dyan. Alright? And during the third stage, guys, remember, umuusli yung umbilical cord. Again, umuusli yung umbilical cord. That will now be your mnemonics. Usli. Okay? Huwag mong pagbalik rin yan. Bakit po? Usli. The uterus becomes firm and globular. That will now be the first sign of placental separation. Okay? And this is what we call as your Calkins sign. Okay? Followed by the sudden gush of fluid, then lengthening of the cord. Lengthening of the cord, this is now the most definitive sign. Ibig sabihin, guys, before ka mag-placental delivery, kailangan munang magkaroon ng lengthening of the cord. You need to wait for the cord to lengthen before you are going now to perform the different maneuvers in the delivery of your placenta. Sir, ano ngayon yung mga different maneuvers in the delivery of the placenta? Okay. Number 1, guys, itong nasa taas, okay, this one, the picture on top, ito po yung tinatawag natin na Brandt-Andrews maneuver. Again, your Brandt-Andrews maneuver. Brandt-Andrews. Ayan. Brandt-Andrews maneuver. Paano po ba ginagawa, sir, yung Brandt-Andrews maneuver? You are going to exert upward pressure in the uterus, then you are going to apply gentle traction in the cord para ma-deliver mo yung placenta. Okay, ayan, gaganon mo yung uterus. Tutulok mo siya pataas. However, we have another maneuver being done. And that will be your Creed's maneuver naman po. Creed's maneuver. Sir, ano naman po yung aming Creed's maneuver? Ito naman po ang inyong Creed's maneuver ngayon. You are going to apply gentle pressure in the contracting uterus, then you are going to apply gentle traction on the cord. It will be your Brandt Andrews and Creed's maneuver. Sir, ano po usually yung mas maganda daw? Mas maganda daw guys dito is your Creed's maneuver. Okay? Bakit po? Yung Brandt Andrews mo pwedeng magkaroon ng injury, yes or no? Kasi ginaganon-ganon mo yung uterus, yes or no? Baka magkaroon ng laceration or whatsoever. So Creed's maneuver is more recommended compared to your Brandt Andrews. But one thing is for sure guys, be it Brandt Andrews maneuver, again, be it Brandt Andrews maneuver or be it Creed's maneuver, one thing is for sure, do not actively pull the cord or the placenta. Huwag mong hilain. Yes or no, measures? Do not actively pull the cord or do not actively pull the placenta. You're only going to apply gentle traction. Iganon mo lang siya para hindi siya para hindi siya bumagsak, yes or no? I-straighten mo lang siya, pero wag mong hilain, yes or no? Let the placenta separate naturally. Paliwanag po tayo. Again, Creed's maneuver and your Brandt Andrews maneuver. Okay? Sige po. Nurses, copyhin mo. Copyhin mo. Screenshot mo. Ililipat po natin in 5, 4, 3, 2, and 1. Okay na po tayo? Sige po. Copyin mo one more time in 5, 4, 3, 2, and 1. Okay na tayo ha? Sige po. Burahin ko and let's go. So again, nurses, anong maneuver yung ginagamit pag fetal head delivery? We call it your modified Ritgen's maneuver. Okay? Pero pag placental delivery, we have your Brandt Andrews maneuver and Creed's maneuver. So don't make pagbaliktad nung tatlo. Yes or no? Yes po. And on the delivery of your placenta, nurses, take note, we have your Duncan's and we have your Schultz mechanism. Okay, so for Duncan's mechanism, it's separated at the edges. Kaya ganyan po yung itsura niya. Madumi. Dirty side. Yes or no? Again, the dirty placenta. Ayan. Kasi nung separate sa gilid, ang lumabas, yung dugyot, yung mga maternal blood vessels. Okay, pero pag Schultz, the shiny side, yes or no? Bakit po shiny? Paglabas, dun sa gitna nag-separate, paglabas, yung fetal side, yung lumabas. Shiny side, yes or no? Yes po. So, again, remember our mnemonics here, dirty is the Duncan's, yes or no? Yes po. And Schultz is the shiny, yes or no? Or sometimes, sabi nila, Duncan's is the maternal side. Duncan's is the maternal side, while Schultz is the fetal side naman po. Alright, so that will be your placental separation. Okay? Sige po, nurses, copyhin mo na po, screenshot mo, ililipat po natin. In 5, 4, 3, 2, and 1. Okay? Go. Next. Okay. Your oxytocin and ergometry. Okay. Ito guys, tanong natin dito. Oxytocin and ergometry. Question, nurses. When do we give your oxytocin? After placental expulsion or after cutting and clamping of the cord? Ano pong sagot ng ating mga top-notchers? Very good. Usually we give oxytocin, that is after placental expulsion or after cord cutting or clamping. Usually we give that one after cord clamping or cutting. Yes or no? Yes po. In some institutions, after delivery of the baby, they already give the oxytocin. Yes or no? Yes po. How about ergometrin, guys? Ergometrin. When do we give ergometrin? Before delivery of the placenta or after delivery of the placenta? Very good. After placental delivery. Yes or no? Yes po. Okay, sir. Bakit po ganyan? After placental delivery. Ergometrin is your methergine. Okay? Ergometrin, methergine. Oxytocin. Remember guys, Ano bang pinagkaiba, Sir Ken, ni oxytocin at ergometrin? Oxytocin, nurses, please take note, that will cause natural contractions, or that will produce natural contractions to prevent, nurses ngayon, or to prevent your hemorrhage, for example. Yes or no? Yes po. Okay. But your ergometry, nurses, please take note, this will now cause sustained strong contractions. Okay, again, oxytocin, natural contractions. Ergometrin will cause sustained strong contractions. However, your ergometrin can close the cervix. Again, it can close the cervix. Yes or no? Yes, for this reason, bakit po pag ergometrin, methergine, we only give it after placental delivery. Why? It can close the cervix because of the sustained strong contractions. Yes or no? Yes po. So again, anuman ang sobra ay masama. Yes or no? Yes po. Remember, in normal delivery, the contractions of the uterus will also aid in the dilation of the cervix. Pero, pag nasobrahan naman po yung contraction, it can cause naman closure of the cervix. Yes or no? Yes po. So, naman ang sobra, bawal. Yes or no? So again, ergometrin, methergine is only given after placental delivery because the sustained strong contractions can close the cervix. Therefore, we will not be able to deliver the placenta. Yes or no? Yes po. Maliwanag po. Okay? Your oxytocin and your ergometry. Alright? Sige po, guys. Copyhin mo. Copyhin mo na po. Copyhin mo. Screenshot mo. Ililipat po natin in 5, 4, 3, 2, and 1. Okay na? Okay, sige po. Alright, go. Wait lang guys ha, mag-charge lang ako. Baka mawanta ng internet. I'm using my phone kasi for the internet. Kasi yung Converge dito sa Mandaluyong ay sobrang hina. Hindi kaya ng Zoom. Sino po na Converge dyan? Is there anyone of you from Mandaluyong na gumagamit ng Converge? Nakakagigil. Mahina. Hindi siya kaya yung Zoom natin. Wait lang. Okay guys, let's continue. Ano yung Pangasinan po ma'am? Pangasinan? Ano yung Pangasinan? Pangasinan sir, pero may deco na gamit? Ano yung deco? Sir, ano po Converge? Okay. Dito sa Mandaluyong ang hina, promise. Globe po sir, maganda sa Totoo ba Globe? Hindi, kasi I think depende rin po sa lugar. Kasi yung Globe dito, sinubukan ko mahina. Sa may bandang malapit sa Shangri-La. Ang problema kasi dito sa lugar, guys, I'm here kasi malapit sa Mega Mall. Yung tawag dito, yung malapit sa Mega Mall na lugar, yung Highway Hills, ganun. Ang nangyari kasi yung mga condominium dito, pag-aari ng SM, tama po ba? Oo. Kapitbahay ko yung mga condominium na malalaki, yung mga condominium dyan na mahaba. Kasi mga condominium. Ang ginagawa kasi ng mga condominium ngayon dito, guys, pag ang may-ari, for example, ng yung condominium, for example, SMDC, ang ginagawa nila, binablock nila ang SMDC feeling, ang alam ko, Smart ba yan or Globe? Basta ang ginagawa nila, guys, kung ano yung sister company nila na tawag dito, na network, yun lang yung pwede mong gamitin. Kasi naglalagay sila lang yung pamblock. Anong ginagamit? Anong tawag doon? Yung signal blocker, signal jammer. Oo, yun yung ginagawa ng mga kondong iba dito. Naglalagay ng signal jammer. Kaya pati yung ibang tao na haharang, yes or no? Yes po. PLDT po, okay dito sa bandang San Juan, sabi niya. Okay, sige. Alright. Congested na siguro. Opo, congested na kasi. Sir, ask ko lang po para saan po yung carboprost? Carboprost guys, carboprost. Carboprost, this is your prostaglandin po. Carboprost is your prostaglandin. Usually ginagamit po ito pampalambot ng cervix naman po. Carboprost, prostaglandin, pampalambot po ng cervix. Yung mga yupang po na may duty, okay lang po. If you need to go na po, sige lang. Anyway, this is recorded naman po. Okay, yung mga yupang na may duty, ingat po kayo sa duty ninyo. Okay? Ayan, sige. Wait lang, may question pala dito. Anong tanong dito? Dosage daw. For oxytocin, usually that is 10 units of oxytocin. 10 units of oxytocin IM. For ergometry naman po, depending on the need po. Kung gaano kalakas yung kailangan mong contraction, usually that is around, ilan ba yun? 200 micrograms po. 200 micrograms. IM din po. But if needed ng mas malakas, then we could add those depending on the need po. Okay? Sige. Alright, sige po. Sir, di po pala ma-play yung recorded video kahapon, wrong password po. Ay, Ma'am Bell, pa-check na lang po yung recorded daw po kahapon, hindi po ma-play. Guys, any concerns? Please send a message to Ma'am Bell, okay? Because I don't have any access po to the recording po. Yung mga REs lang po mayroong access sa recording natin. I don't have any access po dun sa recording, okay? Alright, sige. Sir, okay lang po ba ma-take yung post-test bukas? Pass na lang po si Ma'am Bell. Ma'am Bell, ilang oras po ba yung post-test? Yung pwedeng 24 hours naman po yun, ma'am, di ba? Yung post-test?
Anytime naman po. Kaso po nirarasyo yung post-test. Need po nila sagutan on time para makasabay po sa rasyo.
Ay, sa Russia. Okay po, sige. Thank you. Okay. Alright, guys. Sige, copyin mo na po. Libat ko na in 5, 4, 3, 2, and 1. Okay? Sige. Alright. Malapit na tayo matapos, guys. Then, later on, we'll start with your abnormal OB. Okay? Involution. Now, involution, nurses, is now the return of the reproductive organs to its pre-pregnant state. Again, involution of the sir, ako po after na wala pong Diyos kanina. Okay, sige. What time po ratio? Ay, sige po. Ma'am Bell, pa-check na lang po ng mga concerns nila. What time po ratio? Yung ratio po, ma'am, is after ng lecture. Guys, I might be finished with the lecture mga 5 o'clock. Then, siguro I'll give you 20 minutes for the post-test. Then, siguro mga 10 minutes na for the ratio. Anyway, we are just done with the lecture. So, there is no need for a comprehensive ratio naman po. Siguro, by 5:30, we are done with the ratio na po. Okay? Alright. Let's have the return of the reproductive organs to its pre-pregnant state, nurses. Ayan, pagbaba ng uterus. How are we going to promote this one, sir? And number 1 is your breastfeeding. Another is your uterine massage. Sir, why breastfeeding and uterine massage? Because this can contract the uterus. Yes or no? Yes. But remember guys, pag nag-breastfeed ka, na-stimulate ang oxytocin. Yes or no? Again, top notchers, breastfeeding could stimulate as well the production of oxytocin and that could contract the uterus. Yes or no? Yes po. Then number 3, guys, I would like you to put a big star on number 3. You have to empty the bladder. Again, empty the bladder, sir. Why do we need to empty the bladder? Remember, nurses, if this is, for example, your bladder, the urinary bladder, the uterus is located just behind the bladder. Yes or no? Yes po. Therefore, pag puno yung bladder mo, baka hindi mag-contract yung uterus. Pag puno yung bladder mo, baka hindi makababa ang uterus, therefore magkakaroon ng sub-involution. Therefore, upang bumalik yung uterus doon sa kanyang original position, kailangan po empty yung bladder. Let the woman void. Alright. Bingo, guys. This will now be the normal location of your fundus. Okay. After placental delivery, again, it says, after your placental delivery, tandaan nyo po, it will be below the level of the umbilicus. Nandito siya banda. Okay? Yung kulay green po. Okay, kulay green. Below the umbilicus. Diyan siya. Pero, after placental delivery, yung kulay blue, mali. Kulay blue. Bakit ganon? Hindi siya nagbabago. Ito naman. It will now between the umbilicus and symphysis pubis. Okay, pero 1 hour after delivery, guys, anong gagawin niya? Babalik siya on the level of the umbilicus or below the umbilicus. Yes or no? Yes. So that is the movement of your fundus right after your delivery. Again, top notchers, fetal delivery, nandito below the umbilicus. After placental delivery, between the umbilicus and symphysis pubis. But 1 hour after delivery, bumabalik doon sa level ng umbilicus or below the level of the umbilicus. But guys, take note, it should never be above the level of the umbilicus. I repeat, it should never be above the level of the umbilicus. Guys, sir, bakit po siya bumabalik doon sa umbilicus? For example, it says, nag-deliver ng baby. Delivery of the baby, bumaba yung uterus. Delivery of the placenta, lalong bumaba. 1 hour after, anong sabi ng uterus? Ay, salamat naman, natapos din ang panganganak. Nakapag-relax siya ngayon, nakahinga siya ngayon, bumalik siya doon sa level of the umbilicus or below the level of the umbilicus, but should never be above the level of the umbilicus. Yes or no? Bakit? If it is above the level of the umbilicus, ibig sabihin, hindi siya bumabalik doon sa kanyang normal position. Yes or no? Yes po. Okay? Top notchers. For example, ngayon ito yung sabi sa tanong. Question. 3 hours, again, 3 hours after the delivery or 3 hours after birth, the postpartum woman's fundus is palpated 3 inches above the umbilicus. What will be the appropriate action of the nurse? A, document and continue monitoring, or B, encourage the mother to void? Ano pong sagot ng ating mga registered nurses? A or B? Okay, very good. The correct answer is B. Put a big star, guys. Huwag mong kakalimutan yung ating empty the bladder. Pag ang uterus after delivery is above the level of the umbilicus, ang pinakauna mong gagawin, encourage the mother to void or let the mother empty the bladder. Bakit? Baka siguro mataas yung kanyang uterus dahil puno yung kanyang bladder dahil hindi pa siya umihi. Bakit po? Remember guys, one of the side effects of your epidural is the inability to void. Paliwanag po one more time. One of the side effects of epidural anesthesia is the inability to void. Therefore, if the woman, for example, have received epidural during delivery and the fundus now is above the umbilicus and the woman cannot void, ano po ang pwede mong sabihin? You can catheterize the woman. Yes or no? I-catheter mo siya to empty the bladder. Yes or no? Yes po. Maliwanag po tayo dyan. Okay? And lastly, of course, note that the fundus goes down 1 centimeter per day. Okay? Sige po. Nurses, copyhin mo na po, screenshot mo. Alright? So, ganda rule. After delivery, the fundus should always be below the level of the umbilicus but never above the level of the umbilicus. If it's above, empty the bladder. Alright? Moving forward, guys. Moving forward. Screenshot mo. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay? Go. Now, let's have your lochia, nurses. For your lochia, guys, this will now be your lochia rubra, lochia serosa, and your lochia alba. Lochia rubra. This is color red. Serosa is color pink. Alba is color white. Yes or no? Yes po. Red, pink, and white. All right, top notchers. I'll give you a magic number, sir. What will be our magic number? Your magic number here nurses, is your magic number 4. Okay, para hindi kami lapan. Magic number 4. Bakit po, sir, 4 yung magic number? Lochia rubra is 1 to 4 days. Lochia serosa is 4 to 10 days. Lochia alba is 10 to 14 days. Again, Lochia rubra is 1 to 4 days. Lochia serosa is 4 to 10 days. Lochia alba is 10 to 14 days. The magic of your number 4. In short, top notchers, your lochia, the normal lochial flow, usually that will last for how many weeks? Usually, this will last for 2 weeks. Yes or no? Yes po. Paliwanag po tayo. That's normal. Okay? Na magkaroon ng lochia for 2 weeks. Okay? Your normal vaginal discharge 2 weeks after birth. Okay? And the odor will be a non-foul smelling odor. And the normal amount, another big starter says, is to 4 to 8 pads per day. I repeat, 4 to 8 pads per day. In 24 hours, divided by 8, that will give you 3. Yes or no? Yes po. Therefore, on the early stage postpartum, when or what is the normal frequency of changing pads? Usually, that will be every 3 hours, and that is again perfectly normal. Yes or no? If the woman, for example, is changing her pads every 3 hours after birth, that is perfectly normal. Yes or no? Yes po. Remember, 4 to 8 pads per day is normal. But if the woman, for example, is changing her pads every 1 hour, that is now abnormal. Yes or no, ganda pressures? Normally, changing of pads will be every 3 hours, a total of a maximum of 8 pads in 24 hours. Maliwanag po tayo dyan. Okay? Sige po guys. Copyhin mo. Copyhin mo. Screenshot mo. Screenshot mo. Ililipat po natin. Ililipat po natin. In 5, 4, 3, 2, and 1. Okay na? Okay, let's go. All right. And of course, we have your postpartum psychological adaptation naman. Okay? Now, for this one, guys, we have your taking in, taking hold, and letting go. Okay, taking in phase is the woman is still internalizing. Ay, ini-internalize ko na yung nangyari. And the woman's here is passive and self-centered. Ito ngayon, top notchers, yung mga pagkakataon ngayon na sobrang demanding ng pasyente mo. Bakit sobrang demanding? Kasi nga ini-internalize ko na yung nangyaring trauma ng kanyang panganak. Yes or no? Yes po. Pero pag taking hold na po, taking hold of the responsibility. Again, taking hold of the responsibility. This is now when the woman strives to learn the task of being a mother. Yes or no? Yes po. Okay? In short, for taking in, the woman is dependent. Okay? For taking hold, the woman strives to be independent. Again, the woman strives to be independent. Pero pag letting go, dependent na po siya. Yes or no? Yes. Independent na po siya. Letting go of the past, letting go of the former role. Yes or no? Yes. And for this one, guys, bingo, taking in is 1 to 3 days. Taking hold is 3 to 10 days. Or should I say 3 to 9 days? Sige pa, pati kami. 3 to 9 days. And letting go is 10 days to usually 6 weeks. That will now be your letting go. Okay, 10 days to 6 weeks of your letting go phase. Okay? Therefore, guys, for example, sabi doon, a woman 2 days postpartum is dependent to the nurse. Normal or abnormal? Ano pong sagot ng ating mga registered nurses? Still, that is normal. Tandaan mo po, on the first 3 days after delivery, normal lang na super demanding ng babae. Self-centered, passive. Pero dapat, on the 3 to 9 days, the woman should start becoming independent. Yes or no? Yes po. Maliwanag po tayo dyan. Okay? Taking in, hold, letting go. Guys, parang pag-ibig mo lang din sa ex-boyfriend mo. Yes or no? Yes po. Taking in, tinanggap mo siya ng buong buo. Nag-Trendelenburg position ka. Taking hold, pinanghawakan mo lahat ng pangako niya sa'yo. Pero sa bandang huli, kailangan mong mag-let go. Bakit? May mahal na siyang iba. Yes or no? Yes po. Taking in, taking hold, and letting go. Yes or no? Yes po. Okay? Sige po. Copyhin mo na. Screenshot mo na. Ililipat ko na po. In 5, 4, 3, 2, and 1. Okay, I guess we're done with your normal obstetrics. Yes or no? Yes po. Again, top notchers of Top Rank Review Academy. Do you still remember your latent active transition? Yes or no? Yes po, guys. Tell me now if it's L, A, or T. Latent active transition. Administration of epidural anesthesia. Epidural anesthesia. Active. Let the mother walk. Latent. How about 3 centimeter dilation? 3 centimeter dilation. Latent. How about contractions are occurring every 3 minutes? Contractions are occurring every 3 minutes. Transition. How about the duration of contractions is 40 to 60 seconds. Active. Guys, are we allowed to let the woman push on the first stage of labor? The answer is no. But if the woman, for example, now have Ferguson's reflex, uncontrollable urge to push, or the woman wants to go to the bathroom, what will be the appropriate nursing action? If there's urge to defecate, anong gagawin mo? Check the perineum for possible crowning. Nurses, at what centimeter can we start using now the WHO modified partograph? 4 centimeter during the active phase. And what is the recommended frequency of IE to prevent infection during labor? Every 4 hours. And for the partograph to be normal, interpreted as normal, where should the graph stay? On the right side or the left side of the alert line? The left or the right side of the alert line, but should not pass through the action line. Yes or no? Yes po. Okay, very good. Top notchers bingo. When is again the usual time for the rupture of your membranes? When the cervix is fully dilated or early second stage of your labor. Yes or no? Yes po. Very good. Top notchers of Top Rank Review Academy. How do you call again the maneuver used in the delivery of the diba? Ayan kasi. Wala pa kasi yung tanong, sumasagot na naman. Again guys, the maneuver used in the delivery of your placenta by applying gentle pressure on the top of the fundus while delivering the placenta. Modified Ritgens, Brent Andrews, or Creed's maneuver? Very good. Your Creed's maneuver. Yes or no? And how do you call now the maneuver wherein you are going to support the head of the baby during extension to prevent your perineal laceration? Okay, very good. That will be your modified Ritgens maneuver, guys. When do we again give your ergometrin, Metergine? Before or after placental delivery? After. Why? What type of contractions will it produce? Strong or natural contractions? Strong, sustained contractions that could close the cervix. Yes or no? Therefore, give it only after placental expulsion. Bingo! The nurse palpated the fundus 2 hours after delivery below the level of the umbilicus. A. Continue monitoring, or B. Report to the physician. Very good. Continue monitoring. It should always be at the level or below the umbilicus, but never above the umbilicus. Bingo. On the 7th day postpartum, the lochia is color bright red in appearance. Normal or abnormal? 7th day postpartum, the lochia is bright red in appearance. Normal, abnormal? Abnormal. Bakit? It should already be pink. Yes or no? Yes po. Bright red could indicate now your possible bleeding. Yes or no? Bingo. The woman now, 1st day postpartum, is changing her perineal pads every 4 hours. Normal or abnormal? Still, it's normal. Yes or no? Yes. Remember, every 3 hours is normal, every 4 hours okay lang. Basta, hindi siya dapat every 1 hour. Yes or no? Yes. Remember, 4 to 8 pads per day is normal. Yes or no? The woman now, on the 10th day postpartum, doesn't want to feed the baby, and the woman is depending on her mother. Normal, abnormal? Abnormal na po. Bakit? Baka may postpartum blues siya. Yes or no? Yes. So bakit po? Remember, from the 3rd to the 9th day, dapat the woman now is becoming to be independent. Guys, nakita nyo po yung ating ginawang technique. Yes or no? Yes po. Pag alam mo ang normal, mabilis sa'yo malaman pag something is abnormal. Yes or no? Yes po. That is one of the techniques that you have to remember in your obstetric nursing po. Okay? What is normal and what is abnormal. Okay? Bingo, guys. The woman's fundus 2 hours after delivery is above the level of the umbilicus. Document or void? Void. Yes or no? Yes po. Ask the woman to void. Okay, very good everyone. Guys, same with our activity yesterday. Alin ang naiba. Okay? Go, top notchers. Alin. Ay, meron pa pala. Bakla ka ng toon. Napaya pa ako doon. Alright, nurses, breastfeeding, top notchers. Breastfeeding, ano ba yan? Okay, for breastfeeding guys, kailan po ba? Ay, wait lang. Nakalimutan ko to. Next slide ako. Resumption of sexual intimacy. Guys, take note ha. When is the resumption of sexual intimacy? Sige po. Let me quote my reference here. According to Lippincott nurses, the best time to resume your sexual intimacy is when the pain and lochia have stopped. Again, nurses, according to Lippincott, when to resume your sexual intimacy, the answer is when the episiotomy pain, if ever man naman ang episiotomy, is when the episiotomy pain and the lochial flow have stopped. And remember, lochial flow, that is around 2 weeks, yes or no? Yes. So again, we resume sexual intimacy when the lochial pain and the lochia, or when the episiotomy pain and the lochia have stopped. Maliwanag po tayo. Check. Okay? Sige. Lipat ko na. Guys, don't forget this one, ha? A common question po yan. When do we resume sexual activity? When the episiotomy pain have stopped and the lochia have stopped. All right? Then last na lang po, breastfeeding. For breastfeeding women, guys, kailan daw po bumabalik yung menses? That is around 3 to 6 months po. Right? But for non-breastfeeding women, kailan po bumabalik, Sir Ken? That is around 1 to 2 months. Sir, bakit po pag breastfeeding, mas mabagal yung pagbalik ng menses? The answer, guys, is because if the woman is breastfeeding, there is high production of your prolactin. Again, prolactin. And prolactin will inhibit the menstrual cycle or will inhibit the normal cycle. Yes or no? Yes. But that will now be your breastfeed. Again, for breastfeeding, mas mabagal po yung pagbalik because prolactin would inhibit your normal female reproductive cycle. Maliwanag po tayo siya. Okay? Sige guys. Copyhin mo na po. Copyhin mo na. Screenshot mo na po. Lilipat ko na po. In 5, 4, 3, 2, and 1. Guys, question. Are you familiar with your lactation amenorrhea method? Yes or no? Lactation amenorrhea method. Are you familiar with this one, guys? Yung sinasabi nila, para hindi ka daw agad mabuntis, kailangan mong magpasuso. Yes or no? Sabi nila, guys, nurses, top notchers, sabi nila, para hindi ka daw agad mabuntis, kailangan mong magpasuso. Yes or no? Yes po. Kasi nga, pag hindi ka nagpapasuso, kasi nga, pag nagpapasuso ka, hindi ka rereglahin agad. Yes or no? Yes po. Question, guys. Is this a fact or a bluff po? Lactation amenorrhea method. Is it reliable or unreliable? Guys, remember, this is not reliable. Yes or no? This is a bluff. Yes or no? Yes po. Bakit po? Hindi totoo. Kaya, nurses, dumadami ang ating populasyon kasi mali ang paniniwala ng karamihan sa atin. Yes or no? Lalo for example sa mga far-flung communities. Oy, magpasuso ka ha? Magpasuso ka para hindi ka mabuntis. Anong ginawa ng babae? Nagpasuso ng baby sa umaga, sa gabi. Yung asawa yung nagsuso, tapos tinira siya. Anong nangyari? Biglang nabuntis ulit. Yes or no? Yes po. Bakit po? Anong sabi nila, guys? Even though magpasuso ka, nurses, kahit hindi ka reglahin, pwede ka pa rin mag-ovulate. Yes or no? Again, nurses, even though hindi ka nireregla, pwede ka pa rin mag-ovulate and that could still cause your pregnancy. Yes or no? Yes po. So guys, again, this is not reliable form of your contraception. Even though nagpapasuso ka, still, pwede ka pa rin mabuntis. Kahit hindi ka nireregla, pwede nag-ovulate ka. Maliwanag po tayo dyan. Alright, sige po guys. Moving forward, guys, screenshot mo na. Screenshot mo na po. Ililipat po natin. Ililipat po natin in 5, 4, 3, 2, and 1. Okay, sino yung pasulot? Wait lang. Bakit gano'n? Ina. Okay, go. Everyone. Alin ang naiba? Alin ang naiba? Alin ang naiba? Alin ang naiba? Okay, everyone, please key in your answers. Alin ang naiba? Alin ang naiba? Okay, very good. Bakit po? Correct. Mali po ang right side. It must be left side. Yes or no? Yes po. Okay, very good everyone. Next one, moving forward, diretso po tayo. Alin ang naiba? Alin ang naiba? Okay, alin ang naiba? Alin ang naiba? Guys, go. 180 beats per minute. Normal or abnormal? Abnormal. Dapat 120 to 160. Increase of 5 beats per minute when the fetus move. Normal, abnormal? Abnormal. Dapat 15 beats per minute. Yes or no? Yes po. Okay. 6 movements in 1 hour. Abnormal. Dapat 10 to 12 movements per hour. Contraction stress test yields a negative result. Normal or abnormal? That is your normal result. Correct answer? Tell us. Yes or no? Yes po. Okay. Very good everyone. Moving forward. Diretso po tayo and go. Okay. A. Tetanus toxoid diphtheria. B. Measles and rubella. C. Rabies and hepatitis B. D. Influenza and COVID-19 vaccine. Okay, very good. Bakit po B? Indicated or contraindicated ang B? This is the only contraindicated during pregnancy. Yes or no? Yes. Very good, top notchers. Don't forget your third. Okay. Next. Decrease maternal energy, ripening of the cervix, urinary frequency, and relief of your dyspnea. Okay, very good. There must be an increase in the maternal energy. These are the prodromal or premonitory signs of your labor. Maliban sa decrease, but be increased. Okay, very good. Next. Increase duration of contractions, progressive cervical dilatations, pain that is confined in the abdomen, decreased interval of contractions. Answer? Very good. Letter C. Bakit po? All others are signs of true labor except your letter C. Why? It must be radiating from the back to the abdomen. Your girdle-like pain. Yes or no? Yes po. Okay, very good everyone. Let's have the next question. Okay? How about this one? Start using the WHO modified partograph at 2 centimeter dilation. It must be done every 4 hours. The graph should remain on the left side of the alert line. It must be used only on the transition phase of labor. Oh, guys. Huwag mong madali. Huwag mong madali. Okay, guys. 2 centimeter, correct or wrong? Mali. Dapat 4 centimeter. Yes or no? Yes po. Transition phase, correct or wrong? Hindi pwede. Dapat active phase. Left side, correct or wrong? Mali. Dapat right side of the alert line. 4 hours, correct? Correct. B is the only correct answer here. Yes or no? All other options are correct. Okay? Very good. Moving forward, next po tayo. Okay. Cut the cord immediately after delivery. 2. Apply gentle pressure to the fetal head during delivery. Gently pulling the cord immediately after the uterus becomes firm and globular. Advise the mother to walk during the transition phase of labor. Correct? Answer? Okay. The correct answer is 2. The only correct or the only incorrect? This is the only correct answer. Your modified Ritgen's maneuver. Remember, we don't cut the cord immediately. We need to wait for the cord pulsation to stop. Okay? And we don't pull the cord after the uterus becomes firm and globular. We need to wait for the lengthening of the cord. And walking is only on the latent phase of your labor. Correct answer. Very good. 2 will only be the correct answer. Okay? Very good, everyone. And let's have, of course, the next one. Go. Moving forward. IV fluids are not recommended. Woman must assume an upright position. C. Immediate bonding and breastfeeding are highly encouraged. Or D. Woman must be placed on a complete bed rest. Correct answer? Very good. That will be letter D. Guys, bakit po letter D? The only correct or the only incorrect? This is the only incorrect. Others are correct principles of your natural childbirth. Yes or no? Yes. Okay, very good, everyone. Next. Okay. Dark red, non-foul, vaginal discharge on the 7th day postpartum. B. Fundus palpable 1 inch above the umbilicus. C. Soft and baggy uterus 3 hours after delivery. Or D. The newly delivered woman is self-centered and passive on the 2nd day postpartum. Answer? Very good. That will be letter D. Bakit po letter D, guys? The only normal or the only abnormal? This is the only normal. Yes or no? Others are abnormal. Bakit po? Dark red, 7th day. Mali po. Dapat on the 7th day, pink na siya. Yes or no? Yes po. It should never be above. It should be below. And it must be contracted, not soft and baggy. Okay, very good. Only normal is your letter B. All right. And next question, guys. Go. Okay. A. Magmahal, masaktan at hindi na kailanman magmamahal. B. Magmahal, masaktan, magpatawad at magmahal ng iba. C. Magmahal, masaktan, magpatawad at mahal ulit siya. Or D. Magmahal, masaktan at umasang babalikan ka pa. Ano pong sagot ng ating mga registered nurses? Okay? Bakit nanok-dabaw yung iba? Ano ba naman itong mga to? Guys, masarap magmahal. Yes or no? Oo, magmahal ka lang. Okay? Sige. Go. Bakit naman pighati? Sabi nung isa. Magmahal. Yung masumagot ng letter A. Magmahal, masaktan at hindi na kailan magmamahal. Ang tawag sa'yo ay bitter. Ay. Okay. Magmahal, masaktan, magpatawad at mahalin ulit siya. ang tawag sa'yo ay marupok. Yes or no? Yes po. Magmahal, masaktan, magpatawad at magmahal ng iba. Ang tawag sa'yo ay malandi. Yes or no? Yes po. At D, magmahal, masaktan, at umasang babalikan ka pa. Ang tawag sa'yo ay tanga. Yes or no? So guys, bahala ka na dyan. Kung ano man ang gusto mong isagot dyan. Yes or no? Yes po. Basta ang importante, magmahal ka. Whatever the consequences, guys, ni minsan, hindi naging mali ang magmahal. Yes or no? Yes po. Maliwanag po. Okay? Mali man minsan yung desisyon. Yung desisyon yung mali. Pero yung pagmamahal, hindi kailan yan naging mali. Yes or no? Yes po. Maliwanag po tayo dyan. Okay? Narciso? Nasaan ka? Nasaan ka, Narciso? Is Narciso there? Wala na. May pasok na naman siya. Wala naman. Pumasok na naman si Narciso. May duty ba si Narciso? Okay. Ano ba yan? May duty. Narciso, where are you? Wait lang. May tagayubat dito. University of Batangas. Sir Ridge Norgerd Bruce. Mukhang may biceps ka, sir, no? Parang malaki yung katawan mo. Sir Ridge, are you there? Wala yata siya, guys. Sir Bruce. Ayun siya. Sir Ridge. Tingin ng biceps, sabi nung isa. Sir Ridge, in the gym ka, sir? Do you hit the gym, Sir Ridge? Biceps reveal daw po, sabi nung iba. Yan. Sir Ridge, are you there? Can I see your biceps? Charot. Saan ibang boys? Naman talaga si Narciso, umalis na naman siya. John Patrick Mabasa of CEU Makati. Mr. John Patrick Mabasa. Jumper yan. Hoy! Ba't nyo alam yung jumper? Hoy! Ay, ba't nyo alam yung jumper? Kayo talaga? Okay. Sige. Sir John Patrick Mabasa. Yung mga taga-CEU, is si Guapo. Si Sir John Patrick. Guapo siya. Walang jowa. May jowa, walang jowa. Very guwapo. Sabi ni Sir. Ano pangalan niya? John Patrick Mabasa. Wait lang guys ha. Siyempre, ang gagawin natin, mag-stalk sa Facebook. John Patrick Mabasa. Tignan natin yung kanyang Facebook, kung pogi or hindi. John Patrick Mabasa. Tignan natin. One mutual friend. Siya ba to? Guys, siya ba to? Saan na ba ako? Saan na yung picture ko? Ay, nasaan yung aking screen? Tumugit yung mukha ko. Asan na ako? Nawala ako. Siya ba to, guys? Siya ba yan? Ito, siya ba to? Siya to? Hindi, iba? Ay, siya na. Kaso may jowa na, guys. Oh, may jowa na. Ang sweet-sweet pa nila, oh. Ay, may mga aso pa, oo. May mga aso pa, oo. May aso sila. Ba yan? Taken naman pala. Okay, balik tayo kay Narciso. Narciso! Okay? Magbe-break din yan. Okay? So, it's Narciso, okay? Ayoko na. Okay. We're done. Nurses with your normal obstetrics. Okay? Yan. Sabi dyan ay, thank you. Sabi. Okay? Sige. Moving forward. Okay. Sige guys. Sige po. Before we start with your abnormals, nurses, sige po. Please have your break, nurses, for 5 minutes. 5 minutes lang po. 5 minutes. Okay? While I am trying to pull up the material for your abnormals. Okay? But guys, wait lang. So far, how's our lecture po? In your OB, normals po. Did you learn something po sa inyong OB, normals? Yes or no? Any concerns? Please let me know. Okay po ba tayo? Okay po yung ating discussion? Okay, okay po ba yung ating pacing? Any other concerns? Please let me know para at least makapag-adjust po tayo. Wala naman? Okay, sige. Alright, very good. Sige po, guys, have your break for 5 minutes. Be back, then we'll start with your abnormal OB. Okay? Sige po, go. Ay, ang ganda. Okay, let's continue nurses. Let's have, tawag dito. Ma'am Bell, dun sa active email, Google, ano, ano yung mga concerns mo guys? Di po ma-open yung Google Class. Ayan, what else? Saan po makikita yung mga exams? Ayan, sige. Ayan, alright, sige. Ayan. So guys, tawag dito. Please bear with us muna. Ayan, siguro yung mga technical errors po for now, ngayon lang naman. Nagsimula pa lang kasi tayo. But don't worry guys, as we go on, maayos po yung mga yan, okay? Yung mga Google Classroom, mga exams, ayan. Wala na-receive last night na Google Class. Okay, sige. Ayan. Alright, sige. Go. Just wag pong mahiyang mag-chat kay Ma'am Bell or to anyone, okay? Sige po, go. Let's have your first trimester bleeding. Okay, and that will include nurses your abortion and your ectopic pregnancy. Again, abortion and your ectopic pregnancy. Guys, bilisan ko na ng konti yung lecture natin dito. Anyway, we are already done with the normals. It will be easy for us to understand what are the abnormals. Okay? Sige po. So for the first trimester nurses, we have your abortion. The determination of pregnancy before the age of your viability. Yes or no? Yes po. Okay. And the fetal causes, top-notchers, please take note, that will now be possible rejection of the ovum, and the faulty embryonic development. For the maternal causes will be infection, drug ingestion, malnutrition, and your dehydration. So alam mo na guys, again, basta abortion, nurses, it is the termination of pregnancy before the age of your viability, which is now less than 20 weeks. Maliwanag po tayo dyan. Okay? Sige po. Copyin mo, top-notchers. And one more thing to remember, on the first trimester, usually, ang cause niyan will be the fetal causes. First trimester. But abortion in the second trimester, ibig sabihin guys, that will now be around the 12 to 19 weeks of pregnancy. Second trimester, usually that can be caused by your maternal causes. Okay? Sige po. Copyhin mo guys, copyhin mo, screenshot mo, lipat po natin. Lipat po natin in 5, 4, 3, 2, and 1. Okay? Sige po, go. Alright, now, for abortion nurses, we have your induced abortion and spontaneous abortion. Again, there are two types, your induced and spontaneous. For induced nurses, ito ngayon, sinadya mong ilaglag, artificially done. Top-notchers, and these are now the examples of your abortifacient medication. So again, these are the examples of your abortifacient medication, mga pampalaglag. Okay, nurses, recall lang po tayo. How do you call again? Or what is again considered as the hormone of your pregnancy? Ano pong sagot ng mga top-notchers? Hormone of pregnancy. That will be your, okay, your progesterone. Guys, kailangan ba ng progesterone to maintain the thickness of the endometrium? Yes or not? Yes po, to prevent your possible abortion, guys. Therefore, ano yung gamot na binibigay na pampalaglag? Your mifepristone. And sir, ano po ba ang mifepristone? Mifepristone is your anti-progesterone. Bakit po tayo, sir, nagbibigay ng anti-progesterone? Upang magbakbak, upang magtuklap ang uterus, upang mahulog yung bata. Yes or no? Mifepristone, anti-progesterone. What else? Your misoprostol. Ano naman po, Sir Ken? Yung misoprostol. That is your now, your prostaglandin. Yes or no? Again, says prostaglandin. Sir, ano ang ginagawa ng prostaglandin namin? Ang prostaglandin, aside from it could also contract the uterus, it will soften and dilate the cervix. That will now be your prostaglandin misoprostol, to soften and to dilate the cervix. Yes or no? Yes po. Ibig sabihin guys, sir, pareho bang binibigay yung dalawa? Pareho. Pero, mifepristone, then after 3 days, magbigay ka ng misoprostol. Bakit po? Ibig sabihin guys, unahin mo muna na bakbakin ang loob ng endometrium. Pag nabakbak na, i-dilate mo yung cervix upang matanggal, upang ma-eliminate or lumabas kung ano man yung nabakbak. Yes or no? Yes po. Mifepristone, misoprostol, your abortifacient medication. Bakbakin mo yung uterus. Pag nabakbak after 3 days, buksan mo yung cervix para ngayon mailabas kung ano man yung nabakbak na mga patay na bata or patay na blastosis, yes or no? Yes po. Okay? Sige po guys, copyhin mo. Copyhin mo po, screenshot mo, lipat ko in 5, 4, 3, 2, and 1. Okay na? Okay, don't forget, mifepristone, misoprostol. Okay? Go. Artificially done. Okay. Aside from the induced, we have your spontaneous. So naman po yung naturally occurring abortion. Okay, hindi sinasadya. Ito po ngayon nurses, itawag natin na miscarriage. This will be your miscarriage. Hindi sinasadyang malaglag yung bata. And we have threatened inevitable. Ano po yung inevitable? Inevitable means hindi na maiiwasan. Bakit hindi na maiiwasan? Dahil nag-open na yung cervix. Okay? Hindi na maiiwasan dahil nag-open na yung cervix. Threatened, the cervix is closed. Complete, all are expelled. Incomplete, some are retained. Missed, all are retained. Guys, nurses, balikan lang po natin. Pag meron, for example, na iwan sa loob ng uterus, kailangan mo bang ilabas kung ano man yung naiwan? Yes or no? Yes po. Paano mo nga ilalabas kung ano man yung naiwan? Siyempre, kailangan mong bakbakin yung endometrium upang matanggal. Therefore, anong bibigay mo? Magbibigay ka muna ng, again, your mifepristone. Yes or no? Yes po. Pag nabakbak na, buksan mo yung cervix, your misoprostol. Yes or no? Yes po. Yes, sir. Paano ngayon, for example, nagbigay kami mifepristone, misoprostol? Ang problema, may naiwan pa rin. That is now, when we're going to perform your dilation and curettage, or in Tagalog, that is now your raspa. Yes or no? Yes. We are going to manually scrape the endometrium to remove what should be removed. And guys, bingo, put a big star in the board exam. What is now the most important nursing responsibility after dilation and curettage? Ano pong sagot ng mga top notchers? You answer. Very good, ma'am. Very good, sir. You monitor for bleeding. Yes or no? Yes po, sir. Ken, why do we have to monitor for bleeding? Remember, guys, that bleeding is a sign that there are still retained fragments of pregnancy inside the uterine cavity. Hanggat dinudugang babae, ibig sabihin, may mga naiwan pa doon sa loob ng kanyang uterus. So again, monitor for bleeding. As the nurse, that will be your responsibility. Pag wala ng bleeding, ibig sabihin, the procedure was successful. Okay? Next, recurrent pregnancy loss, your 3 successive miscarriages. 3 beses, nalisan ka, nalaglagan ka. Okay, recurrent pregnancy loss. And septic abortion is abortion complicated by infection. And bingo guys, if asked in the board exam, what is the most common cause of infection after an abortion? That will be your E. coli infection. Sir, bakit po E. coli? Because of the proximity, again, of the anus to the vagina. Remember, the E. coli is found in the anus, therefore, could infect as well the uterine cavity through the vagina. Okay, sige po guys, copyhin mo, screenshot mo po. Go. Okay na guys? Okay, sige. Very good everyone. Sige po guys, ano pong pwedeng pampatay ng kapitbahay na chismosa? Anyway, moving forward, screenshot mo na, ililipat ko na po in 5, 4, 3, 2, and 1. Tulpo, sabi nung isa. Joke lang yun ha, kayo talaga. Okay, lipat ko na po in 5, 4, 3, 2, and 1. Don't forget yung dalawang gamot ninyo ha, mifepristone and misoprostol. Okay? Sige po. Dynamite. Hindi guys. Yung mga pusa nila kasi nairita ako yung mga pusa nila. Di ba yung mga pusa kasi umakyat-akyat yung mga yan? Umakyat sila dun sa may veranda. Ano ba tawag dito? Dun sa may veranda ko. Tapos tumatae sila doon. Kaya gusto kong lasunin, friend. Anong magandang palason sa pusa, guys? Yung isang kain lang nila mamamatay sila, parang gano'n. Nanggigigil na ako. Oo. Araw-araw na lang. Nagaganon ako ng tayo ng pusa. Okay, sige. Moving forward, screenshot mo. Ililipat ko na po in 5, 4, 3, 2, and 1. Alagaan mo, sir. Kung kasi ako guys, sa aso, mahilig ako sa aso. I have a dog. Pero ayoko sa pusa. Kasi nangangalmot. Okay, moving forward, diretso po tayo. Nasuhin ko, gagawin ko ng show. Gawin kong show ko, tapos ibigay ko sa kapitbahay. Okay. Ate, may show po ako, gusto mo. Okay, anyway, moving forward, diretso po in 5, 4, 3, 2, and 1. Okay? Sige, go. Alright, let's have your interventions for your abortion. Okay? Number 1, guys, is your bed rest as prescribed. Again, bed rest as prescribed. Okay? Now, nurses, please take note that bed rest as prescribed, but strict bed rest is not necessary. Okay, sir, bakit po? Because strict bed rest, nurses, now, it can cause pooling of blood. Cause pooling of blood in the uterine cavity. Yes or no? Yes po. Pwede pa rin maglakad-lakad yung babae. Bakit po? Pag ang babae, for example, naka-strict bed rest at nakahiga maghapon, what will happen? Pwedeng yung dugo ngayon, yung patay na bata, hindi lumabas. Yes or no? Maipon dun sa loob ng uterus that could cause another infection. So again, bed rest is prescribed, but strict bed rest is not necessary. Okay? What else? NPO status immediately for possible emergency surgery. Therefore, you have also to maintain adequate hydration, however, only through IV fluids. Monitor for the fetal heart rate and monitor for cervical dilation, guys. Put a very big star on this one. Okay. Basta ang babae ay may complaints of bleeding. Nurses, ulitin ko po, top-notchers, listen. Basta ang buntis na babae, for example, ay may complaints of vaginal bleeding or spotting, regardless of the cause, do not perform your internal examination. Again, nurses, regardless of the cause of bleeding, basta may pagdurugo, never perform your internal examination or your manual examination or your vaginal examination. Yes or no? Yes po. Bakit? If you're going to insert your fingers, nurses, that could cause an injury to the cervix, that could cause an injury to the vagina, and that will be another source of bleeding. Yes or no? Yes po. Therefore, to prevent another source of bleeding, don't insert your fingers, don't perform your internal examination. Yes, sir. How are we going to monitor for cervical dilation? We are going to use your vaginal speculum exam or vaginal speculum. This is the only thing allowed to be inserted in the vagina of the woman. Sir, will that not injure, again, the cervix? Hindi naman po. Bakit? Yung tip niya, hindi mo naman siya ipapaabot sa cervix. Yes or no? Yes po. Pasok ko lang ng konti, tapos ibuka mo, tignan mo pag nag-dilate yung cervix. Maliwanag po. Again, ulitin ko ha. Basta may bleeding, regardless of the cause, bawal ang IE, manual examination, or vaginal examination. What are we going to perform? Vaginal speculum examination. Kailangan may word na speculum. Yes or no? Vaginal speculum exam. Okay? Sige po. What else? Of course, we monitor for your bleeding. Speculum, vaginal speculum exam. Okay, speculum. Right? Then, of course, monitor for bleeding, save all pads. Right? And the best prevention will be adequate prenatal care and your education. Alright? Sige po, nurses, copyhin mo na. Copyhin mo na. Screenshot mo. Lipat ko po. Lipat ko. In 5, 4, 3, 2, and 1. Again, I would like to reiterate, basta may bleeding, bawal ang IE, bawal ang vaginal exam, bawal ang manual exam. Kailangan mo makita, vaginal speculum examination. Okay? Sige po. Very good. Taran! Okay. Now, Sir, anong oras po ang post-test? Uwi pa lang po kasi ako ng Marilao. Mamaya po mga 5 o'clock po siguro yung post-test. Okay, 5 o'clock po. Okay? Go. Now, remember our discussion last time, guys? Di ba sabi natin, pag lumabas yung ovum, the ovum will wait for fertilization in the ampulla. Yes or no? Yes po, site of your fertilization. Once the ovum has been fertilized, the ovum now will travel along the length of the fallopian tube to be implanted in the endometrium. Yes or no? Yes po. Pero ang problema, guys, in some cases, once the ovum has been fertilized in the ampulla, it won't travel towards the endometrium. Dun lang siya sa ampulla. Bingo, a case of your ectopic pregnancy. Yes or no? Yes po. Yung na-fertilize na ovum, hindi nagpunta sa endometrium to be implanted. Therefore, if asking the board examination, what is the most common site of fertilization? You answer ampulla. What is the most common site of ectopic pregnancy? You answer your ampulla. Bakit po? After fertilization, it failed to travel to the endometrium for proper implantation. Sir, bakit po ba kasi nagkakaroon ng ectopic pregnancy? Guys, you answer your pelvic inflammatory disease or your PID. Again, what is PID? Your pelvic inflammatory disease. Sir, ano po ba yung pelvic inflammatory disease or PID? This is now the inflammation of the reproductive organs. Again, inflammation of the reproductive organs in the pelvic cavity, causing now your pelvic inflammatory disease. That will now involve, nurses, your fallopian tube. Sir, how does PID now lead to ectopic pregnancy? Kasi nurses, pag nagkaroon ng PID, pwedeng pati yung fallopian tube mo ma-inflame. Yes or no? Yes po, nurses. If there will be inflammation of the fallopian tube, will that cause narrowing of the fallopian tube? Yes or no? Yes po, namamaga yung fallopian tube, therefore sumisikip yung daanan ng fertilized ovum, hindi siya makakapunta ngayon doon sa endometrium for implantation kaya nagkaroon ng ectopic pregnancy. But if the questioner, for example, is, what is the most dangerous site? You answer, that will now be the interstitial. This is now the most dangerous site. Sir, ano po bang interstitial? Interstitial, guys, is the connection between your fallopian tube and your uterus. Why is it considered, Sir Ken, as the most dangerous site of ectopic pregnancy? Dahil pag sumabog ang ectopic pregnancy mo or pag sumabog ang fallopian tube, rupture, ectopic pregnancy, it will not only damage the fallopian tube, it can also damage the entire uterus. Yes or no? Therefore, most dangerous, interstitial. Most common site, ampulla. And there is pelvic inflammatory disease or your PID, causing narrowing of the fallopian tube, preventing the transport of the fertilized ovum to the endometrium for appropriate or for possible implantation. Okay? Sige po, nurses, copyhin mo na po, screenshot mo na po kapatid, ililipat ko po in 5, 4, 3, 2, and 1. Okay na? Okay. Forward, diretso po tayo and let's go. Now, so again, andun na po lahat. Na-discuss na po natin yan, okay? Ayan, so implantation of the uterus, most common risk factor, your pelvic inflammatory disease, most common site ampulla, dangerous site interstitial, and of course, again, the pain that will now be unilateral. Sir, bakit po unilateral? Lower abdominal discomfort, depending now on which ovary ovulated on that specific month na nabuntis yung babae. Pag left yung nag-ovulate, therefore the pain will be on the left fallopian tube, left lower quadrant. And the diagnosis will be your sonogram. Okay? Sige po. Guys, copyhin mo na, screenshot mo po, Ililipat ko po in 5, 4, 3, 2, and 1. Guys, okay lang po ba yung bilis ko, nurses? Okay lang ba yung bilis ko? Okay lang, ha? Sure? Okay, sige po. Sunod lang ha. Anyway, it's already in your handout. Yes or no? Yes po. Sige, bilisan ko lang ng konti para at least we'll be able to finish everything until 5 o'clock. Okay? Sige, again, recall lang po tayo. In case of abortion, is strict bed rest or bed rest as prescribed only? Bed rest as prescribed only. Yes or no? Bakit po? To prevent pooling of blood in the uterine cavity. Therefore, you won't be able to monitor for the passage of the dead fetus. Yes or no? Yes. Will you increase the oral fluid intake? No. Maintain hydration through IV fluids, but the woman must be placed in nothing per orem NPO for possible surgery. Yes or no? Yes po. The cervix now is dilated. Dilated or open? Threatened or inevitable? Open. Inevitable. Hindi mo na maiwasan dahil bumuka na po yung cervix. Yes or no? Yes po. Okay, very good everyone. And guys, again, are you allowed to insert your finger pag may bleeding ang babae? No. No to IE. Yes to vaginal speculum exam to prevent injuring the cervix and the vagina that will be that could cause now another possible source of bleeding. Yes or no? Yes po. Okay? Very good everyone. Moving forward, diretso po tayo. Ano ulit yung dalawang gamot, guys? Na pampalaglag? Ano yung naunang pampalaglag kanina? Para magbakbak ang uterus? Mifepristone. Eh yung pampalambot at pampadilate ng cervix para bumuka. Misoprostol, guys. Bingo. Ilagay mo ngayon dyan yung dalawa. Yes or no? Yes po. Mifepristone, misoprostol. Sulat mo para at least di mo makalimutan. Mifepristone and your misoprostol. Guys, nurses, pag nagkaroon ng ectopic pregnancy, pwede pa rin bang lumaki yung ectopic pregnancy? Yes or no? Yes po. Pwedeng mag-rupture. Yes or no? Yes po. That is why our goal is to prevent the further growth of the ectopic pregnancy. Bakit? Dahil pag lumaki pa ng lumaki ang ectopic pregnancy, baka sumabog yung fallopian tube. Therefore, how are we going to prevent, Sir Ken, the further growth of the ectopic pregnancy? We need to inhibit the process of cell division or your mitosis. Yes or no? Yes po. This is the reason why we are going to give your mitotic inhibitor. Yes or no? Yes po. Why are we going to give, nurses, your mitotic inhibitor? To inhibit cell division, to inhibit your mitosis, to prevent further growth of the ectopic pregnancy. And very good will be your methotrexate. Yes or no, guys? Is this an anti-cancer drug? Yes or no? Yes, but this will be an anti-cancer drug. Okay? For the surgical management, nurses, that will now be your laparoscopic salpingostomy. Okay, and this will be, nurses, your laparoscopic salpingostomy. Yan. And so, hiwain mo yung fallopian tube, tanggalin mo yung ectopic pregnancy. Okay? HCG assessment must be done every 2 weeks until negative. Bakit po, Sir Ken? To make sure that we have totally and successfully removed all the fragments of your ectopic pregnancy. And bingo, guys, I will give you another big star. Taran! No to pregnancy for 1 year. If asked in the board exam, what instruction are you going to give a woman following the evacuation of your ectopic pregnancy? Instruct the woman to use contraceptives for 1 year. Again, instruct the woman to use contraceptives for 1 year. Bakit po? To prevent pregnancy. Sir, bakit po hindi pwedeng mabuntis ang babae within a year following ectopic pregnancy? Remember, guys, nag-perform ka ng surgery. Your laparoscopic salpingostomy, yes or no? Yes po, nurses. Hiniwa mo ba yung fallopian tube? Yes or no? Yes po. Ibig sabihin, nagkaroon po ng injury yung inyong fallopian tube. Yes or no? Yes po. For example, hiniwa mo siya dito. Guys, will that cause scarring in the fallopian tube? Yes or no? Yes po. At pag yan, for example, babaeng yan, dahil malandi, for example, biglang nabuntis na naman, nagkaroon ng fertilization. Okay? Ang problema ngayon, the scarring now could again block the transport of the ovum that will cause another possibility of ectopic pregnancy. Therefore, nurses, kailangan mag-antay tayo ulit ng 1 year to allow total healing of the fallopian tube before attempting another pregnancy to prevent a possible ectopic pregnancy again. Yes or no? Yes po, to prevent scarring. Okay? Sige po guys. So, contraindicated po ba yung intrauterine device if ever? Your IUD, ma'am, it will be contraindicated in case, for example, it is because of your pelvic inflammatory disease po. Remember, your IUDs are contraindicated in women who are at risk of developing your pelvic inflammatory disease or PID, which is a possible cause of your ectopic pregnancy. Okay? Ayan. One of the contraindications po of your IUDs is if a woman is at risk of your pelvic inflammatory diseases po. Alright? Sir, wala po bang artificial implantation para i-push na lang yung fertilized egg sa ampulla dun sa artificial insemination po? Pwede naman po. If gusto ng mga magulang, okay lang din naman. Pero syempre, mahal. Yung ating ang tawag doon, in vitro fertilization, parang ganun, sir. Ano po ang best na contraceptive para sa mga ganito? Ayan. For the type of contraceptive, guys, to be used, that would always be depend on the tawag dito. That would be the partner and the woman to decide for whatever contraceptive nurses na kanilang gagamitin. Yes or no? Yes pa. Okay, but remember, your contraceptive, guys, meron niyang kanya-kanyang peculiarities. Yes or no? Yes po. Like for example, kanina nga yung IUD that can cause your PID, your pelvic inflammatory diseases. Your orals naman po, for example, yung mga oral contraceptive pills, yung mga COCs combination, oral contraceptive pills. Like for example, yung mga estrogen, mga progesterone, ang problema naman dun ngayon, pwede magkaroon ng breakthrough bleeding. Pwede rin magkaroon ng increase in blood clotting. Pwede rin magkaroon ng increase in blood sugar. Yes or no? Yes po. But once those oral contraceptive pills, for example, will be used, the effectiveness of that one, usually that is around 99%. So okay lang din naman. Yes or no? Yes po. Okay? So for that case, nurses, depende po yun ngayon dun sa kung ano yung kagustuhan po nung babae. But again, the safest, kung kaya nung lalaki, that will now be your condom. Kung gusto ng babae, that will be your cervical cap or your diaphragm. Yes or no? Yes po. Sir, bakit po yung cervical cap, diaphragm, or condom? Kasi walang halong gamot. Yes or no? Yes po. Ibig sabihin, less yung side effect, less yung possible na tawag dito, na adverse effect ng inyong mga oral medications, for example, your diaphragm, your cervical cap, or your condoms po. Okay? Ayan. Sige. Copyhin mo. Midwife si Sir Abin. Ay, midwife ka, sir? Sir Jed, you're midwife, MCC. Okay. Sige po, guys. Ay, nice. Okay. Tapos nag-nursing. Okay. Ayan. May midwife pala tayo dito. Guys, so the next part of the lecture will be discussed by Sir Jed Avenido. Okay, may midwife pala tayo dito. Okay? Sige po. Copyin mo na, guys. Copyin mo na. Screenshot mo na po. Screenshot mo na. Ililipat na po natin. In 5, 4, 3, 2, and 1. Guys, for the oral contraceptive pills, I don't actually discuss it during refresher. Maybe it will be discussed na po during the intensive review for oral contraceptive pills. O kasi medyo mahaba-haba po siyang usapan. Okay? Alright. Sige. Diretso po tayo. Lipat ko na po in 5, 4, 3, 2, and 1. Okay? Sige. Go. Ayan. Okay. Most common type. Nurses. Again, balikan ko po ulit yung ating lecture yesterday. When does your organogenesis take place po? Again, nurses, when does your organogenesis take place? Answer. At what stage of your fetal development? Ovum, zygote, embryo, fetus. Very good. Embryo. Yes or no? Yes po, guys. Pag embryonic stage, dyan na po ba nagkakaroon ng organ development? Yes or no? Yes po. Usually, dyan sumasabog ang ectopic pregnancy. your embryonic stage. Sir, bakit po embryonic stage? Or that will be 5th to the 8th week of your pregnancy. Bakit, Sir Ken? Dahil lumalaki na yung ectopic pregnancy, nagkakaroon ng organs, lumalaki ngayon yung bata, that could cause rupture of the ectopic pregnancy. Yes or no? Embryonic stage po. Okay? And once mag-rupture, the pain now will be characterized as your sudden knife-like pain. And because of bleeding, of course, magkakaroon ng shock-like manifestations, your hypotension, tachycardia, takipnya. Bakit? Nagkaroon nga po tayo dito ng inyong bleeding. Yes or no? What else? We have your Cullen sign. Sir, kailan po yung Cullen sign ulit? Cullen sign, it will be the bluish discoloration in the peri-umbilical area. That will be your Cullen sign. All because of your internal bleeding. Yes or no? Yes po, guys. Therefore, for example lang guys, tanungin ka sa board exam. You are now taking care or assigned to a woman with a diagnosis of ectopic pregnancy at 5th week age of gestation. Which of the following should the nurse closely monitor for? A. Urine output. B. Pulse rate. C. Level of consciousness. Or D. Temperature. Ano pong sagot ng ating mga top-notchers? Okay, very good everyone. Put another big star. The most important to monitor, basta may ectopic pregnancy, sabi sa board exam, kahit wala pang rupture, you closely monitor for the pulse rate. Yes or no? Yes po, sir. Bakit we have to monitor for the pulse rate? Remember, nurses, in case na magkaroon ng rupture, there will be bleeding. And remember, in case of bleeding, what is the first organ to compensate? It will be the heart. Yes or no? Yes po. The heart will increase the heart rate to supply more blood into the different parts of the body in case of bleeding. Yes or no? Yes po. Therefore, what are you going to closely monitor? Pag may ectopic pregnancy, that would always be the pulse rate. Bakit po? Pag tumataas na yung kanyang heart rate or pulse rate, ibig sabihin, baka nagkaroon na po ng rupture, yung babae nagkakaroon na po ng internal bleeding, and the heart is already compensating. Yes or no? Yes po. Your hypo, tachycardia. Yes sir, bakit pulse rate? Bakit hindi blood pressure? Bakit hindi kung ano-ano dyan? Remember again, it will be the heart that will compensate first. Yes or no? Yes po. Maliwanag po tayo dyan. Okay? Very good everyone. And bakit pa heart? Bakit pa pulse rate guys? Your blood pressure kasi nurses, kailangan mo pa ng apparatus, yes or no? Magaganong-ganong ka pa doon ng blood pressure. But the pulse rate, you could immediately check, yes or no? Yes po, by simply using your fingers and your watch, yes or no? Yes po, pero umamin ka. Guys, kayang-kaya mong kumuha ng pulse rate na wala kang gamit na relo. Yes or no? Yes, umamin ka. Huwag tayong magplastikan. Yes or no? Yes po. Char lang. Okay? Bakla ka ng ton. Nag-duty ka, kumuha ka ng pulse rate, ginanon mo lang. Hindi mo tinagnan. Walang relo. Yes or no? Yes po. Okay? Copyin mo na po. Copyin mo na. Pati RR, yes or no? Yes po. Ililipat ko na po in 5, 4, 3, 2, and 1. Siyempre, gawain ko din yan noon. Yes or no? Yes po. RR, sabi ng instructor mo. Ma'am 17. PR. 67 po, okay? Sinulaan mo, yes or no? Yes po, okay? 86 bits per minute, ganun. Tinignan mo lang, okay? Mga bakla kayo ng taon, okay? Diretso po tayo. We're done with your ectopic pregnancy, okay? Now, let's have the second trimester naman po, nurses. That will now be your H-mole. Okay. Sir Ken, bakit po ba kasi nagkakaroon ng H-mole? Guys, top-notchers, do you still remember your OZEF? Yes or no? Yes po. Okay, nurses, ano po ulit yung ating OZEF? Ovum, zygote, embryo, fetus. Yes or no? Yes po. Okay. Yung zygote mo, that will turn into a blastocyst. And the blastocyst will be implanted. Yes or no? Yes po. Okay. In H-mole nurses, ang problema ngayon, yung blastocyst mo, hindi nag-develop into an embryo, hindi nag-develop into a fetus. Blastosis lang siya, yes or no? Yes po. Nag-stop yung kanyang development doon. And that blastosis, nurses, take note, it contains now millions of your trophoblastic cells, yes or no? Yes po. And these trophoblastic cells are producing now high levels of your HCG, causing nurses now your nausea and vomiting in pregnancy. However ngayon, pag HMOL, gestational trophoblastic disease, bingo, nagkakaroon po ng ano? Nagkakaroon po ng inyong hyperemesis gravidarum. Sobra-sobra yung pagsuka ng isang babae na may HMOL. Bakit sobra-sobra yung kanyang nausea and vomiting? Hyperemesis gravidarum. Dahil sobra-sobra yung kanyang HCG produced by trophoblastic cells in the blastosis that did not develop into a embryo, into a fetus. Bingo, the case of your HMOL or gestational trophoblastic disease. Okay? Sige po. Kopyahin mo, screenshot mo po, ililipat ko na in 5, 4, 3, 2, and 1. Okay? Go. Nurses, diretso po tayo. Guys, what will now be, Sir Ken, a common predisposing factor? That will be your late pregnancy. Sir, bakit po late pregnancy? Because of the matured or let's use the word old ovum. Yes or no? Yes po. Syempre, remember guys, sabi natin nun, yung mga ovum mo, yung mga Graafian follicle mo, pagkapanganak mo pa lang, andyan na yung mga ovum mo, andyan yung mga Graafian follicle mo on the surface of your ovaries. Yes or no? Yes po. Therefore, habang tumatanda ka, anong nangyari? Pwede rin pong tumatanda yung mga Graafian follicles mo. Pag na-fertilize, for example, yung ovum, baka hindi na ganun ka-healthy ang inyong ovum. Yes or no? Yes po. And what will be, Sir Ken, the assessment? Bingo, hyperemesis gravidarum. Yes or no? Suka ng suka yung babae. At syempre, walang fetal heart tone, walang skeleton. Question guys, pag HMOL or gestational trophoblastic disease, ano po ang paglaki ng tiyan ng isang babae? Mabilis or mabagal? Mabilis or mabagal? Very good. Mabilis, yes or no? Yes. There will be rapid increase in the uterine size. Sir, bakit po magkakaroon ng rapid increase in the uterine size? Because this is an abnormal growth or abnormal cell. Remember guys, ano po ba yung ating concept ng oncology or cancer nursing? Sabi natin doon, abnormal cells tend to grow faster, divide faster, and spread faster compared to your normal cell. Reading ko po, abnormal cells tend to grow faster compared to your normal cells in oncology. Same lang din naman sa OB. Because this is an abnormal growth, it will grow faster compared to your normal pregnancy. Okay, what else? There will be, of course, dark brown vaginal discharge. Nurses, do we need to evacuate the uterine cavity? Yes or no? Yes po. Kailangan mong alisin yung HMOL. Paano mo ngayon aalisin yung HMOL? E di, same lang, bakbakin mo ang uterus mo na. Paano mo siya babakbakin? Magbigay ng, ano yung unang gamot? Mifepristone. At syempre, pag nabakbak na, buksan mo yung cervix. Anong binibigay? Misoprostol. At syempre, to prevent further growth of the abnormal cells, what are we going to give? Syempre, anti-cancer drug in the name of your methotrexate. Diba? Umikot lang yung ating management. Yes or no? Yes po guys. Pwede po bang may maiwan sa loob? Yes or no? Yes po. Kaya HCG assessment again until negative. Again, HCG assessment until negative. Nurses, pwede po ba agad mabuntis? Hindi pwede. So again, no pregnancy again for 1 year. No pregnancy for 1 year. Okay. Sige po. Wait lang. May tanong dito. Sir, ano po yung normal levels ng HCG sa mga pregnant women? For HCG, guys, that is around 400, it's 400 HCG. That's 400,000. Ano ba yung kanyang yung unit? I forgot the unit. I think it's 400,000 micro. Ano ba yung unit? Anyway, I forgot the unit, guys. Pasensya na po. For HCG, it's 400,000. I think it's micrograms per deciliter. Micrograms per deciliter yata. Okay, that will be your HCG. But for your H mole, that could, again, this is normal ha, normal HCG. But for H mole, guys, that could reach even up to 2 million pag H mole po, or GTD, or gestational trophoblastic disease. Again, normally it's 400,000, pero pag H mole, umabot po ng 2 million micrograms per deciliter. Okay? Alright. Sige, guys, go. One more time. One more thing. Bakit before ko makalimutan? Okay? Bingo. Here says, taran, your hysterectomy. Hysterectomy. Sir, ano po ang hysterectomy? Removal of the uterus. But nurses, hindi naman to palagi ginagawa. Yes or no? Yes po. We are only going, nurses, now to indicate hysterectomy. For example, if the woman, nurses, is already older than 40 years old po. Ulitin ko, guys, ha? If the woman, for example, is already older than 40 years old and is no longer planning to have another baby, then we could now suggest possibility of hysterectomy. Tanggalin mo na po yung uterus. Bakit po? To prevent your choriocarcinoma. Again, to prevent your choriocarcinoma. Sir, ano po ba yung aming choriocarcinoma? Malignancy. Bakit po? Baka kumalat yung abnormal cells doon sa inyong uterus. Yes or no? Your choriocarcinoma. Therefore, para hindi na po mag-metastasize yung abnormal cells of the uterus and to the other parts of the body, if the woman is more than 40 years old and is no longer planning to have another pregnancy, then tanggalin mo na lang po ang uterus through the procedure called hysterectomy. Okay? Sige po. Nurses, copyin mo na po. Sir, nawawala po ba yung sexual desire pag natanggalan ng uterus? Usually, ma'am, hindi naman po. Okay? Kasi yung ating mga sex hormones, usually that is regulated naman po by your anterior pituitary gland and also the ovaries po. We could remove the uterus without removing the ovaries naman po. So, sexual desire, konti siguro buwasan, pero hindi naman siya ganun na totally mawawala yung inyong sexual desire pag tinanggal po yung uterus. Okay? Unless tabiso yan, total abdominal hysterectomy with bilateral oophorectomy, that could cause your libido po. Okay? Alright, sige. Or decrease in your libido. Okay? Sige po. Moving forward, nurses, moving forward, the screenshot mo, ililipat po natin in 5, 4, 3, 2, and remember, guys, your sexual desire, it is controlled by a lot of organs in the body. Number one, the brain. The amygdala. Yung ating libog is controlled, number one, by the amygdala. Another, of course, is the production of the hormones, which is regulated, for example, by the hypothalamus and the anterior pituitary gland, which releases now your yung mga sex hormones nila, like for example, your FSH, LH, etc. At ano pa? Yung mga testosterone for ninyo, mga testosterone, estrogen, etc. Ayan, lahat na po yun, na? Okay, sige. Moving forward, the screenshot mo, ililipat ko na po in 5, 4, 3, 2, and 1. Okay? Sige po. Premature cervical dilatation. Okay, guys, we would like to focus on this one. Okay. Kanina sabi natin, pag nag-dilate ang cervix below 20 weeks, that is your inevitable abortion. Yes or no? Yes po. Pero, tandaan mo ha, before 20 weeks, abortion. Pero, pag nag-dilate, top-notchers ang cervix mo. Again, pag nag-dilate po ang cervix mo, after 20 weeks, that is no longer abortion. That becomes your incompetent cervix or your premature cervical dilatation. Yes or no? Yes po. And Sir Ken, what will be the initial sign your show and increased cervical pressure, and the management nurses will be your cerclage. Sir, ano po yung cerclage? That will now be suturing or tying of the cervix. Shirodkars is suturing of the cervix, while McDonald's is tying of the cervix. Okay? Talian mo or isuture mo. Anyway, guys, this is the vision or this is your view. If you are using, for example, your vaginal speculum, ayan. Ito yung speculum mo, pag silip mo, bukas yung cervix. Okay, you should tie it or you should suture it. And what will be the position? Taran, ang favorite mo, Trendelenburg position. Yes or no? Yes po, sir. Bakit po Trendelenburg position? That is to decrease the tension in the cervix. Yes or no? Again, to decrease the tension in the cervix. Maliwanag po. Question, guys. If the woman now, for example, have undergone cerclage, nurses, can the woman still deliver via normal spontaneous vaginal delivery? Yes or no? Again, if the woman had cerclage, be it Shirodkars or McDonald's, can the woman still deliver via normal spontaneous vaginal delivery? Okay, correct answer is yes. Bakit? We are going to remove the sutures at term, making it possible for the one to deliver now via NSVD at term or 37 weeks pataas po. Okay? Sige. Okay na? Alright, sige. Go. Very good, everyone. Moving forward, screenshot mo na po. Screenshot mo na. Don't forget that Trendelenburg position to decrease the tension in the cervix after the procedure. Okay? Brahin ko, lipat ko na po in 5, 4, 3, 2, and 1. Okay? And guys, let me show you ito ngayon yung ating ayan, McDonald's and your Shirodkars. McDonald's on the left, Shirodkars on the right. Okay? Sige po, screenshot mo. Ililipat ko, in 5, 4, 3, 2, and 1. And this is also your example of the suturing of the cervix. Ayan, bumuka siya. Anong ginawa? Tinali, sinuture. Ayan, nasuture. Oh, wala na. Close na. Yes or no? Yes po. That will now be your cerclage. Okay? Sige po. Okay? Alright. Moving forward. Screenshot mo. Ililipat ko na po in 5, 4, 3, 2, and okay, so we're done with the bleeding on the first and on the second trimester of your pregnancy. Okay, guys? Are you hungry? Sorry. Nakalimutan ko magpa-break. Okay. Diretso ako dito. Okay. Guys, nurses, top-notchers of Top Rank Review Academy. Don't forget lang po yung tatlong gamot, mifepristone, misoprostol, at methotrexate. Yes or no? Yes po. And guys, again, ectopic pregnancy, H-mole. Can the woman get pregnant again anytime? Yes or no? The answer is no. Instruct the woman to use your oral contraceptive pills. And if the woman now, for example, has had H-mole and the woman is more than 40 years old and is no longer planning to have another pregnancy, what will be indicated? O diba? Hindi pa tapos yung tanong, may sagot ka na naman sa akin. Yes or no? Okay. Very good, everyone. That will now be your hysterectomy. Yes or no? Yes po, mga advance, mag-isip. Yes or no? Yes. Okay, very good, everyone. Sige po. Guys, stop na sure. Sige. Please have your break for, okay lang guys, 15 minutes. Okay lang. 15 minutes. Then, when you come back, we'll start with your third trimester bleeding po. Guys, 15 minutes lang po, ha? Okay. Ayan. Para at least we can finish early this afternoon. Okay, sige po guys. I'll see you after 15 minutes. Kumain muna. Go! Okay, guys, let's start with your tawag dito, bleeding on the third trimesters of your pregnancy naman po. Starting of course with your placenta previa. Okay, guys, bakit po ba nagkakaroon ng placenta previa? Okay, balikan ko lang to guys. Dito, tignan mo rito nurses ha. The most common risk factor of placenta previa is multiparity. Okay, multiparity, previous CS, and dilation carotides. Lahat ng to nurses, all these factors could cause scarring of the endometrium. Yes or no? Yes po. Therefore guys, pag may scar doon sa endometrium, ano mangyayari? It will displace the placenta. Yes or no? Yes po. Causing now your placenta previa. Sir, saan po ba kasi dapat talaga ang placenta? Normally guys, ang placenta mo talaga, nandito yan sa taas ng inyong uterus. Nandito sa banda dito. Normally. Pero for example, pag nanganak ka na at nag-separate yung unang placenta, after the separation of the first placenta, it will leave a scar in this part of the endometrium. On the second pregnancy, the placenta now will place itself sa kabila naman po. But again, after delivery, again, may scar na yan. Third pregnancy, dito naman siya sa baba. May scar ulit. Fourth pregnancy, dito ulit siya sa kabila. Okay, hanggang sa fifth pregnancy ngayon yung placenta sabi niya, ay ano ba yan? Ang daming scar. Sige na nga, dito na lang ako. Bingo, multiparity could cause your placenta previa. Pag ilang beses na, for example, ng anak, ilang beses na po nang pagkaroon ng placenta previa, or ilang beses na po, for example, nagkaroon ng placental separation, that could cause scarring of the uterus. Same din naman, for example, pag CS, syempre, pag CS, hiniwa mo yung tiyan, hiniwa mo yung uterus. Again, that will cause scarring. The placenta will look for a location na walang scar. And same again, of course, your previous DNC. Bakit pag DNC? You manually scrape the endometrium that could then cause scarring of the endometrium, leading to your possible placenta previa. Malinaw po tayo dyan, okay? Sige po. So again, scarring can cause your placenta previa. And what will now be certain? The fundic height assessment. It will be higher than normal. Again, higher than normal po. Bakit po higher than normal? Siyempre, yung placenta ay tinutulak yung bata pataas. Yes or no? Yes po. Therefore, higher than normal. Okay po tayo dyan? Okay, and what will now be certain? The most important sign, bingo, that will now be your painless, bright red, vaginal bleeding. Bakit po painless? Because there is no separation. Na-compress lang yung placenta kaya nagkaroon ng painless, bright red, vaginal bleeding. Diagnosis to be ultrasound, of course. Most common cause of fetal loss, prematurity. Complication, your hemorrhage. Okay? Remember, pag nagkaroon po ng placenta previa, usually, kailangan na po agad i-deliver yung fetus. Okay? Sige po. Moving forward, guys. Moving forward, screenshot mo. Screenshot mo, ililipat ko po. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay? Sige. Let's have the management nurses. Go. Okay, for the management, guys, what will be our goal of management? Number 1 is to maintain adequate circulation. And how are we going to maintain certain adequate circulation? Again, ang walang kamatayan, ang mapaghimala, ang namamayagpag, your left side lying position. Yes or no? Yes po. And again, basta may bleeding, bawal ang IE, use your speculum. At pag may bleeding, D5LR. And of course, monitor for blood loss. Maliwanag po. Okay. Bingo. Another big star, guys. Pag nagkaroon ng placenta previa at kailangan na po agad-agad i-deliver ang bata, ano po yung gamot na binibigyan natin to increase your fetal lung maturity? Bingo. Another big star. Hindi po nawawala sa board exam. That will be your beta-methasone. Very good, sir. That will be, very good, ma'am, your beta-methasone. Or pag wala pong beta-methasone, kahit ano na may zone sa dulo. This will be your corticosteroids. Yes or no? Yes. Ano po ang gamit ng corticosteroids during pregnancy? To increase your fetal lung maturity upang umabot yung kanyang LS ratio ng 2:1. Again, guys, put a big star, gawin mong parol, beta-methasone to increase your fetal lung maturity given IM to the mother. Yes or no? Yes po. Maliwanag po tayo dyan. Again, a common question the board exam, hindi po nawawala. Ang beta, metasol. Okay, copyhin mo na guys. Copyhin mo na po. Screenshot mo na. Screenshot mo na po. Ililipat na po natin. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay na? Okay, moving forward and let's go po. Diretso? Now, let's say for abruptio placenta naman. Okay. For abruptio, guys, pwedeng may bleeding, pwedeng walang bleeding. Bakit po? For example, nag-separate sa gilid, syempre may bleeding yan. Pero pag sa gitna, walang bleeding. Yes or no? Yes po. Okay, sige po. Copyhin mo. Copyhin mo, screenshot mo. Ililipat po natin, lipat po natin in 5, 4, 3, 2, and 1. Okay na? Okay, putahin ko. And let's go. Okay, let's have your abruptio placenta naman po. For abruptio nurses, what will now be? The predisposing factors that will be your pregnancy-induced hypertension, shabu. I would like to highlight cocaine. Guys, highlight mo cocaine, common in the board exam, and smoking. Right? Trauma, stress, and emotion. Bakit po? Nagkaroon ng separation of the placenta. Guys, all of this could cause an increase in your blood pressure. At pag tumaas po ang blood pressure, pwedeng mag-rupture yung mga small blood vessels, causing now premature separation of the placenta. At dahil nag-separate, that will be painful, dark red, vaginal bleeding. Yes or no? Yes po. So remember guys, anything that could cause scarring in the endometrium can lead to placenta previa. Anything that could cause increase in the blood pressure can cause your abruptio placenta. Maliwanag po. And pag abruptio, painless, painful, dark, painful, bright red, vaginal bleeding. And what will be the management? Same with placenta previa. Therefore guys, pag same with the placenta previa management, how are you going to reposition the woman with abruptio placenta? Ano pong sagot ng mga top notchers? In your answers? Very good. Left side lying position. Yes or no? Yes po. Can you perform? I.e. No, only your vaginal speculum exam. Ano po yung fluid na binibigay pag may bleeding? D5 LR. And bingo, top notchers, all of you, what is again? The drug used to increase your fetal lung maturity. Ano pong sagot ng mga top notchers ng Top Rank Review Academy? Okay, very good. That will be your beta metasone. Yes or no? Yes. When a complication of your abruptio placenta is your covelear uterus. And sir, Ken, ano po ulit yung covelear uterus? That is now your purplish uterus accompanied by rigid board-like abdomen. Your covelear uterus. Sige po, copyhin mo. That will now be your abruptio placenta. Okay, sige po guys. Copyhin mo na. Copyhin mo na. Screenshot mo na. Screenshot mo na. Ililipat na po natin. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay? Sige, putahin ko and let's go. Okay, let's have your gestational diabetes mellitus. Okay, sige po. Don't forget yun ha guys, again, anything that could cause scarring in the endometrium, placenta previa. Anything that could cause increased blood pressure, abruptio placenta. Your cocaine, your smoking. Yes or no? Yes po. Okay, go. Now, let's have your gestational diabetes mellitus, guys. Nakakasunod pa? Sorry po. Okay pa ba yung pacing ko? Okay lang yung bilis ko, nurses? Okay lang? Nakasunod? Okay, sige, focus mo muna tayo, guys, ha? Okay, bilisan ko lang po para matapos po natin hanggang alas 5. Yes or no? Kasi Friday ngayon, yes or no? At alam ko pa, Friday, meron pa kayong mga lakad, yes or no? Siyempre. Ay, alam nyo yung gagawin na. Pakakailan pa. Okay, sige, go. Oh, remember, ano ba ulit yung gamit, sir, ka ng insulin? Ang gamit ng insulin, guys, it will open the glucose channel. In short, your insulin will help in the transport of the glucose coming from the blood vessel to the cell. Yes or no? Siya po ay magpapasok ng glucose from the blood to the cell. Yes or no? Yes po. Okay? Then good. Forget the one. Let's solve. Screenshot mo po, ililipat po natin in 5, 4, 3, 2, and 1. Okay na po tayo dyan, ha? Okay, top notchers, go. Let's discuss your gestational diabetes mellitus. In GDM top notchers, please take note. Ano po ba yung mga risk factors? That will be your age, obesity, and genetics. Okay, it says, I just would like to make sure, yung handout na nabigay po sa inyo, same po ba nung content ng lecture ko? Yes or no? Same po ba tayo? Same naman na? Okay po. Meron na to, nabigay to sa inyo. Nakalagay ito sa inyo. Okay, very good. Para hindi kayo mahirapang magsulat, okay? Very good. Now, ang possible cause, nurses, please take note, that will be your human placental lactogen. Ano po ba ang human placental lactogen? This is now produced, top-notchers, by the placenta during pregnancy to prepare for lactation. Ang problema ngayon, guys, your HPL or human placental lactogen, this is now considered as the main antagonist of insulin during pregnancy. Ito po yung kalaban ng insulin during pregnancy. Therefore, pag tumaas ang HPL during pregnancy, what will happen? Babagsak po ang level ng insulin mo. Yes or no? Yes po. At pag bumagsak yung level ng insulin, what will happen? The glucose cannot be converted into your energy. Yes or no? Yes po. Therefore, anong gagawin ng katawan? If glucose cannot be converted to energy, the body will get glucose or energy from fat, which we term as your lipolysis. Ang problema ngayon, guys, the byproduct of your lipolysis are your ketones. Yes or no? Repeat up, notchers. What is the byproduct of your fat metabolism? The byproduct will be your ketones, leading now to maternal ketoacidosis. At pag dumami ng dumami yung ketones sa dugo ng mother, it will displace the oxygen, causing now decreased placental oxygenation, leading to your fetal hypoxia. So a simple GDM could lead to fetal death secondary to fetal hypoxia. Bakit nawalan ng oxygen yung bata? Dahil bumagsak yung oxygen sa placenta, dahil yung blood ni mother dumami yung ketones. Bakit kasi dumami yung ketones? Because this is the byproduct of your fat metabolism when the body obtained energy coming from fats. Bakit kasi? Because the body cannot obtain energy coming from glucose dahil mababa ang insulin, dahil mataas ang human placental lactogen, the antagonist of your insulin. Okay. What else will happen, Sir Ken? Siyempre, magkakaroon po ng maternal hyperglycemia. And remember that the glucose can pass through the placenta, causing now your fetal hyperglycemia. And nurses, pag may fetal hyperglycemia, nagkakaroon din po ng fetal Guys, kindly check. Ano po nakalagay sa handout ninyo? Fetal polyuria or fetal polyuria po ba yung nandiyan sa handout ninyo? Okay. Polyuria na. Guys, palitan ko to ha. Anyway, alam nyo na yung polyuria. Polyuria magkakaroon therefore guys, oligohydramnios or polyhydramnios po. Polyhydramnios, yes or no? Leading to your polyhydramnios. Sige po, idagdag ko na lang dito. Magkakaroon po ng polyhydramnios. Alright. Ang problema ngayon guys, nurses, please take note. Your fetal hyperglycemia, that will cause now the fetal pancreas to produce insulin, and this will be on the 16th week of your pregnancy. Again, in the 16th week of your pregnancy. That is the reason nagkakaroon po ng tinatawag natin na fetal hyperinsulinism. Again, fetal hyperinsulinism. At ano po ang nangyari, Sir Ken? Pag nagkaroon ng fetal hyperinsulinism, what will happen is that the glucose now will enter the fetal cells. Again, the glucose will enter the fetal cells. The nurses, pag nag-enter po ang glucose sa ating fetal cells, what will happen? Lalaki or liliit yung bata? Lalaki yung bata. Yes or no? Yes po. Therefore, ano po ang anak ng isang babae na may gestational diabetes mellitus? Large or small? Bingo, there will be large for gestational age baby. Again, large for gestational age baby or your macrosomic baby. Yes or no? Yes po. Or if the baby is more than 4,000 grams or 4 kilograms. That will now be your macrosomic baby. Sir, bakit mataas or bakit malaki yung anak ng babae na may GDM? Lumaki yung bata dahil yung glucose na nanggaling kay mother ay pumasok dun sa kanyang fetal cells. Bakit? Dahil nagkaroon ng fetal hyperinsulinism. Because the fetal pancreas will produce insulin on the 16th week of pregnancy in response to your fetal hyperglycemia. Paliwanag po tayo dyan. Okay? Sige po guys. Copyhin mo na po. Screenshot mo. Ililipat po natin in 5, 4, 3, 2, and 1. Okay na po ba tayo dyan? Okay, sige. And diretso po tayo, mga kapatid sa pananampalataya. Okay, almost done. Diretso po tayo. Okay, so guys, let's have a test for glucose. For the test of glucose, nurses, number 1 here, we have your 50-gram oral glucose test. But before anything else, nurses, let's just first have, what is the normal glucose level? Everyone, sige po, lahat po kayo. Wala pong maling sagot. What is the normal glucose level po? Sir, ano po yung nagpo-form ng insulin? Fetal pancreas po. The fetal pancreas po. Okay? Okay, so makita mo iba-iba yung sagot. Some are saying 80 to 100. Some are saying 80 to 110. Some 8 to 120. Some 70 to 110. So guys, again, for the blood glucose level, actually talaga ganyan yan. Iba-ibang references, iba-iba po ang sinasabi. Yes or no? Yes po. But nurses, for our discussion, allow me to use 70 to 110. Again, for our discussion, allow me to use 70 to 110 milligrams per deciliter. Okay? Now, we have what we call, nurses, as your 50-gram oral glucose test. Sir, paano po ba yung 50-gram oral glucose test? Wala po itong preparation. And it is done on the initial prenatal visit. Now, after giving now your 50-gram oral glucose solution, guys, sorry, let me highlight this one po ha. It is done during the initial prenatal visit. Yan po yung unang test na ginagawa po natin sa pinakaunang consultation. Okay, why? Because this test is to check for the risk of developing your gestational diabetes mellitus. Now, we have your 50-gram oral glucose solution. Once or after giving now, the 50-gram oral glucose solution, nurses, we are now going to obtain a specimen for your blood sugar after 1 hour. And what will be certain the normal blood sugar after 1 hour? That will be at 140 milligrams per deciliter or less. Ulitin ko, it should be 140 milligrams per deciliter or less. It is less than 140 milligrams per deciliter. However, top-notchers, if it is higher, pag more than 140 milligrams per deciliter, then we are now going to perform another test, and that will now be your 100-gram oral glucose test. For this one, the woman now will be placed NPO post-midnight, and no smoking, and stay seated on the morning of the test. Sir, bakit po NPO post-midnight? Because on the morning of the test, we are going first to obtain the fasting blood sugar level. Then after obtaining the fasting blood sugar specimen, that is when we are now going to give your 100-gram oral glucose solution. Then 1 hour after giving the 100-gram oral glucose solution, we are going again to obtain a specimen after 1 hour, after 2 hours, after 3 hours. Bingo! That is the reason why your 100-gram oral glucose tolerance test is also known as your 3-hour OGTT or your 3-hour oral glucose tolerance test. Why? We are going to check for the body's ability to metabolize or to tolerate your glucose, yes or no, in 3-hour period. Okay, bingo. Let's now discuss the normal values. For the fasting blood sugar, it should be less than 90 milligrams per deciliter. After 1 hour of giving 101, or 1 hour after giving your 100-gram oral glucose solution, bingo, the normal will be less than 180 milligrams per deciliter. Hala sir, ba't ang taas naman ng normal mo? 180, remember, nagbigay ka nga ng 100 gram. Yes or no? Yes po. But after 2 hours, it should be down at 160 milligrams per deciliter. Then, after 3 hours, it must be down to less than 140 milligrams per deciliter. Okay, very good ma'am. Ibig sabihin guys, kailangan ma-metabolize, kailangan bumaba ang blood glucose mo in 3-hour period to less than 140 milligrams per deciliter. Bakit po sir Ken pag hindi bumaba? Pag yan for example nurses sabi doon, okay guys, for example sabi doon, 2 hours after giving 100 gram oral glucose solution, the blood level now of glucose is at 172 milligrams per deciliter after 2 hours. Guys, is this normal or abnormal? Very good. This is abnormal. Yes or no? Yes po. Bakit po abnormal? It's higher than 160. Remember, what is normal? Less than 180, less than 160, less than 140. In this case, after 2 hours, nasa 172. Abnormal po. Bakit? Ibig sabihin, the body was not able to metabolize or tolerate the glucose. Bakit po? Because there is insufficient insulin dahil may gestational diabetes mellitus nga. Yes or no? Yes po. Okay, how about this one guys? After 2 hours, for example, sabi niya, the blood glucose now is at 156 milligrams per deciliter. Normal or abnormal? Very good. This is now considered normal. Bakit po normal? It's less than 160. Yes or no? Yes po, maliwanag po. So, pwedeng mas mababa, pero hindi pwedeng mas mataas doon sa normal value. Yes or no? Yes po. So, guys, let's memorize. FBS, after 1, after 2, after 3, less than 90, less than 180, less than 160, less than 140. Yes or no? Yes po again. FBS, after 1, after 2, after 3, 90, 180, 160, 140, pwedeng mas mababa, pero hindi pwedeng mas mataas. Maliwanag po tayo dyan. Okay? Very good, everyone. Moving forward. Moving forward po, screenshot mo, ililipat po natin in 5, 4, 3, 2, and 1. Okay na po tayo? Sige po, copyhin mo, lipat po natin, ililipat po natin in 5, 4, 3, 2, and 1. Okay? Go! Okay, let's have your glycosylated hemoglobin nurses. Sir Ken, ano naman po yung aming glycosylated hemoglobin? This is now your glucose bound to your hemoglobin. Yes or no? Ibig sabihin, yung hemoglobin mo, may kumapit na glucose. Hemoglobin, irreversibly bound to your glucose. Meron na siyang asawa forever. Yes or no? Yes po. Okay. Bakit po kasi Sir Ken? Una muna, ano po bang normal? The normal, guys, is less than 6%. Alright? In some books, actually, it's less than 5.7%. Okay? But for better retention, let's just use less than 6%. Okay? Actually, there are some books, it's less than 8%. Pero medyo mataas na yun. So let's just use less than 6%. Okay? Ayan. But again, I repeat, some books, it's less than 8%. Okay? But again, the principle is mas mababa, mas okay. Okay? So less than 6%. Anong ibig sabihin niyan, Sir Ken? This is normal. Pag less than 6%. What if, for example, ang sabi doon, anyway, this is your HB1AC. Okay? If, for example, nga nakita mo doon, that the HB1AC, for example, is at 15%. Ibig sabihin, guys, baka merong diabetes si mother. Or meron siyang diabetes. Bakit po? Remember, nurses? Dahil sa sobrang dami ng glucose sa kanyang dugo, yung ibang glucose kumapit na doon sa mga hemoglobin mo. Kaya ka nagkaroon ng glycosylated hemoglobin. Yes or no? Yes po. But normally talaga, less than 6% of your hemoglobin is bound to glucose. And that is normal. Again, normally, less than 6% of glucose is bound to hemoglobin that is normal. Pero pag more than 6% na po, ibig sabihin, sobra-sobra na yung glucose, kaya yung ibang glucose kumakapit na dun sa mga hemoglobin mo. And sir, what will be the implication of this one? It will implicate now long-term compliance to treatment. Sir, how long is how long? 3 months. Yes or no? Yes po. Ibig sabihin, guys, if a person with diabetes mellitus has a HB1AC of less than 6%, ibig sabihin, for the past 3 months, the patient was regularly taking or injecting her insulin. Yes or no? Yes po. Pero, pag more than 6%, ibig sabihin, hindi siya nag-inject ng insulin for 3 months po. Sir, bakit po 3 months? Because 3 months, guys, this is now the lifespan of your RBCs. Yes or no? Yes po. Maliwanag po tayo dyan. So again, normal, less than 6%. Alright? Indicates long-term compliance to treatment plan. Alright? Sige po, guys. Copyin mo na. Copyin mo na po. Screenshot mo. Screenshot mo. Ililipat po natin. Ililipat po natin in 5, 4, 3, 2, and 1. Okay? Sige po. Diretso tayo and let's go. Okay? HB1AC po. HB1AC. Okay? HB1AC. Tuloy ba't ako wait lang. Palito ako, nahilo na. Okay, HB1AC tama? HB1AC tama, guys? Oo, HB1AC. Apo, it's HB1AC. Hindi po siya HB1C, okay? HB1AC. Tama po. Okay? HB1AC. Alright? Sige. Moving forward, ililipat po natin in 5, 4, 3, 2, and 1. Okay? Sige, go. Okay. Let's have the management. Okay? Sige. Let's have your insulin, guys. This is the safest management of pregnancy during, or this is the safest management for diabetes during pregnancy. Why? This is an FDA category B. Ibig sabihin, nurses, in animals, there was no adverse reaction to the fetus. Your FDA category B. Yes or no? So it's safe during your pregnancy. Okay? Bingo. Let's have your dosage adjustment. Now, on the first trimester, nurses, please take note. The glucose is needed for fetal brain development. Okay, nurses, for example, try to understand this one. If this is, for example, the maternal blood, and this will be, for example, the fetal cells. Okay? Now, if this is the glucose, for example, kumain si mother ng glucose, and this will now be the fetal brain. Remember, the fetal brain needs glucose for fetal brain development. Ngayon, nagbigay ka, for example, ng insulin kay mother. What will the insulin do? The insulin will carry the glucose into the cell. Yes or no? Yes po. Therefore, guys, tanungin kita. On the first trimester of pregnancy, wherein glucose is needed for fetal brain development, how are we going to adjust the dose of your insulin? Are we going to increase or decrease the dose of your insulin? Ma'am Beatrice said decrease. Okay, most of you now are answering decrease. Ma'am Maya, Ma'am Maxine, Miss Mary Grace. Okay, very good everyone. The correct answer is decrease. Bingo, lagay mo dyan. We have to decrease the dose of insulin on the first trimester of your pregnancy. Why? Guys, look at this one. If you are going to add insulin, lahat ng glucose ni mother will enter the maternal cells. Walang aabot dun sa fetal brain ni baby for fetal brain development. Therefore, what are we going to do? We have to decrease the insulin. Bakit po? Decrease the insulin now to allow some of the glucose to be able now to reach the fetal brain for fetal brain development. Yes or no? Yes. So therefore, on the first trimester, decrease the dose of insulin to allow some of the glucose to be able to reach the fetal brain. In Tagalog, huwag mong kunin lahat ng glucose ni mother. Magtira ka para kay baby by decreasing the dose of your insulin. Maliwanag po tayo dyan. Okay? Very good, everyone. Next, on the second and third trimesters, tandaan mo, tumataas na po ang human placental lactogen, which is an antagonist of insulin. Therefore, guys, second and third trimester, are you going to increase or decrease the dose? Ano pong sagot ng mga top notchers? Very good. Diyan ka ngayon mag-increase ng dose. Why? To compensate na po for the decrease in the level of the insulin. Yes or no? Yes po. Caused by the human placental lactogen. Maliwanag po tayo dyan. Okay? Very good, everyone, guys. Tanungin ko po kayo. For the first 2 days of our lecture refresher course under Top Rank Academy, guys, first 2 days of your formal review for the May 2023 Nursing Board Exam, guys, ano po usually yung ating ginawa for the 2 days? Nag-memorize or inintindi yung concept? Ano pong sagot ng mga top notchers? Nag-memorize or inintindi? Inintindi, inanalyze. Yes or no? Yes po, guys. Ganyan ang gawin mo sa review mo. Yes or no? Yes po. Bakit, guys? Pag nag-memorize ka lang, sure ako, makakalimutan mo yan pag minemorize mo. Yes or no? Yes po. Pero, pag naintindihan mo, hindi mo yan makakalimutan. Yes or no? Yes po. So guys, please take note ha. You still have ilang months pa po to prepare? You have almost 6 months to prepare. Yes or no? Yes po. Hanggat maaari, don't just memorize. You need to understand the concept. Yes or no? Yes po. Pag memorize, baka makalimutan mo. Pag naintindihan mo, hindi mo yan makakalimutan. Maliwanag po. Therefore, first trimester, decrease the dose. Second trimester, increase the dose. Maliwanag po tayo dyan. Okay? Now, for the labor nurses, during labor, give glucose solution plus regular insulin. Bakit po? Kailangan ni mother ng energy for the delivery of the baby. Okay? And on the first 24 hours naman, guys, do not give insulin. Sir, why are we not giving insulin on the first 24 hours? To prevent hypoglycemia. Remember, napagod si mother mag-deliver. So don't give insulin to prevent your hypoglycemia. But 24 hours after delivery, we could now return to the usual dose of insulin. Bakit po, Sir Ken? Dahil after delivery, wala na yung placenta. Ibig sabihin, wala na rin po si human placental lactogen. Naglaho na siya. Yes or no? Therefore, go back to the original dose of your insulin. Okay? Sige po, guys. Copyhin mo na. Copyhin mo na po. Screenshot mo. I-screenshot mo po. Ililipat na po natin. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay? Sige po. Copyhin mo. Lilipat na po natin in 5, 4, 3, 2, and 1. Okay na? Okay. Let's have your pregnancy-induced hypertension, guys. Nurses, again, what is the normal blood sugar level? Ano pong sagot ng mga top notchers? Ano po yung normal blood sugar level? 70 to 110 milligrams per deciliter. Ano po yung test na ginagamit during the initial visit to determine the risk of GDM? 50 gram or 100 gram? 50 gram. For example ngayon, nag-undergo siya ng 100 gram oral glucose solution. What is the normal FBS? Normal FBS? Less than 90. Yes or no? Yes po. How about 3 hours or 1 hour after giving your 100 gram? After 1 hour, less than 180. After 2 hours, less than 160. After 3 hours, less than 140. Mas mababa, pero hindi pwedeng mas mataas. And guys, what is the normal glycosylated hemoglobin? Less than how many percent of your hemoglobin is bound to glucose? Less than 6%, which indicates now your long-term compliance to treatment plan. And again, nurses, knowing that glucose is needed for your fetal brain development, how are you going to adjust the dose of insulin on the first trimester of your pregnancy? Decrease to allow some of the insulin to be able to reach the fetal brain for its development. Guys, insulin. Pregnancy category A, B, C, D, or X? Pregnancy B. Yes or no? Yes. Okay. Very good, top-notchers. Sir, how about po yung metformin? Metformin, guys, is also category B. It is also safe during pregnancy. But remember, ang metformin kasi, ang ginagawa lang niya is it prevents the formation of glucose coming from the liver. Yes or no? Yes po. Okay? Okay naman siya for pregnancy. Pero remember, the main problem talaga in your GDM is yung talagang insulin na bumagsak because of your HPL. Kaya better than metformin, that will now be your insulin. Yes or no? Yes. But though metformin can also be given naman during pregnancy. It is safe. Okay? Your metformin. Same sila. Pregnancy category. Di po sila pareho. Metformin and your insulin. Okay? Sige. Okay. Let's have your PIH, guys. Now, in PIH nurses, remember, what is our main problem here? That will be your vasoconstriction. Okay? And the predisposing factor will be your early pregnancy and late pregnancy. But guys, I would like to put a big star. What age group is at the highest risk of developing PIH? You answer, adolescent. Yes or no? Again, nurses, if asked in the board exam, what age group is of the highest risk of developing PIH? You answer, adolescent women. Yes or no? Yes. This is why, if the woman who is pregnant is adolescent, you need to encourage her to have prenatal checkup because they are highest risk of your PIH. And pag nagkaroon na naman po ng vasoconstriction, magdi-decrease ang nutrient exchange in the placenta. Yes or no? Yes po. Therefore guys, ano ngayon ang anak ng babae na may pregnancy-induced hypertension? Small or large for GA? Very good. Small for gestational age. Yes or no? Yes. Or again, yung sabihin kahapon, ano yung tawag doon? Your IUGR. Yes or no? Yes po. Your intrauterine growth retardation or your IUGR, intrauterine growth retardation, or small for gestational age baby. Okay? Now, remember guys that there are types of your PIH. Number one, we have your transient hypertension. Transient hypertension, nurses, is when the blood pressure increases to 140 over 90. That's it. Pero, pag yung hypertension mo, sinamahan ng edema at proteinuria, that will now be your pre-eclampsia. Yes or no? Yes po. Sir, bakit po sila nagkakaroon ng edema? Remember guys, if this is for example your blood vessel, ano po ba ang trabaho ng protein? Ang protein, it maintains what we call as your oncotic pressure. Ano po, Sir Ken, ang oncotic pressure? It is the pooling pressure inside the blood vessel. It will retain the water in the blood vessel. So what will happen guys, pag nawala yung protein, nawawala ang oncotic pressure. Ano nangyayari? Yung fluid ngayon will extravasate. Lalabas din from the blood vessel, going to the interstitial, causing now your edema. Kaya nagkakaroon ng edema pag mayroong PIH because nawawala yung protein ng babae dahil umiihi siya ng protein, proteinuria. That will now be your preeclampsia. Pero ang problema ngayon, From edema of the body, it could lead to cerebral edema. And this cerebral edema, baka mag-edema yung utak, that could lead to your seizure. Yes or no? Yes po. At pag nagkaroon ng seizure, that is no longer your preeclampsia, that becomes your eclampsia. Yes or no? Yes po. But again guys, recall lang po tayo. Is pedal edema normal during pregnancy? Yes or no? Again, is pedal edema normal during pregnancy? The answer is yes. Therefore, Sir Ken, when does edema become abnormal? If it is found on the face and on the hands of the woman. Yes or no? Or nagkakaroon po ng anasarca. Yes or no? Nag-edema na po, for example, yung buong kanyang katawan, that is now abnormal. But again, I repeat, edema of the legs or the foot in pregnancy, normal. But edema of the face and hands, suspect your preeclampsia. Yes or no? Pag nag-seizure, eclampsia na po. Maliwanag po tayo dyan. Okay? Sige po. Guys, copyhin mo. Copyhin mo po, screenshot mo. Screenshot mo, ililipat po natin. Ililipat po natin in 5, 4, 3, 2, and 1. Okay na? Okay. Sige po, burahin ko. Guys, wait lang ha. Check ko lang kung naisama ko dito. Ay, hindi ko naisama, sorry. Nurses, ganito. Nurses, pwede bang magkaroon ng seizure? Yes or no? Yes po. Therefore, what are you going to monitor, guys? Put a big star, ha? You are going to monitor, nurses, number 1, pag nagkaroon ng visual disturbance. What else? Epigastric pain. What else? Tawag doon? Headache. Severe headache. Severe headache or severe epigastric pain. Guys, take note. Pag ang pasyente mo, for example, ay may PIH at biglang sabi niya, yung paningin ko lumalabo, yung ulo ko sobrang masakit, aray ko, yung tiyan ko, makirot. Bingo guys, these are impending signs of seizure or signs of impending seizure or ano ba magandang term dito? Danger signs. Yes or no? Danger signs of impending seizure. Yes or no? Anytime baka mag-seizure yung patient, therefore, kailangan mo siyang bantayan. If a woman with PIH is now complaining of visual disturbances, epigastric pain, and your severe headache. Maliwanag po tayo dyan. Alright, sige po. Guys, copyhin mo na. Copyhin mo na po, screenshot mo. Screenshot mo, ililipat ko na po in 5, 4, 3, 2, and 1. Yes po, very good ma'am. I would like to use the word, ayun, yung gamit ni ma'am, the aura of your seizure or the aura of your seizure. Yes or no? Yes po, the aura of your seizure. Yung mga signs na anytime baka mag-seizure yung pasyente mo. Okay? Sige po. Moving forward, lipat ko in 5, 4, 3, 2, and 1. Okay? Go. Now, there are types of your preeclampsia, guys. Your mild and your severe. If it's your mild, ito naman po ang inyong severe. Okay, kung makita mo, blood pressure 140/90, 160, tapos positive 1, positive 2, positive 3, positive 4. Okay. This will be edema. Positive 1 edema, positive 2, positive 3, and your positive 4 edema. And this will be your proteinuria. Okay. Positive 1, positive 2, positive 3, positive 4 proteinuria. Okay, so you simply drop the specimen of urine, then compare the color to the bottle. Okay, I would like just to emphasize on this one, guys. What is normal for urine, for protein in the urine? Guys, the normal is, number 1, absence of protein in the urine. The absence of protein in the urine is normal. Also, din naman, traces of protein in the urine is also normal. Again, guys, ulitin ko, the absence of protein or the presence of traces of protein in the urine is both normal. Negative or trace is normal. What is abnormal? Positive 1, positive 2, positive 3, positive 4. Paliwanag po tayo dyan. Ulitin ko, don't forget this one. Okay, the absence or the trace of protein in the urine is normal. Guys, balikan ko lang po yung concept yesterday. Again, guys, top notchers, if you still remember, nurses, what is again the normal weight gain during the second and third trimester of your pregnancy? I repeat, nurses, again, what is the normal weight gain on the second and third trimester of pregnancy? Ano pong sagot ng ating mga registered nurses? Very good, 1 pound per week. Nurses, pag merong pre-eclampsia, nagkakaroon po ba ng edema? Yes or no? Yes po. And the weight of the fluids in the interstitial will add to the weight of the patient. Therefore, if the weight gain is more than 1 pound per week, that is now your mild pre-eclampsia. Pero pag more than 5 pounds per week na po, that could now be your severe pre-eclampsia. Yes or no? Yes po. So again, sabi ko sa inyo, kailangan mong malaman ang normal sa abnormal. Normal weight gain, 1 pound per week, second and third trimester. Pero pag ang weight gain na po is more than 1 pound per week on the second trimester, bingo, suspect your preeclampsia. Bakit? Because of the edema. Yes or no? Yes po. Ay, sorry guys. Sorry po. Sorry po. It must be more than 1 pound per week, more than 5 pounds per week. Yes or no? Yes po. Pasensya na po. Ayan. Bakla lang. Okay? Again, more than, tawag dito, more than 1 pound per week, more than 5 pounds per week. Okay? Ayan. More than. Okay? Sige. Ayan. Oh, ayan sila din. Sinulat nila yung more than. Okay. Aminin mo guys. Aminin nyo. Nung elementary kayo, nahirapan din kayo sa more than, less than, at equal. Yes or no? Yes po. Hirap na hirap ako ng nurses, ha? Nung elementary ako, di ba may mga exam tayo? 8, tapos 10. 11, tapos 5. 5, 8, tapos 3, 11. Ay, 3, 4, ganon. Tapos sabi ng teacher mo, place if it's less than, equal, or more than. Yes or no? Bakla nung bata ako talaga, hilong-hilo ako. Hindi ko alam kung saan ko ilalagay yung tusok na yes or no. Yes po, ayan. Okay, wala lang. Nalala ko ng elementary ako. Ginaganon-ganon ko lang siya. Ini-equal-equal ko pa. Ginaganon-ganon ko lang siya. Okay, ayan. Greater, equal, or less than. Oh, ganon. Wala lang, na-share ko lang. Salamat sa attention, di ba? Okay. Hindi guys. Kaya ako nag-nursing kasi mahina ako sa math, yes or no. Oy, promise guys. I hate math. Promise, talaga. Hindi ko alam. Hindi ko maintindihan. Yung mga algebra, mga trigonometry, ay nako, Diyos ko, nung college ako. Buti lang yung best friend ko magaling sa math. Siya ang gumagawa ng assignment ko talaga nun. Hindi ko maintindihan. Yung sabi doon, 6A plus 2B equals 3C. Find the value of B. Sabi sa akin, ano? Sabi ko, ewan ko dyan. Bakit ba kasi pinaghalo yung number tsaka yung letter? Yes or no? Kaka-stress. Okay, anyway, moving forward. Promise kasi ko ito maintindihan. Okay, moving forward, ililipat ko na po. Ililipat ko na in 5, 4, 3, 2, and 1. Okay, go. Tapos yung physics nun, guys. Ay, nako. May physics pa ba kayo? Guys, do you have still physics? In your curriculum, may physics pa kayo? Wala na. Meron pa, wala na. Physics. Advanced physics, wala na. Buti pa kayo, guys. Alam niyo ng college kami? Meron kaming advanced physics nung second year college. Ganito yung tanungan nun, guys. For example daw, may plane. If you are going to push a box weighing 50 kilograms and the inclined plane is at 45 degrees, and the pull of gravity, etc. Find the amount of energy needed to push the box up the inclined plane. Ganun yung tanong sa amin nun, friend. Hindi ko talaga maintindihan. Sabi ko, ay, ano ba yan? Sabi ko, nag-nursing ako. Bakit ko makukumpitin yung amount of energy, yes or no? Yes po, wala lang. Na-share ko lang. Diretso na tayo. Salamat sa attention. Let's have the management of your pregnancy-induced hypertension. Okay. For the management, nurses, please take note. Ayan. Positioning, again, ang walang kamatayan Left side lying position. Guys, alam ko, anong oras na? 4:30 na. Sabi nung iba, friendship, anong oras siya matapos? Ang haba pa nung handout. Bakit? Anong oras na? Anong oras kaya siya mag-dismiss? Yes or no? Yes po. Guys, sige po. Tapusin na natin to, yes or no? Mga 5:30 po, tapos na tayo. Okay? Sige. Diretsuhin ko na, ha? Okay. Attention na, guys. Environment. Less stimulated. Company. Same diagnosis. Bakit? Parehong kailangan ng katahimikan. Priority. Safety and airway. Medical management. Bingo. Your hydralazine. A direct vasodilator, hydralazine. Bakit po? Remember, the main problem is vasoconstriction. Okay? Guys, nurses, pag tinanong ka, where are you going to admit a patient with pregnancy-induced hypertension? Room A, room B, or room C? Again, where? Or B, on the hallway. Where are you going to admit a patient with pregnancy-induced hypertension? Nurses, kailangan bang less stimulus? Yes. Bakit? Kasi nga, baka mag-seizure. Yes or no? Yes po. So, hindi pwede sa D kasi hallway. Madaming dumadaan. Hindi rin pwede, nurses, sa B. Bakit? Tabi ng station. Ang mga nurses, mga marites, maingay. Yes or no? Huwag din po sabi, baka mag-seizure yung pasyente mo. Yes or no? Yes po. Sir, how about A? Huwag din po sa A. Bakit? Sobrang layo. Remember, kailangan mo ng close monitoring. Baka mag-seizure. Yes or no? Yes po. The correct answer would be letter C is the correct answer. Across the nursing station. Sir, bakit po across the nursing station? Number 1, para nakikita mo siya, close monitoring, and less din po ang stimulus. At least medyo malayo na po ang inyong room across the nursing station po. Okay? For close monitoring. Okay? Guys, for the diet, nurses, is there proteinuria? Yes? Or ano po again? Is there proteinuria? Yes or no? Very good. The answer is yes. Therefore, what diet are you going to give? High protein or low protein diet? Very good. High protein diet. Bakit po high protein? To replace the lost protein in the urine to lessen the edema. Yes or no? Yes po. Next question, guys. Meron po bang hypertension? Meron. Therefore, high sodium, moderate sodium, or low sodium diet? Guys, in the book of Piliteri, ulitin ko ha, in the book of Piliteri, ang sagot mo na dyan is moderate sodium diet. Again, nurses, you may verify this one in the book of Piliteri, moderate sodium diet. Sir Ken, bakit po moderate sodium diet? Take note, nurses, we have what we call as your RAAS. Again, we have what we call as your RAAS. Sir, ano po ba yung RAAS namin? Your renin, angiotensin, aldosterone system. Alright, sir. Ano po ba ang gamit ng aming RAAS? Okay. Nurses, remember your renin, angiotensin. This angiotensin, if converted to angiotensinogen 1, alright, and this A1, if converted by your angiotensin converting enzyme into your angiotensinogen 2, this will now be a potent vasoconstrictor. Lalo pong tataas yung blood vessel pag nag-constrict si blood vessel. Sir Ken, bakit ngayon moderate sodium diet? The reason, guys, is if you are going to give, for example, a low sodium diet, again, if you are going to give, for example, a low sodium diet, what will happen? Babagsak yung sodium ng pasyente. This low sodium now will stimulate your RAAS or renin, angiotensin, aldosterone system. Bakit po? dahil kailangan ng inyong aldosterone. Because your aldosterone will retain the sodium to prevent hyper or hyponatremia. Ang problema ngayon, hindi lang po yung aldosterone ang na-produce. Pati sa angiotensin, na-convert to 1, na-convert to 2, nagkaroon ng constriction, lalong tumaas yung blood pressure ng pasyente mo. Yes or no? Yes po. Therefore, to prevent stimulating the RAS, you give your moderate sodium diet. And if you say moderate sodium diet, that is now around 1,500 milligrams per day lang po. Yes or no? Again, 1,500 milligrams of sodium per day, and that is your moderate sodium diet. Maliwanag po tayo. Not your low sodium diet to prevent RAS stimulation. Okay? Alright, guys. Sige po, copyhin mo na. Copyhin mo na po, screenshot mo na. Screenshot mo na po, ililipat na po natin. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay na? Okay po. Go. Okay. Let's have the management to prevent hypertension or convulsion. That will now be your magnesium sulfate. Guys, this will be your magnesium sulfate. Magnesium sulfate. But remember, guys, that magnesium sulfate is both a respiratory, again, both a respiratory and a neurologic depressant. Again, both are respiratory and neurologic depressants. Therefore, guys, what will be our assessment parameters? Go. The respiratory rate must be higher than 14 beats per minute. Okay. In some books, actually, it's 16. In some, it's 12. Okay, so let's just use 14 beats per minute. Patellar reflex, it must be positive. And the urine output must be more than 30 ml per hour. Or your normal urine output. Bakit po, sir, kailangang normal? Yung urine output to make sure that the kidneys will be able to eliminate the excess magnesium sulfate to prevent, nurses, your magnesium toxicity. Yes or no? Yes po. Maliwanag po tayo dyan. Okay? Sige po. Again, RR must be higher than 14. The patellar reflex or deep tendon reflex must be positive, and the urine output must be more than 30 ml per hour. And guys, I would like to highlight this one, put a big star. What is the therapeutic level? That's 5 to 8 milligrams per deciliter. Okay. Yung normal level, guys, this is the normal level in MS. Pag MS po test 3, the normal level of magnesium in the body is 1.5 to 2.5. But this 1.5 to 2.5, it cannot prevent convulsion. Yes or no? Yes po. What will be the level that could prevent convulsion? That will now be 5 to 8 milligrams per deciliter, or what we call as your therapeutic level to prevent your convulsion. But if there is, for example, now more than 8 milligrams per deciliter, that will now be your toxicity level. And what will be, sir, can the antidote? Of course, your calcium gluconate. And what will be the long-term complication of long-term use of magnesium? Don't forget, pag mababa ang pag mataas ang magnesium, babagsak yung calcium. Kaya pwede magkaroon ng osteoporosis. Okay? Sige po, guys. Copyhin mo na. Copyhin mo na po. Screenshot mo. Screenshot mo. Ililipat ko na po. Ililipat na po natin in 5, 4, 3, 2, and 1. Okay? Sige. Nurses, bulayin ko na. Lipat ko po and go. Alright. Now we go to your RH, ISO immunization. Madami pa ba? Konti na lang, guys. Yung iba, mabilis na lang to. Okay. Kayang-kaya po yan. We'll be able to finish this one. Okay? Sige, guys, excuse me lang po. Saglit quick break lang po. Quick break. 1 minute. 1 minute. Saglit lang po, ha? Go. Kayo din. Mag-quick break po. Kumuha ng something to eat. Go. Okay, guys, let's continue, nurses. Let's have your RH isoimmunization, okay? Now, for this one, nurses, take note, paano po ba nangyayari ang inyong RH isoimmunization? Okay. O yung iba, hindi na kumakit. Okay. Na nawala na sila. Okay, guys, ganito. I might end the lecture ng 5:30. Okay lang. Then 5:30, you'll be having the post-test. Then, I'll give you 20 minutes. Okay lang. Then, we'll have the ratio until 6 o'clock. Okay lang tayo, guys. Extend lang tayo ng 1 hour. Okay? To those of you na medyo merong lakad, okay lang po. If you need to leave early, earlier than 6 o'clock, okay lang po. Walang problema sa akin. Anyway, you will be given a copy naman po of the recorded lecture. Okay? Sige po. We just have to finish this one. Okay, go. RH isoimmunization. Taran. Ay, mali. If the mother, for example, is RH negative and the father is RH positive, guys, ano ngayon ang mangyari sa bata? Negative or positive? Most probably, the baby will be RH positive, yes or no? Yes, so. Ibig sabihin, the baby has what we call as your antigen D coming from the father. Yes or no? Yes po. Okay. Now, for example, the mother is maternal blood vessel. A. Then this will be your fetal blood vessel. Fetus. Fetus number 1. Okay. Question, guys, again. During pregnancy, nurses, concept tayo recall. During pregnancy, is there a direct exchange of blood between the mother and the baby? Yes or no? Again, the answer is no. Yes or no? Yes po. Okay, so it is safe. Yung antigen din ni baby, nandyan lang sa kanya. Si mother, walang antigen. Ang problema ngayon, nurses, pag nagkaroon na po tayo ng placental separation during the delivery process. Yes or no? Again, pag nagkaroon na po ng placental separation during the delivery process. What will happen? Pag nag-separate yung placenta, pwedeng humalo yung dugo ni baby dun sa dugo ni mother. So, ano mangyayari? Yung dugo ni baby, pupunta ngayon dun sa dugo ni mother. Guys, anong gagawin ni mother? The mother now will produce your antibodies. Yes or no? Yes po. And what will these antibodies now do? It will kill the Rh positive red blood cells of the baby. Again, the antibodies will attack to kill the antigen D. But guys, is fetus number 1 already safe? Yes or no? Yes po. Bakit? Na-deliver na siya. Yes or no? Pinanganak na siya. Safe na siya. Yes or no? Yes po. Kasi nga nagkaroon na ng placental separation. Safe na siya. Pinanganak na. Ang problema ngayon, nurses, pag nagkaroon ulit ng fetus number 2. Nurses, question. If the fetus number 2, same father, that will be again Rh positive. Yes or no? Yes po. Question, guys. Does the antibodies produced during the first pregnancy, will that remain in the maternal circulation? Yes or no? Yes po. Andyan lang yan sa maternal circulation. Hindi na yan aalis. Nandyan yan forever. Para siyang vaccine. Yes or no? Andyan na forever. Ano mangyayari? The antibodies now will immediately attack the RBCs which are containing antigen D of the growing fetus, causing your erythroblastosis fetalis. Again, erythroblastosis fetalis. Bakit po siya tinawag na erythroblastosis fetalis? Erythro, red blood cells. Blastosis, destruction or destroyed in the fetus. Sinisira ng mga antibodies produced during the first delivery. It now destroys the RBC of the fetus number 2, causing your erythroblastosis fetalis or Rh incompatibility. Guys, pag nasira ang RBC, lumalabas po ba ang inyong bilirubin? Yes or no? Yes po. Therefore, ano po pong nangyari? Nag-i-increase po ang bilirubin nung baby. Nagkakaroon po ng jaundice. Yes or no? Kakaroon po ng inyong jaundice. Alright? Sige po. Nurses, another question. Is baby or fetus number 1 question always safe? Yes or a no? Again, is fetus number 1 always safe? Yes or a no? The answer, very good. It's a no. Bakit po? Example is your amniocentesis. Guys, ano po ba ang amniocentesis? I-injectan mo tutusukin mo yung tiyan ni mother. Yes or no? Or any, very good ma'am, any invasive procedure. Bakit po? Amniocentesis or any invasive procedure that could cause accidental puncture of what? Of the baby, of the placenta, or the umbilical cord. Yes or no? Yes po. At pag nagkaroon guys ng accidental puncture of the baby, of the placenta, or the umbilical cord, that could cause now mixing of blood between the mother and the baby, causing now your RH incompatibility. Therefore guys, fetus number 1 is not always safe, especially if the mother will undergo an invasive procedure that could cause accidental puncturing of the baby, placenta, or umbilical cord that could cause mixing of the blood between the mother and the baby, causing your RH incompatibility. Yes or no? Yes po. Therefore guys, nurses, ano po ulit yung ating management dito? Management? Your ROGAM. Yes or no? Your RH, iso, immunoglobulin. Yes or no? Yes po. And guys, nurses, when are we now going to give ROGAM? Ano pong sagot ng ating mga top notchers? When are we going to give ROGAM? Okay guys, ganito ha. Very good. 72 hours after delivery, pwede po yan. Okay, after 72 hours. Sorry. First, we give 72 hours after delivery. Okay. Question guys, sapat na po ba yun? Na binigay mo siya? Hindi pa. What if magkaroon ng second baby? Kailangan ba agad-agad magpa-inject ulit? Yes or no? Yes po. Okay? As soon as there is pregnancy or every succeeding pregnancies. Yes or no? Every succeeding pregnancies. Okay? Or as soon as mabuntis ulit yung nanay, magpa-injection ulit ng ROGAM to decrease the potency or to decrease now. Anyway guys, your ROGAM, nurses, please take note. Number 1, it will weaken the existing antibodies. I repeat, the ROGAM will weaken the existing antibodies. And number 2, it could also prevent the development or the production of new antibodies. Maliwanag po. Again, your ROGAM, it can weaken the existing antibodies or it can prevent the production of new antibodies. Therefore, every time na mabuntis ulit yung nanay, third pregnancy, fourth pregnancy, magbigay-bigay po agad ng ROGAM. Yes or no? Yes po. And one more guys. We give ROGAM we give ROGAM after an invasive procedure. Yes or no? Again, that matures, we give ROGAM 72 hours after delivery, every succeeding pregnancies, and every after an invasive procedure. If the baby is RH positive or has antigen B. Maliwanag po tayo dyan. Okay? Sige po, copyhin mo, screenshot mo, ililipat ko in 5, 4, 3, 2, and 1. Alright, nurses, go. We also have nurses what we call as your Coombs test. Okay, ano po ba Sir Ken yung Coombs test namin? If you say top-notchers Coombs test, this is to check for the presence of your antibodies. We have your direct, we have your indirect. Okay, tanda mo lang guys, ang pinagkaiba lang nila, pag direct, gagamitin mo yung RBC. nung mismong nanay. Okay? Pero pag indirect nurses, usually, what are we going to use? That will now be the plasma or the fluid portion of the blood. Then, you are going to add your anti-human globulin. Then, you check for agglutination. Pag yan nagkaroon ng blood clotting, then that is positive for your antibodies. Maliwanag po. Yun lang namin yung pinagkaiba ni direct at ng indirect. Use the RBC. Indirect, use the antibodies. Okay? Use the antibodies. Use the plasma. Okay? Sige po. Nurses, copyhin mo. Copyhin mo, screenshot mo. Ililipat po natin in 5, 4, 3, 2, and 1. Guys, go. Now tell me, nurses. Okay? Coombs test is used to determine the presence of antibodies. Yes or no? Yes po. Nurses, ang sagot mo lang sa akin is yes or no. Are we going to give antibodies? Are we going to give ROGAM? Yes or no lang po tayo, ha? Okay. The mother is RH negative. The baby is RH negative. Are we going to give ROGAM? Yes or no? Very good. The answer is no. Do not give ROGAM. The mother is RH positive. The baby is RH positive. Are we going to give ROGAM? Again, the answer is no. Basta pareho si baby at si mother, huwag ka nang magbigay. There will be no production of your antibodies. Next. Very good, everyone. The mother is RH negative. The baby is RH positive. Are you going to give ROGAM? Of course, the answer is yes. Bakit po? Because the mother could produce antibodies against the baby who is RH positive. Yes or no? Yes po. Next question. Mother is RH negative. Father of the baby is RH positive. Give or do not give? Yes or no? Of course, the answer is yes. Bakit? Automatic dito, the baby could be an RH positive. Yes or no? Yes. Very good, everyone. Next po tayo. The mother is RH negative. Coombs negative. Ibig sabihin, walang antibodies si mother. And the baby is also RH negative. Are you going to give? Yes or no? Again, the answer is no. Hindi kailangan kasi both are negative. How about the next one? The mother is RH negative. Coombs positive. The baby is RH negative. Give or do not give? Yes or a no? Oops, the mother is negative. Baby is negative. Pero Coombs positive. The answer is no. Bakit po? The baby is RH negative. Yes or no? Yes po. Sir? Bakit may antibody si mother kung yung baby niya is RH positive? Nurses? If both parents, if both parents, for example, are RH positive, is there a possibility that the baby is still negative? Yes or no? Guys, the answer is yes. Kahit pa both parents are RH positive, there is still a chance that the baby is RH negative. Bakit po? For example, the mother, the mom. D. The father, D. Yes or no? Yes po. Okay? Ayan. Kung titignan mo dito, guys, for example, the affected is the D. Yes or no? Yes po. Okay. Ano mangyayari dyan, nurses? Okay, sige. Wait lang ha. Burahin ko para mas malinaw. Sorry. D. Okay. D. Guys. Nakuha? Sorry. Sorry, guys. Ayan, sige. Wait lang. Ano ba yan? Nakuha niyo yan? Sorry po. Ang kulit ko. Okay, sige. Burahin ko ha. Burahin ko po. Okay. Wait lang. Huwag na ito yung iba. For example, the mother. Mother is RH positive. Mother is RH positive. D. Also, the father is RH positive. Mali, wait lang. Mali yung aking kulay. D na lang. White yung dapat yung D. Hindi affected. Ha? Okay. Then father is also D and D. Okay? Ayan. So, pag naghalo yung genes, pwede maging D and D. Ayan, yung dalawa. Pwede rin namang maging D and D. Affected pa rin. Pwede rin namang D and D. At pwede rin namang yung dalawa, D and D. Therefore, not affected, 25% chance na RH negative yung anak nila. Even though the mother and the father are both RH positive, there is a chance that, or 25% chance that one of their children is RH negative. Yes or no? Yes po. In this case, guys, pwedeng yung antigen ni mother dito nanggaling dun sa first pregnancy. Yes or no? Yes po. But again, the second baby was RH negative. Yes or no? Yes po. Okay? How about the next one, nurses? The mother's RH negative, Coombs positive, the baby is RH positive. Give or do not give? Answer? Okay, of course, you are going to give. Bakit po? Because the baby is RH positive. Yes or no? Yes po. Maliwanag po tayo dyan. Okay? Alright. Sige guys, copyin mo na. Copyin mo na. Any questions, nurses? On when to give and not to give your rogam? Naintindihan po ba? Yes or no? I hope the answer will be yes. Okay? Sige. Copyin na. Ililipat ko na po in 5, 4, 3, 2, and 1. We're done with your RH ICE immunization. Okay. Go. Okay. Alin ang naiba? Ano pong sagot ng ating mga registered nurses? Alin ang naiba? Alin ang naiba? Alin ang naiba? Alin ang naiba? Very good. This is only the 30 guys. The only correct or the only incorrect? The only incorrect. Yes or no? Yes po. All other options are correct. Mali po. Decrease insulin on the first trimester of your pregnancy. Okay? Very good. Next po tayo moving forward. Alin ang naiba? Alin ang naiba? Answer? Guys, is this normal? Normal. Normal? Abnormal. It must be less than 6%. 169 after 2 hours. Abnormal. It must be less than 160. Weight gain of more than 1 pound per week on the second trimester. Abnormal. It must only be 1 pound. Therefore, answer, letter A, is the only normal. Yes or no? Yes po. Okay? Very good. Next. Alin ang naiba? Alin ang naiba? Alin ang naiba? Guys, normal. Intense pelvic pressure ups, bingo, preterm labor, abnormal. Yes or no? Yes. Very good, everyone. Go. Next po tayo. Alin ang naiba? Alin ang naiba? Alin ang naiba? Normal? Okay. Deep tendon reflex? Okay. 60 ml in 4 hours. Mali. Dapat 30 ml per hour. Ibig sabihin, dapat in 4 hours, meron yan kahit papano, nasa 369, 12, 120 ml. Yes or no? Ibig sabihin, kulang yung kanyang urine. Magnesium level of 5.9? Yes. The normal is 5 to 8 milligrams per deciliter for therapeutic level. Yes or no? Very good, everyone. C will be the correct answer. Okay? Very good, nurses. Moving forward, diretso po tayo. Go. Save all tissues fast. intravenous fluids as prescribed, vaginal examination, or provide emotional support? Answer? Very good. Vaginal examination. Yes or no? Yes po. Bakit? No to IE. Dapat may word na is speculum. All of these are correct. Okay, very good everyone. Di ba? Wala pang tanong. Alam mo yung sagot. Yes or no? Therefore, in the actual board exam, walang magbabasa ng tanong. Yes or no? Yes po. Doon ka agad sa options. Kumanta ka lang. Number 1, alin? Alin? Alin ang naiba? Gaganon ka lang doon. Charot lang. Hoy, bakla ka ng taon. In the board exam, you still have to read the question. Yes or no? Mamaya, after 1 hour, lumabas ka. Ang bilis mo naman, friend. Ay, ano naman, friend? I did not read the question. Only the options. Alin ang naiba. Yes or no? Yes, pumakla ka ng ton. Huwag mong gawin yon. Mamali ka sa board exam. Okay, A. Placing a client diagnosed with placenta previa in a left side lying position. 2. Cerclage in Trendelenburg position. C. A strict bed rest for abortion. D. Left side lying for fetal movement count. Correct answer? Very good. Correct? Correct? Correct. Mali. Remember? Only bed rest as prescribed. Yes or no? Yes po. Very good, top notchers. Moving forward, diretso po tayo. Nurses, tignan mo dito ha. GDM, low birth weight. PIH, macrosomia. Placenta previa, prematurity. RH, isoimmunization, low levels of bilirubin. Answer? Okay, very good. C. Bakit po C? The only correct or the only incorrect association? This is the only correct association. Bakit po? Pag GDM, dapat large for gestational age. Pag PIH, is small for gestational age. Pag RH isoimmunization, dapat high levels of your bilirubin. Yes or no? Yes. Very good, everyone. Moving forward, diretso po tayo next. Next. Mother is RH negative. Baby is RH positive. Give or do not give? Give. Ay, wag ko sinagot. Guys, ano sagot dyan? A, B, C, or D muna? Okay. Baby is RH positive. Mother is RH positive. Do not give. Mother is positive. Father is negative. Do not give. Why? The mother is already positive. Mother is RH negative. Coombs negative. Baby is negative. Okay. Do not give. The correct answer? A. It is when you only give your ROGAP. Yes or no? Yes. Okay. Very good, everyone. Sige. We're done with your complications of pregnancy. Now we go the last part, and that will be your abnormal labor. Guys, for abnormal labor, balikan mo lang yung ating table. Latent, active transition, 0 to 3, 4 to 7, 8 to 10, 20, 40, 60, 20 to 40, 40 to 60, 60 to 90, every 10, every 5, every 3. Guys, again, pag primipara, gano'n po kahaba? Gano'n kahaba? 14 hours. Pag multi, 8 hours. Therefore, pag ang primi, for example, ay in labor for 20 hours na, with dilation at 6 centimeter, normal or abnormal? Abnormal. That will be your abnormal labor. Pag alam mo yung normal, alam mo ang abnormal. Yes or no? Yes po. Tapos na tayo sa abnormal labor. Okay? Alright. Moving forward, lipat po natin. And let's go. Go. Now, induction of labor. Guys, we are going to induct labor. For example, nag-stop yung labor. Okay. Induction, guys, is we are going to artificially start the labor process. Augmentation, we are going to restart the labor process. Bakit? Tumigil yung pag-contract ng uterus. And what are we going to give? Your oxytocin. Yes or no? Yes po. And what will be Sir Ken? the effective labor pattern pag umabot na po ng every 5 minutes or equal to your active phase. Yes or no? Yes, then guys, what will now be the complication? Water intoxication. Yes or no? This is to simply contract the uterus. How about prostaglandin? Alam mo na yan. To soften or to dilate the cervix. Yes or no? So guys, these are the drugs used in the induction and augmentation of your labor oxytocin and your prostaglandin. Okay? Sige po. Copyin mo na guys. Copyin mo na. Screenshot mo. Screenshot mo. Ililipat po natin. Ililipat po natin in 5, 4, 3, 2, and 1. Okay na? Okay. Diretso po tayo. Moving forward. Let's go. Okay. Preterm rupture and premature rupture. Of course, biglang lalabas yung fluid. Yes or no? Yes po. Anong gagawin mo? Check the fluid for the pH. Yes or no? Yes po. Yellow, that will be urine. Pag blue, yung pH paper, that will now become your amniotic fluid. Yes or no? Yes po. So guys, if you are going to check the fluid after a premature or preterm rupture membrane, dapat kulay blue ang maging kulay ng amniotic fluid. Bakit? Because amniotic fluid is alkaline. Yes or no? Yes po. Pag yellow yan, baka yung babae na naihilang. Yes or no? Yes po. Okay? Sige po. Copyin mo guys. Copyin mo. Screenshot mo. Screenshot mo po. Ililipat po natin. Ililipat po natin in 5, 4, 3, 2, and 1. Don't forget ha, kulay blue pag amniotic fluid. Okay? Diretso tayo. Premature rupture of membrane. Nurses, tandaan mo dito. Ano ang unang gagawin mo pag nagkaroon ng premature rupture of membrane? Number 1 guys, ito po, ang unang gagawin mo ha, you have to reposition the woman first. Yes or no? Sorry, we have to, how do you call this one? Rule out cord prolapse. Again, first, i-check mo muna. Baka lumabas yung cord. Then number 2, check for the fetal heart rate. Maliwanag po. Again, that will be the proper sequence of your management. Rule out muna yung cord prolapse, then check for fetal heart rate. Bakit po, Sir Ken? Dahil pag nagkaroon ng cord prolapse yan, pwede yung magkaroon ng cord compression. At pag nagkaroon ng cord compression, magkakaroon ng variable deceleration. Yes or no? Babagsak yung heart rate ni baby. Before you check the heart rate, make sure na walang cord prolapse. Para sure ka na hindi naipit yung cord, normal yung heart rate na makuha mo. Yes or no? So again, first, rule out cord prolapse. After that one, check for the fetal heart rate to make sure that there is no cord prolapse, no cord compression, there is no variable deceleration. Yes or no? Yes po. Before engagement, bed rest prevent cord prolapse. Pag before labor, again, ang mahiwagang betamethasone to increase your fetal lung maturity. Pero pag active labor, advised to walk to further dilate the cervix. Okay? And complication is your Potter-like syndrome. Okay? Sige po guys. Copyin mo. Copyin mo po, screenshot mo. Screenshot mo. Ililipat po natin. Ililipat po natin in 5, 4, 3, 2, and 1. Guys, make sure that the cord is not compressed to make sure to have a normal fetal heart rate. Okay? Sige po. Okay na? Okay, one more time. Screenshot mo. Screenshot mo. Lipat ko in 5, 4, 3, 2, and 1. Okay? Go. Okay. Chorioamnionitis. Okay, guys. Lahat na po nandyan. I just would like to ask this one, guys. Pag may chorioamnionitis, ano po ang pulse rate ni mother? Tumataas or bumababa? Pag may infection, tachy or bradycardia? Tachy or bradycardia? Tachycardia. Yes or no? Guys, tandaan mo. Basta may infection, mga itis, whatever the type of infection, chorioamnionitis, vaginitis, cervicitis, salpingitis, endometritis, mastitis, lahat na po ng infection na itis, it will always be cardia. Bakit po, guys? In case of infection, the heart needs to pump faster to supply more blood on the site of your infection. Maliwanag. Ulitin ko ha. If there's infection, be it chorioamnionitis, mastitis, cervicitis, salpingitis, lahat na po. The heart will pump faster, tachycardia, to supply more blood to the site of your infection. Maliwanag po tayo dyan. Okay? Sige po. Copyin mo. Screenshot mo, ililipat ko po, ililipat ko in 5, 4, 3, 2, and 1. Anyway, almost everything is in the handout na po. Next po. Taran. Prolapse umbilical cord. Ayan na ngayon. Nag-prolapse umbilical cord ka na. Ano ngayon, Sir Ken, ang una naming gagawin? You answer. Bingo. Reposition the woman first. Then, check for the fetal heart rate. Sir, why are we going first to reposition? Again, to make sure na hindi naipit yung cord ni baby. Dahil pag naipit yung cord ni baby, talagang magkakaroon ng variable deceleration. Therefore, before checking the fetal heart rate, first reposition the woman to make sure na hindi naipit yung umbilical cord para normal yung kanyang heart rate. Yes or no? And what will be certain the position? Your knee chest position. Pag walang knee chest, exaggerated left sims position. Ito ngayon, ang inyong exaggerated left sims position. Bakit po, Sir Ken? Number 1, naka-left siya to prevent compression of the inferior vena cava. Number 2, naka-elevate po yung kanyang buttocks. Bakit po, Sir Ken, naka-elevate yung kanyang buttocks? Para yung ulo ng bata ay pumasok ng konti to relieve the compression of the cord para hindi maipit yung cord ni baby. Yes or no? Yes po. Okay? And what are we going to do, nurses? Pag may cord prolapse, tandaan niyo po to ha. Bingo. CSWW. Cover the cord with sterile gauze, wet with warm saline. Again, cover the cord with sterile gauze, wet with warm saline. Sir, kailangan po ba talaga na warm saline solution? The answer is yes. Bakit po warm, Sir Ken? To prevent vasoconstriction of the cord. At dahil nag-constrict ang cord mo, baka mag-decrease yung oxygen going to the baby. Yes or no? Yes po. Therefore, dapat warm saline solution. Maliwanag po to prevent constriction of the umbilical cord. Maliwanag po tayo dyan. Okay? Sige po. Copyhin mo, guys. Question. Pag may prolapse umbilical cord, can we push the head of the baby upward? Yes or no? Ano pong sagot ng mga top notchers? Guys, the answer is yes. We could push the head of the baby upward po. Parang ganito siya, guys. Itulak mo ng konti yung kanyang ulo. Bakit po, sir? Bakit po siya tutulak yung ulo namin? Ayan. Ito. Ayan. Itulak mo ng konti yung ulo na pataas to relieve the compression of the cord. Again, push the head upward. But guys, can we place the cord back into the uterus? Yes or no? Can we place the cord back? Okay, the answer is no. Very good. We could not place the cord back to the uterus, but we could push the baby upward to relieve compression of the cord. Maliwanag po tayo dyan. Okay? Very good. Moving forward, screenshot mo. Screenshot mo po. Ililipat po natin in 5, 4, 3, 2. Ay, nawala. And 1. Okay? So guys, eto ngayon ang inyong, ayan, different positions to manage your umbilical cord compression. In case of prolapse umbilical cord, yes or no? Yes po. Okay? Sige. Copyhin mo, nurses, copyhin mo, screenshot mo, lipat po natin in 5, 4, 3, 2, and 1. Okay? Sige. Next. Ano to? Uterine atomy. Alam mo na to, guys. Pag hindi nag-contract yung uterus, syempre, void, breastfeed, massage. Alam mo na yan. Okay? Sige, guys. It's all in the handouts po. Okay? Sige po. Burahin ko na. Lilipat ko po in 5, 4, 3, 2, and 1. Okay? Go. Next is your, ang tawag dito? hematoma. Guys, tandaan mo ha. In OB, pag sinabing hematoma, hindi lang yan basta-basta pasa. Di ba pag MS kasi pag hematoma parang nagkapasa, hematoma. Hindi po yan ganun. Tapos nag-OB. Pag OB guys, hematoma, it means there is a very, very big, large blood clot in the pec of the mother. Yes or no? Yes po. Bakit po sir nagkaroon ng big blood clot in the pec of the mother? Baka hindi maganda yung pagkakatahi or baka nagkaroon ng vaginal tear at hindi lumabas yung dugo ng maayos. Yes or no? That will not be your hematoma. It will cause a sensitive bulging mass in the perineum accompanied by severe pain and pressure and the inability to void. Okay, guys? Tanda mo lang dito. Here's a question. Pag hematoma, nagkaroon po ba ng bleeding? Yes or no? Yes po. Nagkaroon ng bleeding, hindi lang lumabas yung dugo. Yes or no? Yes po. So what could be another assessment? Put a big star. Pwede pong magkaroon dyan ng hypotachy-tachy or your shock. Yes or no? Bakit siya nagkaroon ng hypotachy-tachy? Dahil nagkaroon ng bleeding, hindi lang lumabas yung dugo. Nagkaroon ng yung blood, naging malaking blood clot. Yes or no? Yes po. Maliwanag po tayo. Nagkaroon ng bleeding. Management, ice packs, warm sitz bath. So same lang po. Pag ice pack, pag may severe pain. Warm sitz bath, just for comfort. Okay? Analgesic as prescribed. And of course, if there's a need, urinary catheterization. Yes or no? Yes po. Okay guys, sige po, copyhin mo. Screenshot mo. Ililipat ko na po. Ililipat po natin in 5, 4, 3, 2, and 1. Don't forget, hematoma, nagkaroon ng malaking blood clot sa pepe ni mother. Nagkaroon ng bleeding, kaya magkakaroon ng hypotachy-tachy. Yes or no? Yes po. Okay? Go. Malaking blood clot sa pepe ni mother. Endometritis, same lang din po. Again, tachycardia. Yes or no? Andiyan na po lahat. Ito lang po, guys. Endometritis. Pag endometritis, meron ka dito ngayong mga foul-smelling discharge. Question, guys. How are you going to position the woman with endometritis? Semi-Fowlers, Trendelenburg, left side lying position. Okay, very good everyone. The correct answer, Fowler's position po. Sir, bakit po Fowler's position? Na ganyan yung babae. Bakit po? To drain the uterus. Yes or no? Again, to drain the uterus to prevent accumulation of the abnormal discharge in the uterus causing another possible cause of infection. Yes or no? Yes po. Okay? Very good everyone. Sige po, copyhin mo, screenshot mo Fowler's for endometritis. Okay? To facilitate the discharge of the foul-smelling discharge. Okay na? Go. Moving forward. Lipat ko na in 5, 4, 3, 2, and 1. Okay? And anyway, everything is in the handout. Okay? Go. Mastitis. Ito naman mastitis. Same lang po. Yung interventions natin. Pag may pain, edi cold compress. Okay? Warm compress for comfort. Okay. Guys, what else? Warm compress before breastfeeding. Sir, bakit po? That is now to dilate the ducts. Yes or no? Yes po. How about ito guys? For example, sabi doon, the woman now is about, or the woman now has severe pain, and the woman is about to breastfeed. Guys, anong gagamitin mo? Cold compress or warm compress? May severe pain, pero gusto nang magpasuso. Warm compress or cold compress? Answer? Guys, the correct answer? Cold compress po tayo. Yes or no? Yes po. Bakit? To prevent the pain. Bakit po? Mahirap magpasuso kung sobrang kirot ng suso ng babae. Yes or no? Baka matrauma siya. Baka ayaw na magpasuso. Yes or no? Yes po. So again, cold compress. Okay. I read one comment po. Alternate cold and warm compress. Guys, that is also correct. Yes or no? If you want, alternate cold and warm compress, that could also be correct answer in the board exam. Yes or no? But both are correct. Okay? Question, guys, for example. The left breast and the right breast. Okay. The right breast, for example, is affected, inflamed. There is mastitis. Question, guys. If you are now going to breastfeed the baby, saan ka unang magpasuso? On the left breast or on the right breast? Very good. First, magpasuso ka sa left breast. Yes or no? Then, second, on the right breast. Yes or no? Unaffected breast po muna. Sir, why are we going to begin on the unaffected breast? Remember, guys, pag dalawa, for example, yung suso mo, at na-inflame yung right breast, mabigat yan. Yes or no? Yes po. Doon ka muna magpasuso sa left breast. Bakit po? Habang ikaw ngayon ay nagpapadede doon sa left breast, it will also stimulate now the ejection of milk in the right breast. Yes or no? Ibig sabihin, guys, while you are now breastfeeding on the left breast, nag-start na pong mag-decongest yung right breast. It will now start secreting kunti-kunting gatas para paglipat ng bata on the right breast, medyo mas magaan na yung kanyang right breast, mas less na yung sakit pag siya ay nagpasuso. Yes or no? Therefore, start on the unaffected breast first, because while breastfeeding on the unaffected breast, the affected breast now is being decongested, nagkakaroon po ng milk ejection, promoting comfort now on the right breast. Yes or no? Yes po, guys. Pag may mastitis po, ano po ang more encourage? More breastfeeding or less breastfeeding? Ano pong sagot ng ating mga top notchers? More or less breastfeeding? Very good. More breastfeeding. If needed, ang kailangan mo sa mastitis. Why? The answer is to decongest the breast. Magpasuso ka ng magpasuso pag may mastitis to decongest the breast para hindi kumirot ang suso mo pag napuno ng gatas. Yes or no? Yes po, guys. Can we encourage the use of your breast pump? Yes or no? The answer is, of course, the answer is yes. For example, pag busog na yung bata, huwag mong pilitin kumain yung bata. Baka naman yung bata, pinasuso ng pinasuso para hindi mawala yung sakit ng suso. Yes or no? Bakla ka ng taon. Pag busog na siya, you could use your breast pump. Yes or no? Yes po. Maliwanag pa tayo. Okay? Sige, copyin mo na, guys. Copyin mo po. Screenshot mo. Screenshot mo. Ililipat ko po. Ililipat po natin in 5, 4, 3, 2, and 1. Okay na? Okay. Lahat? Go. More breastfeeding pag mastitis. And of course, nurses, eto, postpartum blues and postpartum depression, guys. If you say postpartum blues, this is only for 1 week. And this is considered normal. Pero pag depression na po yan, that is already more than 1 week, and it is so considered abnormal. Yes or no? Maliwanag po. Again, postpartum blues are normal. Depression more than 1 week is already abnormal. And what are the possible factors? Number 1 is ang yung pagbaba ng inyong mga hormones like your estrogen. And contributing factors is your exhaustion, tension, abandonment. Manifestations are hesitance to care for the newborn, or parang ayaw niyang alagaan yung bata, or dugyot yung bata. Unkempt newborn, yes or no? These are all the manifestations. Ayaw hawakan yung sanggol, iyak ng iyak, ang dugyot-dugyot ng bata, yes or no? Postpartum blues or depression. And what will be the interventions, guys? For the intervention, sige, ilagay mo na dyan, diet, exercise, lahat na po. But if you say anticipatory guidance, nurses, this is now more on a health, ang tawag dito, education form. Yes or no? Yes po. Sir, ano po ba yung anticipatory guidance? Anticipatory. Before pa po, again, before pa manganak yung babae, sabihan mo na siya, ma'am, after mong manganak, normally, on the first week after mong manganak, baka makaramdam ka ng konting kalungkutan. Ang dahilan po niyan, ma'am, ay bumabagsak yung level ng estrogen mo. Kaya on the first few weeks or on the first week, Normal lang po na makaramdam ka ng konting kalungkutan. You may talk to us if you need someone to talk to. O, di ba, taray? Therapeutic communication, yes or no? Para alam ng babae na after delivery, for example, nalungkot siya, ay, sabi ni Sir Ken, yung kalungkutan ko, dahil lang daw bumagsak yung level ng estrogen ko. There is no need for me to worry. This is a part of the process. Yes or no? Para hindi siya ma-stress, para hindi niisipin na malungkot siya, at baka daw siyang malungkot. Yes or no? Yes po. Anticipatory guidance. Maliwanag po tayo dyan. Okay? Sige po. Copyhin mo. Copyhin mo. Screenshot mo. Ililipat ko in 5, 4, 3, 2, and 1. Again, ulitin ko. Postpartum blues normal, 1 week. Postpartum depression abnormal, more than 1 week na po yan. Okay? Sige po. Go. Nurses. Tanong. If a mother has H or hepatitis B, can the mother breastfeed? Yes or no? Very good. The answer is yes. Bakit? What are nurses? The vaccines given to the baby on the first 6 hours, that will be your BCG and Hepa B vaccine. Ibig sabihin, the baby will be protected. Yes or no? Yes po. Guys, question. Is Hepa B transmitted through the breast milk? Yes or no? No, not transmitted through breast milk. However, guys, is Hepa B transmitted through the blood? Yes or no? Yes po. It is only blood transmission. Ang concern natin dito, guys, is for example, pag nagsuso yung bata at nasugat, for example, yung suso ni mother at magdugo yung suso, diyan pwedeng magkaroon ng Hepa B yung bata. Kaya nga kailangan, on the first 6 hours, magbigay na po ng Hepa B vaccine to protect the baby from the hepatitis coming from the mother. Yes or no? Yes po. How about nurses, HIV? Can a mother with HIV breastfeed the baby? The correct answer, guys, is no. Bakit? Because HIV can be transmitted via the breast milk. Yes or no? Yes po. Nurses, question. If the mother is HIV positive, will the baby automatically be HIV positive as well? Yes or no? Pag ang nanay may HIV, will the baby also become HIV positive? The answer is no. Why? Bakit po? We have what we call as your zidovudine. Sir Ken, ano po ba yung aming zidovudine? This is now, it prevents HIV transmission from the mother to the fetus. That will now be your zidovudine. It prevents HIV transmission from the mother to the fetus. Ini-inject po yan during pregnancy para hindi mahawa yung baby. Yes or no? Yes po. But guys, is HIV transmitted to the breast milk? Yes or no? Yes po. Questioner says, if the mother has HIV, for example, or even Hepa B, what is more recommended? NSVD or CS po? NSVD or CS? Vaginal birth or cesarean section? Very good, guys. Recommended is cesarean section. Yes or no? Yes po. Sir, bakit po CS? Less blood contact. Yes or no? Yes po. Bakit, guys? Pag NSVD, dumudugo po ba yung puwet ni mother? Yes or no? Yes po. Pag yung puwet tuloy, dumudugo po ba yung vagina ni mother? Yes or no? Yes po. At pagdaan ni baby dun sa vagina, baka makuha niya yung infection. Yes or no? Yes po. Guys, pag CS, nagkakaroon ba ng bleeding? Meron naman syempre, pero it is not in contact with the baby. Yes or no? Bakit? Pag CS, hiwain mo, kunin mo yung bata. Prevent the baby from being in contact with the maternal blood during the cesarean section. Pero pag vaginal birth kasi, you cannot prevent the baby from having blood contact with the mother. Maliwanag pa tayo dyan. Okay? Sige po. Copyin mo, guys. Copyin mo, screenshot mo. Ililipat ko in 5, 4, 3, 2, and 1. Okay, one more time. Screenshot mo. Lipat ko in 5, 4, 3, 2, and 1. Okay? Nurses? Alin? Alin? Alin ang naiba? Alin? Alin? Alin ang naiba? Hindi ko na-discuss. Wait lang, okay? Guys, take note. Ano pong naiba dito? That will now be your metronidazole. Yes or no? Yes po. Guys, tandaan mo mga mycins and silins. These are all safe during pregnancy. Yes or no? Mga mycins, mga silins, cephalexin, those are all safe during pregnancy. Metronidazole is not safe during pregnancy. Yes or no? Yes po. Okay? This will be the unsafe. Alright, very good. Next po tayo. Moving forward, alin? Alin? Alin ang naiba? Alin? Alin? Alin ang naiba? Alin? Alin? Alin ang naiba? Guys, normal, abnormal? Abnormal. 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 Normal. Yes or no? Correct answer? Letter D. Yes or no? These are all signs of possible infection. Yes or no? Yes po. Your choreo, amnionitis. Yes or no? Yes po. Sir Ken, di ba ang normal WBC is 5 to 10,000? Bakla ka ng taon. Remember no sabi ko guys, in pregnancy, normal lang po ba na tumaas ang WBC? Yes or no? Yes po. To prevent your infection. Yes or no? Yes po. Maliwanag po tayo dyan. Alright? Very good everyone. Moving forward. Lipat ko in 5, 4, 3, 2, and 1. Okay? Go. Alin? Alin? Alin ang naiba? Alin? Alin? Alin ang naiba? Mastitis, breastfeed every 6 hours. Prolapse cord, Trendelenburg. Endometritis, Fowler's position. HB or H. hepatitis discouraged to breastfeed. Answer? Okay, guys. Mastitis. Every 6 hours. Wrong. Remember, kailangan more frequent breastfeeding. Yes or no? Yes po. Not every 6 hours. Prolapse cord, Trendelenburg. Wrong. It must be your modified Sims position. Yes or no? Yes po. Endometritis Fowler's. Correct? Correct. Discourage breastfeeding. No. Hepa B could still breastfeed. Very good, everyone. C will be the correct answer. Yes or no? Yes po. Okay, the only correct among the options. Okay, very good. Next, moving forward, alin. Alin. Alin ang naiba? Alin. Alin. Alin ang naiba? Monitor the FHR. Cover sterile gauze, warm saline. Place the client in upright position. Push the head of the baby upward. Very good. Correct answer is letter C. Yes or no? Yes po. These are all correct management for prolapse umbilical cord except semi-upright position. Okay? Very good, everyone. Moving forward. Guys, nakita mo? Walang tanong, pero may possible sagot. Yes or no? Ibig sabihin, nurses, alam mo yung concept. Yes or no? Yes po. Maliwanag po tayo dyan. Guys, nurses, did you learn something po for the first 2 days of your review with Top Rank Review Academy? Yes or no? I hope the answer will be yes po. Okay, guys? We'll see each other pa sa intensive review hanggang sa final coaching. Yes or no? Yes po. Unti-untiin lang po natin, dahan-dahan lang po hanggang sa ma-master mo lahat ng concepts. Yes or no? Yes po. Okay? How about this one, nurses? Soft baggy uterus 4 hours after delivery. Sensitive bulging mass in the perineal area on the 3rd day postpartum. Inability to void 18 hours after anesthesia. The client easily cries on the 2nd day postpartum. Guys, why letter D? The only normal or the only abnormal? This is the only normal. Bakit po? Postpartum depression. Cries easily. Yes or no? Yes po. All others are already abnormal. Yes or no? Yes po. Okay? Very good, everyone. Moving forward. Taran! Thank you. And that will now end up, nurtures, our lecture in obstetric nursing. Guys, tanong ko lang po again. Pag merong rupture of membranes, anong unahin mo? Rule out cord prolapse, or check the fetal heart rate? Anong unahin mo? Very good. Rule out muna to make sure na hindi naibit yung cord. Paano ngayon? Pag nagkaroon na ng cord prolapse, are you going to check the FHR or first reposition the woman? Pag nagkaroon na po ng cord prolapse, reposition muna to make sure na hindi naibit yung cord para hindi bumagsak yung heart rate ng bata. Yes or no? Yes po. Okay? Very good, everyone. So nurses, are you ready for the post-test? Yes or no? I know you are ready. Yes or no? Yes po. Okay? Sige po. Top-notchers, please have the post-test for 20 minutes. Okay? Then after 20 minutes, I'll be coming back. Then we'll have the ratio only for 10 minutes. Anyway, we are just done with the lecture. Okay? Sige po, guys. The exam is posted na po. I'll be back exactly after 20 minutes. Then we'll have the answer of the post-test po. Good luck, everyone. Please read the questions carefully. To those of you na aalis na po, maraming salamat. I'll see you all soon during the intensive review. Okay? Bye-bye, everyone. Thank you po. Okay? Sige, go. Okay, guys, are you done, nurses? Are you done with the post-test? Everyone, are you done? Or meron pang sumasagot? Okay na lahat? Okay, let's start. Nurses, anyway, quick rush lang po. Anyway, we're just done with the lecture. Okay? Sige, go. Guys, number one, ano sagot ninyo? Sabi niyo dito? I planned for this one, pero ngayon parang hindi pa ako handa. Is that normal? Yes or no? Yes po. You are feeling ambivalent, which is normal during the first trimester of your pregnancy. Yes or no? Yes po. Very good, everyone. Number two. A 9-week preemie client now asks you, is it possible for me to listen to my baby's fetal heartbeat? Guys, 9 months na po. 9 weeks. Possible? Yes, by using your Doppler. Yes or no? Yes po. D will be the correct answer. Okay? Very good. Number 3. 24-year-old, 18 week. Sabi niya, bakit yung bata hindi pa gumagalaw? Yung kapitbahay namin, gumagalaw na. Marites na nga, buntis pa. Yes or no? Therefore, what will be the correct answer? Very good. Normally, for a preemie client like you, the first movement will be on the 20th week of your pregnancy. Okay, very good, everyone. So guys, nakita mo, kahit gaano pa kahaba yung tanong, kung alam mo yung normal tsaka abnormal, hindi ka mawawala. Yes or no? Yes po. Correct. Number 4. Bakit daw, or ano daw ang common adaptation during your pregnancy? Hypoventilation, increased pH, decreased J motility, or decreased glomerular filtration rate? Okay, very good, everyone. C will be the correct answer. It must be hyper, it must be decreased, it must be increased GFR. C will be the only correct common adaptation during your pregnancy. Okay, very good. Let's have question number 5. Ay, tate. All but one are principles in identifying parity. Guys, all but one means is lahat maliban sa isa. Yes or no? All but one, lahat maliban sa isa. Ano pong sagot ng ating mga registered nurses? Very good. Count the number of fetus delivered before 20 weeks. That is wrong. That is your abortion. Yes or no? Yes po. Okay? Number 6. May 5, 2021. Ano pong sagot ninyo dito? What will be her expected delivery? Very good. May 5 ended May 5. So May 5 for 4 days. May 5 for 3, 2. That will be May 2. Yes or no? Yes po. Okay? So, minus 3 plus 7, that will be February 9. Yes or no? B will be the correct answer. Okay? Very good, everyone. Number 7. Late 20s and the firm uterus in line with the umbilicus. Okay. 20th week of your pregnancy. Very good, everyone. Number 8. Ano ba yung haba? Okay. Sige. Meron daw siyang pregnancy, contractions last 35 seconds. Sabi po dyan, ibig sabihin, nagkaroon ng abortion. Yes or no? Kasi wala ng fetal heart rate. So meron na pong isang abortion. Eliminate mo na po yung walang abortion. Okay. Both are G3. Tama. Hanap mo lang yung term. Ano po yung term? 33 weeks na SGA at twins na 37 weeks. Very good. G3, T3, P0, A1, L3. D will be the correct answer. Okay? Very good. Number 9, moving forward. Okay. Include all but one of the following. Again, lahat maliban sa isa ay tama. Ano po sagot natin? NPO, correct? Monitor blood loss, correct? Drink plenty of fluids. Mali. Remember, kailangan naka-NPO immediately after possible miscarriage. Correct. Correct answer, letter C. Yes or no? Yes po. Okay. Ensure adequate hydration but only by using IV fluids, NPO. No to oral fluid intake. All right. Number 10. Detection of ectopic pregnancy is paramount in life-threatening. Guys, what will now be a symptom of your possibility of your ruptured ectopic pregnancy? Very good. A, unilateral lower abdominal tenderness, and a positive pregnancy test. Okay? Very good. Number 11. The characteristic manifestation of gestational trophoblastic disease is, ano pong sagot ng ating mga registered nurses? Okay, the answer, it is now The uterus grows rapidly because it is an abnormal growth. All right. Number 12. Which of the following discharge instructions must be given to a woman who has just undergone suction curettage for gestational trophoblastic disease? What will be the answer of our top notchers? Very good. No to pregnancy for 1 year. D will be our correct answer. Okay, number 13. The insulin dosage all throughout your pregnancy is? Ano pong sagot ng ating mga top notchers? Very good. It is decrease during the first trimester, increase on the second and third trimester. D will be the correct answer. Okay, very good. Number 14. Magnesium sulfate daw. Ano daw ang normal na urine output? Correct answer? Very good. Correct, correct, correct. Answer, bingo. Asan na? 1, 2, and 3. Yes or no? Yes po. D will be the correct answer for your magnesium sulfate. Right? Next question. Guys. The fetal heart sounds are normal pero may bleeding. Okay. Internal examination. That's wrong. Notify the heart rate of 130. That's wrong. That is normal. No need to notify the physician. Ambulate, ay bleeding na po. Placenta previa. Hindi pa rin maglakad din. Lalong dudugin yung babae. Correct answer? Very good. Do perineal pad count. Okay. Very good everyone to those who got the correct answer. Okay. Number 16. Mabagal daw po yung labor. There is hypotonic uterine dysfunction. Therefore, what are we going to give? Of course, it will be your oxytocin. Okay? Number 17. The nurse now is developing a plan of care for a client in her 34th week of gestation who is experiencing premature labor. What non-pharmacologic intervention should the plan include to halt your premature labor? Ano pong sagot ng ating mga registered nurses in this one? Very good. You are going to provide adequate hydration. Yes or no? Yes. Okay. C will be the correct answer for number 17. Maintain adequate hydration, sir. Why do we have to maintain again adequate hydration? Remember guys, pag dehydrated ka, dehydration will stimulate the posterior. Again, dehydration will stimulate the posterior pituitary gland to produce nurses your anti-diuretic hormone that is now to retain your water. Yes or no? Yes po. Ang problema nurses, ang posterior pituitary gland mo is also the one producing now your oxytocin. Yes or no? Yes po. Therefore, pag dehydrated ka, it will not only stimulate the PPG to produce your ADH but also your oxytocin that could lead now to your preterm labor. Therefore, pag may preterm labor, you need to ensure adequate hydration to prevent further stimulating the posterior pituitary gland. Maliwanag po tayo dyan. Okay? Sige po. Moving forward, ililipat ko po in 5, 4, 3, 2, and 1. Okay? Go. Number 18. A client at 28 weeks gestation now is complaining of contractions. Ano pong binibigyan natin to enhance or to promote your fetal lung maturity? Okay, very good. That will now be your letter D. Yes or no? Yes. Okay. Number 19. Moving forward. The nurse would best position a pregnant woman with collapsed umbilical cord to, ano pong sagot natin dito? Very good. Exaggerated left seems lateral position. Alright, number 20. The heart rate decreases on the onset of contraction. How are we going to reposition the woman? Answer? Very good. We are going to position the woman in continue monitoring the patient. Yes or no? Yes po. Okay, early decelerations po. Okay, number 21. Okay, client in labor, meron daw umbilical cord compression. Nurses, what will again cause the umbilical cord compression? Ano pong sagot ng ating mga top notchers? Very good. That will now be letter D. Yes or no? Yes po. Variable decelerations. Okay, number 22. A nurse in the labor room is caring now for an inactive phase of labor. The nurse is assessing the fetal patterns and notes a late deceleration on the monitor strip. The most appropriate nursing action is to, ano pong sagot ng ating mga registered nurses for this one? Late deceleration. Very good. Stop, reposition, oxygenate, and notify the physician. Very good. And number 23, ang GDM daw niya is 6%. Okay. Anong ibig sabihin po? Pag ang GDM mo ay 6%, it only means that the sugar control is adequate. Yes or no? Yes po. Very good. Number 24. A nurse is assessing of the fundus in a postpartum woman and notes that the uterus is soft and spongy and not firmly contracted. Guys, not firmly contracted. Ano daw po ang gagawin natin? Will you massage? Yes. Urinate? Yes. Check for the bladder? Yes. Don't give uretodrine. Bakit po, sir? Ano po ba ang gamit ng uretodrine? It will relax the uterus further. Yes or no? Yes po. Maliwanag po tayo dyan. Alright? Sige. And, ano ba yan? Number 25, moving forward, ililipat ko na last question, top notchers. Ano meron dito? The fetal heart rate is 80 beats per minute. Therefore, ano ang gagawin ng mga bakla? Okay, notify the physician. It's less than 120. Alright? Very good, everyone. Sige po, top notchers of Top Rank Review Academy. Please key in your scores. Key in your scores. Number 23, ma'am. Hindi po. 6% is okay po. Wala pong problema. Pag 6% po, yung ating GDA levels po. It's still that is considered normal po. Okay? It must be 6% or less po. Actually, in some books po kasi it's actually less than 8%. Okay? In some books. But we just used less than 6%. The lower, the better. Okay? Sige po. Everyone. Sige po. Please scan your scores, guys. Ano pong score natin? Okay, we have 24. Very good, ma'am. We have 23, 21. Wow, perfect score. Miss Garcia from Tarlac State University. Okay, 22, 20, 17, 19. Very good. 17, 17, 16, 23, 16. Okay, very good, everyone. I guess most of you naman got a good score in the examination. 24. Very good, ma'am. We got a perfect score from section 1. Okay, so nurses, I will now be formally ending our refresher course in obstetric nursing. Thank you very much, guys, for staying with me until 6 o'clock. And I'll see you all soon on our intensive lecture po. Guys, anyway, for the lecture ng intensive ng OB, I guess it will be handled na po by Ma'am Heidi. Okay, but for intensive, I will be handling your psychiatric nursing po. So pagbalik ko, I'll be discussing your psychiatric nursing na po. Okay? Alright, guys. Thank you, everyone. God bless you all. Enjoy the weekend with your family and with your friends. God bless you. Take care. I'll see you on our intensive review in psychiatric nursing. Thank you, everyone. God bless. Patulog na po. Ay, hindi. Friday ngayon. Lumabas. Mag-enjoy. Enjoy your life. Yes or no? Yes po. Bye-bye. Thank you. Mwah, 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 mwah. Okay? Sige go. Sige po. Alright.